Medical professionals of Reddit, what is the nastiest case you've encountered? Moving an elderly diabetic patient from the stretcher to the bed. Her rotten pinky toe came off during the transfer. She didn't notice. Guy shot himself in the head with a .22. I started doing CPR and his brains kept flowing out of his mouth. Thankfully my acting chief told me I could stop. Source: I'm a firefighter. Holy crap. Guy had laid on his couch for so long that his skin had grown into the fabric. Ems had to cut the entryway of the house off to get the couch out with him in it. They then had to get a U-Haul van to put him in and bring him to the hospital. When he had gotten to the ambulance bay, I was part of the team to get him off the couch and onto a bed. The smell. I will never forget that smell. Just think about how long it would take for your skin to grow into a couch. He had not moved off that couch in months. For anything. His mom was feeding him and he was defecating etc directly into the couch. We finally decided the only way to get him on the bed was to just tip the couch over. Myself and a few nurses were trying to stabilize his necrotic legs. When we started to flip the bed, his left leg completely detached from the knee down. The nurse next to me vomited and I managed to hold the leg in place until we set him down. It was only attached to his knee by the skin and muscles. The bone had snapped just from gravity. All the skin on the back of his legs and back peeled off and stayed on the couch. The smell and watching that leg spin 360 degrees will never leave me. TL. Dr. Guy laid on couch for months and died. Source: MS4. Dated a doctor for 5 years. He was Israeli but worked in a hospital in Palestinian territory right after med school. There was one patient who he noticed on his first day. He was a very old man who'd been there for months. He was in a coma and had an infection that had eaten through one side of his face, exposing his teeth and jaw. Apparently his mouth was always open and he always sounded like he was gasping for air. My BF said he seriously considered just giving the old man a huge dose of something because it was inhumane to keep him alive in that condition. The laws in Israel about euthanasia are very strict and you have to take every measure to keep people alive. But the real reason he didn't do it is because he never got a minute alone with the guy. Realistically, it's good that he didn't, because a coroner with half a brain could have spotted an overdose in an otherwise stable patient and your doctor friend's career would have been over, not to mention possible jail. Paramedic picked up a lady wearing a muumuu to move her to a stair chair. She apparently wasn't wearing underwear and as soon as she was upright she took at least a 3-pound crap all over my boots and legs. Got my partner good too. I managed to only dry heave while carrying her outside where I vomited all over her lawn and in the back of the ambulance for the rest of the drive. Also firefighter. The worst was showing up to a new family's house because the new parents were not paying attention to their 18-month-old's location. Found her that day face down in a kiddie pool you can buy from the dollar store. No amount of medical intervention can prevent that. Jesus. I just flashed back to when we moved into our house and my husband and I both thought the other was watching our 18-month-old son. We started looking for him everywhere. I finally ran out front and saw him standing in the middle of the street about 5 houses down. I must have run that distance in 3 seconds. Scared the crap out of me. I can't imagine how awful that must have been for them. I used to be a radiotherapist. My first job was in a very hot, and in some places lacking in amenities, country. We were told a patient would be coming in, and that we would need to button up our white coats and wear masks not commonly needed. I suppose I should have put the pieces together. In our lovely, shiny, new hospital, an old man with a bandaged foot and lower leg had been causing people to move away because of a rank smell. What did I care? I thought, it's probably just bad BO. Besides, I'm mostly anosmic. He comes in. We lie him down on the bed, face down. I'm a bit confused, as I raise the bed a bit to make moving him and messing with dressings easier. As there has been no treatment plan sent in with him, word was that the oncologist was going to do a visual setup, rather than spending time on the simulator machine. I can still see this now. The nurse starts to unwind the bandage from his calf. I can see others are enjoying the smell of unwashed dude, but I'm sweet. We get down to the nitty gritty. The bandage comes off and we're left looking at his foot with just the dressing pad over it. It looked weird. It was red, but looked spongy. I could see it moving, as if Time slows as the nurse gets hold of the dressing pad and pulls gently. The pad unsticks from the just above the inside point of his heel. His heel gently peels off with it. I know for a fact that everyone in the room would have started looking at each other wide-eyed if the maggots hadn't started dripping out from where the back of his foot had been. They went everywhere. Perfect silence, beyond a voice, possibly mine, saying that getting the doctor would be a good idea. The old dude didn't feel a thing. His foot had been dressed on a Friday, and the flies had got to what was already necrotic before his Monday appointment. He ended up having a below knee amputation. The other one is about malignant melanoma. Let me know if you want to hear about it. I'd love to hear your tales war stories. Feel free to share. This comes to mind because it was so recent. Elderly demented patient had a rectal tube in place due to C. diff and to prevent further skin breakdown. It was near 2200 and I was doing rounds when I began smelling it. If you have ever smelled C. diff, it is something you will not forget. As I look into the room, this patient is saturated in blood and feces. I have seen my fair amount of blood, but never this amount. The amount to where you walk into the room and immediately begin tasting iron. Come to find out, she had forcefully removed her rectal tube and her platelet count was low to begin with, thus causing massive hemorrhaging upon removal. This was one of the only times I have questioned my occupation. On trauma service during med school, a 22-year-old was brought in with a 7-inch serrated hunting knife through the eye into his brain. CT of his head looked awful. It was hard to recognize normal brain tissue. Posted this in another thread before. Weekend afternoon, one of the first nice days of spring. Slow day in the air for the most part, when in comes a distressed younger couple with their infant baby. Mom is hysterical, and dad is barely keeping it together. Dad gets it out that baby is bleeding from his mouth. I'm skeptical, because the baby looks quite happy, but I do see a slight reddish pink tinge inside his mouth. I take the child and put him down on the exam table, all bright lights and tongue depressors to get a good look in the baby's mouth. Sure enough, evidence of blood, but again, no baby distress. Oh wait, there's something near the back of her mouth. Kind of a darkish red color. A blood clot maybe? Not sure. Have a co-worker firmly immobilize the head, and with hemostats, go in and pluck out the object. Amazingly, it comes out in one piece, and looks like a plump, slightly larger sized raisin. I can't figure out what it is, but it's definitely not a clot. Into the specimen bag goes the squishy thing. No distress for the baby, vitals normal, breathing easily, happy demeanor, good color, etc. Time to get more of a history from mom and dad. First day outside with new baby and their dog, enjoying the weather. Baby's on a blanket, giggling as the dog runs around him. Wait a sec, did you say a dog? Lem take a closer look at the thing in the specimen bag. Sure enough, suspicions confirmed. It's a tick. Deflated to be sure, but a tick that recently had a large meal of the red stuff. Baby must have pulled it off the dog, and then done what babies do by putting it in his mouth. TLDR. Infant pulled a tick off of family dog and chewed it. This is probably the nicest, happiest, most benign story in this thread. It's a breath of fresh air in the middle of a field full of horror. I got to do a week of OR observations as part of my training in sterile processing. I got to see some cool stuff, like joint replacement, brain surgery, including an exploding subdural hematoma hit shot CSF clear across the room, and robotic surgery. But I also saw gin. One case was a vaginal hysterectomy, hard to watch, but enlightening. The next, another vag hysto case, haunted my nightmares for a while. 57-year-old postmenopausal morbidly obese woman. To do a vaginal hysterectomy, they open the vagina up, grab the cervix with a tool called a tenaculum, which looks like a pair of giant earwig pincers, and basically pull the cervix out. Upon pulling it out, it dumped out a foul-smelling, chunky substance which resembled tuna helper. Even the seasoned nurses looked away in horror. To this day, 8 years later, I can't eat tuna noodle casserole without shuddering a bit. The fact that you can still eat tuna anything astonishes me. Cardiac sonographer here. I was called to the Estat, The patient had a kitchen knife sticking out of his chest. It took less than a minute to confirm that yes, his heart was punctured and bleeding into the pericardium, which is the sac that surrounds the heart. He was already in tamponade, which means the heart is drowning in fluid. I've never seen anyone whisked off to war so fast. He survived. Definitely read your username as Stabadaba. I thought that was very appropriate for the story, until I read it again properly. The amount of sexually and physically abused children is astounding. You encounter these kids daily and may never realize it. Kids who try to kill themselves because of bullying. So many stories and each one is horrible no matter the circumstances. Yet, just last week I went to a code where a poor 9-month-old had a cracked skull with internal bleeding and bruising around his neck. That one really got to me. Used to volunteer in an emergency room. This one guy had both his feet severely infected with fungus. While I was wrapping them with a bar and the pus was spilling everywhere. Mine isn't nearly as disturbing as the two top posts, but when I was a CNA working nights at the hospital, we got a call from the saying they were bringing up an admit, but we never got an answer as to why the patient was being admitted. When the transporters showed up with the patient, his legs were wrapped in the wet umbrella bags, obviously. Plastic bags for you to place your wet umbrella when going in somewhere from outside. And when we asked why the patient had these bags taped to his legs, the transporters told us that they were holding in the smell. Of course, we still aren't sure why he has these bags, but we are slowly but surely getting somewhere. When evaluating the patient, we, my charge nurse, the patient's nurse, and myself, took the bags off and the smell was like nothing I can describe. Come to find out, the patient lived alone by himself and rarely showered. He had developed gangrene on his feet, and it was so bad that his skin was literally falling off of the bone. The smell was rotting flesh. He went in for immediate double amputation the next morning. And by next morning, I mean, he was brought to the floor at 4 AM, and was down and all by 8 AM. A customer of mine, who works as a nurse at a correctional facility, told me about a woman that was reaching up inside of vagina, pulling out flesh and eating it. She said that the head of security at the time couldn't stop throwing up and had to leave. They had to call in a backup captain to take care of the situation. Had a patient come in labor, could smell her BV, bacterial vaginosis, infection from the door. As labor progressed, there were white chunks of nasty literally falling out of her. We obviously already had a bed saved for the baby in the NICU. Showtime finally came, and to this day I don't know how the doctor didn't throw up with his hair down there. Anyway, baby came out, obviously sick. We washed that kid 3 times, and he still smelled awful. I walked into NICU later that day and gagged on the smell. How you can have an infection like that and not get it treated I will never know. How you can have an infection like that and not get it treated I will never know. Probably an American. Probably no health insurance. Psychiatrist here. I don't frick around with eating disorders for a second. When I suspect eating disorder, I get a full set of labs to make sure they are safe and have a low threshold to referring to specialty clinics. I've seen some severely malnourished people. I mean, think Holocaust survivor. But what makes it tricky is patients with eating disorders who either are in denial about their eating disorder or flat out don't want it treated. Sometimes there can be a delusional feel to the disorder where they are convinced that either nothing is wrong or if they realize they're underweight they blame it on medical problems or pain rather than admit to an eating disorder. TL. DR. Lady lost bottle top up her vagina for months causing persistent infections and a massive outflow of dried period blood, bacteria, and pus when removed, sufficient to gag everyone present. Describe it with far too vivid imagery to rake in thousands of internet points. EMT, bedridden 98-year-old lady with Kennedy ulcers to the bone, nasty infection. When we came in she was laying on her side and the cat was licking her ulcer. This one just happened 2 days ago. Lucky I wasn't around when this happened. Little old man has dementia. Little old man has C. diff. He is a brand new admit to the facility due to the last facility discharging him due to behaviors. None of this was reported to facility. He approached me while I was on shift with agitated discussions over car keys and getting out of this place. Nursing home. I realized he was probably more confused than our average patient, but census is low and they don't have an Alzheimer's unit available. I redirect him and see my patients and go home. I look for him next day for therapy evals. He's not there. I approach my other patients and quickly hear the story. He began by screaming for help at 10 at night. They helped him use his private bathroom, C. diff isolation precautions. He is still very awake and agitated. He yells and screams for a bit, then they put him in his wheelchair to let him stay mobile. Big mistake. He begins his reign of terror by going to both shower rooms and crapping in each, effectively shutting them down until decontamination. With those two down, he begins sneaking into residents' bathrooms and defecating everywhere, into their toilets, closets, one poor lady's trash can next to her bed. But he's not done. CAN staff haven't realized the chaos of this determined individual because he transfers himself out of his chair and back to bed. He then grabs a hold of the urinary catheter with both hands. He rips it out like a lawnmower starting, blood and crap covered. He begins to realize that wasn't meant to be removed that way. He screams for help. Staff arrives to chaos on the hall. They have to call the ambulance. The EMS team quickly refuses the patient when they see him covered with highly infectious waste. He is then life flighted out of facility due to pain and bleeding. I know this is sick and likely a coping mechanism, but as a doctor, reading this story right now makes me literally LOL. In my first year of medical school, I wandered down to the ER one Saturday night. In gangland, apparently it's a common initiation to be made to shoot a homeless man. This poor old homeless guy who'd been wheeling around in a wheelchair with a hip to foot cast on was shot in the head with a flare gun that had been loaded with a shot shell. Avulsed most of his left face, but the eyeball was spared and the skull wasn't violated. Just a lot of bloody shreds hanging off. During the exam it was evident, though, that there was gangrenous skin around the top and bottom of the leg cast, so the trauma surgeon called for shears. He cut the cast open but it did not come away easily, so he called for help. And a few others grabbed the cut edge with gloved hands and on his order, pulled the cast apart. Most of his leg came away with the cast. The reeking stench of gas gangrene struck me like a hammer and produced instant, reflexive, vomiting. I had time to turn my head and hit the lid of a hazardous waste can. Two other people also reflexively puked, one landing her greenish chunks right into the just opened cast. Inside the cast, I recall seeing muscle, ligaments, most of the femur including the cartilage covered part that articulates with the knee, and maggots. There was little blood, probably because the leg was gangrenous and dead. The homeless man screamed as the cast came off, but the screams grew feeble rather quickly. I think he was dying. I noped out of there right away, although we didn't have that phrase back then. I left the ER, walked to the parking lot, drove to my girlfriend's house, got in bed with her and cried for about an hour. The next morning I woke up and decided that I was going to have to alter my ways of perceiving and thinking if I was going to do this. Over the next couple months I sought out medical horrors, no shortage of them in this giant inner city public hospital, and systematically desensitized myself to them. Nothing troubles me along those lines now, and I have never seen anything anywhere near as awful. Showed up on a lady who had been sitting on the street. She had shot going down both legs with larvae living in open wounds. The smell still haunts me. As only a student in the medical field, I have seen a lot of stuff. For me the most disgusting to be around is C. diff, crap everywhere. And that distinct C. diff smell that permeates the hallways. Not a doctor, but my dad is an anesthesiologist. Had 2 separate occasions of heads who got loaded and ate all their fingers off. I've been hospitalized quite a few times now. I just want to say the crap that nurses and doctors go through on a daily basis is freaking mind-blowing. Nurses deserve like 5 times what they're currently paid. And docs, well, just keep doing what you're doing. Anytime I've been an inpatient there has been non-stop crapping on the floor, screaming, crying, other bodily fluids everywhere, people dying, violent senile old people literally covered in crap running around. I almost had a nervous breakdown last time I was in there. As a 30-year-old male, I'm not ashamed to say that after 2 weeks in hospital, I cried myself to sleep while basically hiding under the covers because of the traumatizing mayhem happening all around me. If you know a nurse, give them a hug, and maybe some money. Hey man, hospitals can be scary places, especially when you're alone. No shame in tears. Hope you're doing better. This is from medical school years ago. A woman sat her 3-year-old girl in a pot of water up to the nipple line and boiled her. I saw the kid a few months after. She was completely scarred up. The burn had caused liver damage and she needed a liver transplant. I still don't really know the mechanism of this. They had a foster mother lined up for her, and she was looking forward to adopting her. Unfortunately, I think I remember later being told that the child died. It was the most senseless, horrific thing I've ever seen. I worked with a similar child. As a baby toddler, one of his parents had put him in a bath of scalding water. This kid had the most horrific burns all over his body, and had difficulty walking because of it. It was heartbreaking. I think the single nastiest thing I have encountered in my career is the smell of extensive, malignant cancer. During my end surgery rotation during medical school, I had a patient with uncontrolled squamous cell carcinoma on his left jaw that had progressed to the point that there was a huge crater of cancer and necrotic tissue. A fellow med student saw him first and after interviewing him, came out to present his case to the attending. He was clearly shocked, and when it came time to present his plan, he pretty much just said, "It's really bad." So we head toward the exam room, and as we turn down the hall where the room is, the smell first hits me. It was hard to describe exactly how bad this smell was, but imagine a combination of a dead animal that had been rotting for several weeks, combined with a bag of hot garbage. We opened the door and are hit with the smell full force, enough to the point I had to actively stop myself from gagging. The patient's mandible and oral cavity were clearly visible through the crater, and there were numerous metastases spread throughout his neck and upper chest. The outer ring of the crater was very raised and angry looking, clearly an aggressive cancer, and the inner area was a combination of black dead tissue and pus. I was amazed that my attending was able to handle the situation professionally, although all we could offer him was a referral to hospice care and pain medications to manage the severe pain. We were working in a state where physician-assisted suicide is not yet legal. Regardless, the combination smell of dead tissue with actively growing cancer was something I will never forget. Source: physician. On my uncle's first day working in accident and emergency, someone handed him a motorbike helmet of a guy who had been in a bad accident. The entire head was still inside the helmet. He quit on the spot and became a concert pianist instead. Not a doctor, but my friend GF, who is one, once started a convo saying, "I saw the biggest penis today." One of her patients had a massive swollen dong because he was a truck driver with diabetes. Holding his pee and led to bacteria going crazy over all the sugar in his pee. This a side effect of the new diabetes drug Invokana. Not the swollen dong, but frequent infections from the sugar in the urine. Double-edged sword it is. A friend of mine recently posted this on another forum. So who here has ever smelled two gangrenous legs that have gotten that way because someone decided to spend 25 years crapping and pee themselves and not changing their trousers? He's fully able. Just had a nervous breakdown and started crapping himself. And it goes into the wounds. The floors are hardened into his skin and the trousers. Can't force him to go to the hospital though, because he's fully aware of what he's doing and the consequences. That's like the worst case of passive lengthy suicide I've ever heard of. Jesus. I am not a medical professional, but the nastiest I heard from a doctor friend is a catastrophic combination of issues that I don't pretend to understand in the colon and intestines, which resulted in the patient vomiting her own crap. I never believed it, but I'm not a doctor, so what do I know? Not me, but my grandmother, who's a doctor. She told me someone once came in with a beetle up their nose and left it up there a week before coming to her. She told me once she got it out, tons of snot and blood came pouring out. Worked in dietary at a nursing home. I had to deliver to a room that had the note skin tear risk. When the nurse went to lift the woman, she shifted slightly and an inch of skin literally just split. Neither medical professional or a case I encountered, but my mate's mum is a nurse and she regaled us with a lovely story of a man coming into A&E with an IKEA pencil shoved up his dong. My dad is a doctor. During his residency, a patient came in complaining of a bad odor coming from her lady region. She had her first period a few months prior. Turned out she thought tampons were dissolvable. I work in surgery. One day I go to pick up a patient from pre-op for a craniotomy. This is no big deal. We do this surgery all the time. Only with this patient, I can smell something bad before I even pull back the curtain. This is never a good sign. I go in, and his head is all wrapped up in gauze, from the top of his head to about midway down his face. One of his eyes is uncovered. He's fully responsive and oriented, so I ask him the normal questions and we get rolling back to the room. During intubation I get the background on what happened to this guy. Apparently he had skin cancer that he never got treated, and it began to eat inward. It comes to time for me to prep the site, and I unwrap his face, and literally half of his face is eating away. His left eye and the surrounding bone is completely gone, and the eyebrow has fallen into the area where his eye used to be. The skin in the forehead area is gone, and so is the skull under it. I can literally see into the brain, where infection has set up, and I'm watching pus drain out with every heartbeat. Every time I go to prep it, my sponge comes back covered in pus and grey matter. We eventually ended up setting him up with a plate to cover the part of the skull that is missing, and I think went with a skin graft to cover the forehead area. TLDR. Guy doesn't get face cancer treated, it eats away his eye and into his brain. Wear sunscreen, people. As a medical student I got to scrub into a case of severe Fernie's gangrene. This is a severe infection that affects the scrotum and surrounding soft tissues. It often spread quickly and can become life-threatening. At first it did not seem too bad. In the grand scheme of things, it looked we would just be removing the skin around the scrotum only. What we discovered was that it was far more extensive than expected. We would have to remove the skin and soft tissue from the just below the belly button to the midway down the thighs, the perineum, and most of the buttocks. The skin around the penis was removed as well, and the testicles just dangled from their cords, like one of those Office kinetic motion toys, but with 2 balls instead of 5. I am now imagining a quiet hospital room at night. In the room, a single patient dozes, the entire midsection of his body swathed in bandages. Intravenous antibiotics and other fluids drip slowly into him. There is little noise from outside or adjacent rooms. Upon entering the room, one hears only click 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 click. I work in the laboratory as a lab scientist. I had to cut into a swollen, infected gangrenous scrotum. The squishy sound it made, the juice that came out, never eating anything crunchy and juicy at the same time. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now. Serious redditors who have been clinically dead and then revived/resuscitated. What did dying feel like? How it changed your life? Did you see anything while passed on? When I was really young, I went to a church party at a pastor's house, went off the diving board to look cool in front of big kids. While I couldn't swim, immediately sank. I kept breathing in water every time I surfaced. Then I remember feeling really tired and really calm. I looked towards the surface and saw it get further and further away. Everything grew dark, weird to say, but it was blissful. I felt nothing, then remember hacking my lungs out and nothing in between. Kids saw me and rushed over. I don't remember being pulled out or the mouth to mouth. All I remember is coughing violently. When I was 9, I had appendicitis, but every doctor I saw told my parents it was just the flu. After about 10 hours in the ER, one doctor, thankfully, had a feeling it was something more and came into my room and pressed his fingers into my side. Within about 2 minutes of that, my appendix burst and I just remember slipping into blackness. Not sure if I was ever declared clinically dead. I remember slipping in and out of consciousness as they wheeled me into surgery. I remember my surgeon hovering over me before they knocked me out, and that's about it. I was a brat as a kid, but after that I became a lot nicer. After having to spend I think 8 days in the hospital recovering, my classmates and friends and people from my team sports came to visit. I burst into tears every time I woke up to someone in my room, because it made me realize people actually loved/cared about me. The scar on my stomach is a daily reminder of that, and I love it. That's beautiful. I'm happy you had so many people to visit. Hospital can be lonely and depressing. Anything that connects you to the outside world is a godsend. God, I don't even know how to answer it. There was this time when I tried to kill myself. A perfect deep cut on my arm. I thought, well, I did it. It's the end. And after what seemed like an eternity, my body finally collapsed. I'm not quite sure about what happened while there I was out. I do remember having a dream though. It wasn't anything mystical or any shit. Just me in an empty place, and remember that in this dream I met myself. Like, literally myself. My child self held my hand and we talked for a lot of time. We played a little, explored the place, talked about stuff, and it went like that for days. Like, there was actually day and night on my dream. Finally, I wake up. I lost a lot of blood, but not enough to kill me, because my sister found me that day. Mom said the doctors thought I was already dead and even considered brain death. I spent almost a week in a coma, and the only thing that kept them from giving up on me was because, after some days, I started talking in my sleep, so they noticed my brain was still answering. I'm not totally sure of what happened or how I survived. I was 15 years old at the time. The scar is almost gone by now, and that was my last attempt. Next year I met the most amazing person on the world and we are planning our house together. AWW. Happy endings. Good read, thank you. I died on the operating table. I was awake. Emergency C-section. An artery was severed. I bled out. I knew instinctively I was dying. I heard myself flatline. There was this strange sensation like a suction pulling me out of myself. I saw my body, lifeless, masked doctors and nurses rushing about, and then there was darkness. I was aware that I was no longer an individual, but part of something so much bigger. There was no fear or pain. I was at peace. I knew as if being told, but not in words. Almost a collective knowledge that I had a choice to remain in that peace or to go back into my body. As soon as I thought of my children, I was pushed violently back into my body. It seemed smaller than before. All the fear and pain rushed back. I'm very different, I have lost foreign language. I can only speak English now. Before I died I spoke German, Latin, and French in addition to my native tongue. I had a photographic memory, also lost. I also spent over a year in physical therapy. My body and brain have never fully recovered. It's been over 2 decades since my experience. For a long time I thought my condition was punishment for rejecting heaven. I have suffered chronic illness, autoimmune disorder, crushing depression. But I'm still here. There is more to this existence than I can understand. Love with your soul. In the grand scheme of things, love is the only thing that matters. Love is stronger than death. Love is the reason I came back. I'm kinder now, more patient. What I lost was so little compared to what I have gained. It took death to teach me how to live. That collective knowledge. I felt that. Like you have all the answers to every question you could ever ask. Just know where go to ask them, ha ha ha. I had a cardiac arrest during a surgery once. My heart stopped for roughly a minute. The doctors did chest compressions and were able to revive me. I had been put under. So you would think that I wouldn't remember anything. But when I woke up, I felt like I had been asleep, instead of just falling under the anesthesia and immediately waking up. The day that I got sober was the day I almost died. I have been an addict since I was 12, yes, it's possible, and that day was only a few months ago. I had received a dodgy dose from a new dealer, and it was laced with something, and I ended up having a severe OD. I was lucky in the fact that I'm still alive, and without any noticeable brain damage. I was revived with medications and machines, and I don't really remember much from that day, because I was really messed up. But it was scary. For me, everything felt like it was in slow motion. And there are a lot of gaps in the days and weeks following that incident, as I was in a program for recovery. But something good came from that day. I got clean. And I got sober. That really put into perspective that I'm not indestructible. I'm not immune to death. And drugs are no longer have their same appeal that they used to have. I'm off the streets. I'm living in a house with 3 other people. I have genuine relationships. I'm in a different city where I have 0 connections with my old contacts. I have a great support system. I'm working on getting a job. I successfully completed a 6-week program for substance abuse issues. And I'm happy. I hope this makes sense. Long story here, so saddle up. It was 2000. I was a 10-year-old boy in transit with my family to live on a military base in Baumholder, Germany. We left from Texas, so we had a grueling itinerary of buses and planes to make our journey. After about 20 or so hours in motion, I start to feel feverish. We are just ending what was a 6-hour bus ride into base to be temporarily placed in barracks housing. When it was time for me to get up and walk down the aisle of the bus, I could not use my left leg very well at all. Upon meeting the obstacle of the stairs, I fell from the top onto the concrete. The MPs had a brief look at me and wrote my pain off as a sprain. My family and I went on our way. Next 2 days a fever like I've never injured since ensued. My stepdad, who was in the army, was a harder and didn't think I needed medical attention. My mother had to convince him on the 3rd day that we needed to do something. I hadn't eaten in days and was not keeping fluids down very well. The hospital on site was not exactly a place for diagnostic medicine, and after seeing me suggested we go to Landstuhl Hospital. We were waiting on our clothes and car to be shipped from the States, so we had no mode of transport. My parents bought a VW Golf hatchback that was the grossest brown color I have ever seen. I remember hastily being thrown into the back, shivering in a blanket. I watched the road through a hole in the floor while coming in and out of consciousness. I don't remember being admitted to the hospital. The doctors ending up finding that my femur had been pushed out of socket by a MRI infection. Immediately I was put under to relieve pressure and scrape out the infected tissue. After my first surgery, I was feeling weak but drugged up enough to not really care. It was the best I had felt in days. Well, here is where everything took a turn. They gave me penicillin. I was not confirmed to have an allergy, but my mother was. About 5 minutes after they gave me the 4th, I was very warm, feeling sleepy. All I remember was falling asleep. I had 3 seizures and had to be revived twice. I'm not sure how much time elapsed between the anaphylaxis/cardiac arrest and me waking up, but I remember it just as that. Just waking up. I saw no lights, no beings, no other side. I didn't have any sort of otherworldly experience. I just woke up. My whole family was there crying and laughing. My first words uttered were, "I'm hungry." I had to have 2 more surgeries to clean and scrape the infection out over the course of 3 weeks. I was kept in the hospital because they were worried what the penicillin may have done to my heart/brain. I had to have injections at home 3 times daily for 6 months through a port that was connected to my heart directly. I'm 30 now, and looking back on it, I now know the experience shaped me immensely. I take nothing for granted. I may not have seen a ghost of my past or had my life flash before my eyes, but I certainly was awakened that day to be a better me. Also, my hip still hurts every day. When I was 7, I choked on a hot dog at a backyard BBQ because I was quietly sitting by myself in a corner, reading. Nobody noticed me until I was already on the ground and blue. My uncle pretty much shoved his whole hand down my throat to get the food out, then did mouth to mouth and CPR for 2 minutes until I was conscious. I slipped in and out of consciousness for the whole ambulance ride to the hospital, and I remember feeling like the oxygen mask was choking me and fighting the EMTs who strapped me to the board. I spent the night in the hospital with a concussion. My grandmother fainted and hit her head when she thought I was gone, and they let us stay in a room together. She taught me how to play gin that night. Anyway, my strongest memory is feeling the world slip away from me. I was frozen. I knew that I was going to die, and I was too scared to move. My whole family was on the other side of the yard, and it felt like I was being pulled away from them into nothingness. I don't remember any bright lights or anything like that. What I remember most is a sudden burst of noise. It was total silence, and then sudden screaming and crying. I think that was the scariest thing of all. To wake up to the sound of both my parents and even my super stoic grandfather just wailing. I was very religious as a kid, and I think it pushed me over into a zealotry that lasted pretty much until puberty, when I decided that I liked boys more than Jesus. I was afraid that if I so much as told a fib, I would die and not get to spend eternity in paradise with my family. We were Jehovah's Witnesses, and I was all up in everyone else's business too, because I wanted to be sure we were all free of sin, so we could be together if one of us suddenly dropped dead, or if Armageddon came. I'm atheist now, so obviously it didn't stick, but I was an insufferable Bible basher for my entire childhood. Basically, as a direct result of a stupid piece of hot dog. Wow, I just read an AMR about a person who was a JW. I had a bleed after surgery before discharge that landed me a few floors down in ICU. When I came around, I remember vomiting pure blood with bubbles, getting all weak in my limbs, like you're drunk. The feeling of, well, not peace but like finality. It's different from it hurts, I think I'm gonna die. It's like it feels like dying. It's like when you're dog tired and you're struggling to stay awake and slowly succumbing. Minus the sleepy feeling. Just everything. Every act seems like too much work. I was out for about 45 minutes, according to friends, but felt like it was just seconds. I was submerged in water. I could see and talk while in the water, like the ocean. And I saw shadows of people on the other side. Similar when there is a wave in the ocean then you submerge. Seemed like that was the only thing that separated me from them. Like a curtain of water inside the ocean. I couldn't really see them, but they seemed like friends. And I was told to go back. Then I woke up. It made me appreciate life more. I was very reckless. I was hospitalized due to advanced stages of Wilson's disease. Originally told my symptoms were a viral infection. About a week after my initial doctor visit, my ex took me to the ED because I looked off jaundice. Does that to you? Collapsed in trach because my liver had completely failed and my kidneys were right behind it. I remember getting into the ED saying hi to the person at the desk and everything going completely black, but all the pain, nausea, everything was just gone. Like it was nothing. Like falling asleep on your couch for a nap. I woke up what seemed like a short time later. Turned out it was actually a month and a half of 2 major surgeries and 4 heart restarts later. It was like no time had passed. Like I was out then I was awake. It was peacefully terrifying hearing about it later, to be honest. Like peaceful because it didn't hurt per se, and terrifying because there was nothing. Overdosed on heroin and Valium when I was about 19. Don't remember anything except blackness. Last thing I remember is sticking a needle in my arm. Then nothing. No near-death experience. No lights or tunnels. Just black. It's weird to think how fast your life can just be over in literally the blink of an eye. Thankfully I have 7 years off that shit now. I'm so thankful I had people around me that were willing to call for help. Narcan wasn't ubiquitous then, like it is now. I had a friend from high school that overdosed and died because the girl he was with was afraid she'd get arrested if she called for help. I'm so lucky I got a second chance, and I'm definitely not taking it for granted. Now I'm in medical school and planning to go into addiction medicine. Hopefully I can help others like me. Congratulations on sobriety. Woohoo. Thank you. It's a beautiful thing. Heart attack 10 years ago. Had to be shocked back to life twice. I only remember the second time. Or rather, feeling like someone dropped a safe on me. Did not see anybody, but I think I did see them working on me. I say think, because I remember it being fuzzy, as if I wasn't wearing glasses. Which, of course, I wasn't. I got pretty depressed. Initially, nothing says you are old, and I was only in my mid-40s. Like a heart attack did get me to reorder my life a bit. Strangest part, though, my wife had gone with some girlfriends to a fortune teller about a year before, and they had said I would have something very serious happen medically that month, but I would survive. I woke up during surgery once and drowned in my own blood. I was clinically dead for about 3 minutes. I didn't see/hear anything. When I woke up I was totally unaware that anything had happened. To me everything had gone as planned, and I had just woke up as planned. If it wasn't for the extra nurses/doctors around me I'd have never known anything had gone wrong. This is why I don't believe in heaven or hell. When we die, we simply cease to be. That's scary to think about. I think the vast majority of humanity would agree with you, and it's why so many choose to believe in heaven or some form of afterlife. I fell asleep watching a movie and my husband, then boyfriend, dozed off. Then woke up and realized I wasn't breathing. Flipped on the lights and I was totally blue. No pulse. I felt nothing. I just woke up to paramedics all over and around me. But I had no vision and I was very confused. I could recite my social security number, but not the days of the week. And I knew something was wrong with me, but I couldn't fully comprehend. After a crapload of testing and a week-long hospital stay, I had no answers as to why it happened. It happened again 9 months later. We were watching TV, and I dozed off on the couch. Then woke up on the floor to paramedics trying to revive me. Both times, the part where I had no pulse and wasn't breathing felt like absolutely nothing. The aftermath was confusing, painful, and nauseating. It never happened again. And it's been 9 years since then. I hope they know what happened to you, so you can treat it. I hope you stay healthy. Unfortunately I never got conclusive answers. They were sure enough it was my heart, that they did an angiogram, but it didn't produce results. I had a heart monitor surgically implanted, but after 8 years of no results, the battery died and I had it removed. I'm happy and healthy now, and I've had 2 kids with no complications. So I just have to thank my lucky stars and move on. Slowly losing consciousness was terrifying, but it was followed by the most profound sense of peace I have ever experienced. Then bam, came to right in the middle of puking up blood. I wasn't clinically dead, but I had been knocked unconscious in a car accident, and no doubt I was in shock. I was 8 when this happened. My mother was driving, and she did not survive. I was in the I guess, waiting for the doctor to come back and sew up the gash in my leg. At first I was hysterical with fear, and then I just faded out. I didn't fight. It didn't hurt. Then I was in the upper corner of the room, looking down on my body. I had no emotional attachment to it. It seemed like an object with no more significance than the furniture. But there was a sort of woman by the bed. She was blurred and transparent. She looked, my 8-year-old self thought, like a genie. She looked at me and smiled that part one could see clearly, and then she vanished. She didn't move or leave. She just wasn't there anymore. I wish I could say it was my mom, but I don't know. It was definitely female though. I don't remember how I got back into my body. My memories of the rest, if the day, are very disjointed. But on the whole it's made me less afraid to die. Went into atrial fibrillation 2.5 years ago and dropped dead in front of my wife. She called 911 and performed CPR until the police arrived with a defibrillator and got my heart started. I was rushed to the hospital and was in an induced coma for 3 days. I was brought out of it on Thanksgiving of 2017. I don't remember anything about dying and did not see anything. The doctors were worried about possible brain damage due to lack of oxygen until my heart was started again, but I didn't have any permanent effects, although I do jokingly tell my wife it is the brain damage every time I do something that pisses her off. She doesn't like my humor. The weird part is that it has not changed my life significantly at all, and sometimes it feels like people are disappointed in me because of that. I had rehab for about 3 months and was cleared to return to work and drive, and life has gone back to normal. I still love my wife and kids, and I'm still the same douchebag I was before it all happened. I would rate the whole experience a 2/10. Not recommended. I died when I was 15 years old. I went into cardiac arrest and was clinically dead for 15 minutes. Ventricular arrhythmia for no reason while in the car with my family. I just celebrated 6 years of being resuscitated 2 weeks ago. There was nothing after I died, unfortunately. When people ask, I don't normally relay this info, but the best way I can describe it is that dying will feel exactly like how you felt before you were born. Our last minute here is a last minute ever. So be kind to those around you and tell your loved ones how much you love them when you're given the opportunity to. Dying feels like nothing. You won't even realize you've died. It's changed my life immensely. My death is very much part of who I am and a major factor for how I treat other people and the limited tolerance of mistreatment I have from other people. Serious redditors who have been clinically dead and then revived/resuscitated. What did dying feel like? Medical professionals of Reddit. What is the Doctors of Reddit, what are some of your worst experiences with anti-vaxxers? Not a doctor, but I work for a vaccine manufacturer, and my title is raw material engineer, aka I work with vaccine ingredients for a living. When an AVER asks me, on social media or in public, if I know what's in a vaccine, I basically cackle and crack my knuckles. They also don't seem to have an answer for why I give my children the same vaccines if Big Pharma is trying to poison people. People keep asking to do an AMA and I think that's a great idea. I'll make sure I do it very soon, but I want to wait for a time when I have enough time to dedicate to Reddit. And for those asking what's in them, that's a more complicated question. Depending on which vaccine, both the type and the brand, there are upwards of 100 different components that go in from start to finish. I am Big Pharma. I'm not a doctor, but I have a story that I'm pretty sure that fits here. We had neighbors that have become lifelong family friends. They have a daughter the same age as my sister, and she got diagnosed with autism shortly after getting her MMR. A couple months after her diagnosis, the paper came out saying vaccines caused autism, and the mom believed it. It was new information. No one really was sure what to believe. Anyway, fast forward 4 years and the mom is pregnant again. She and OZ'd getting her new baby vaccinated with the MMR. She did, because, in her words, I'd rather have another autistic child than one in the IQ. The new baby is completely typical and she now doesn't believe in the anti-vax crap. My point is, at even the height of the autism being caused by vaccine scare, she was smart enough to get her kids vaccinated. And I will never understand why people don't protect their kids as well as herd immunity. Finally, Summit 5 thing I can get behind. I'm so sick of hearing about parents who would rather have a dead child than one with autism, if the myth were true to begin with. Currently in my first trimester and this baby is getting every freaking vaccine they'll give it. I ended up with scarlet fever as a kid because people are so obtuse. Just breaks my heart. Pediatrician here. As a medical student, I watched her baby die from rotavirus BC. Mom thought vaccines cause Alzheimer's, not autism, Alzheimer's. And she didn't think he needed to go to the hospital when he hadn't kept down a feeding for 12 hours because sometimes kids just do that. My current winner is a mom who refuses vaccines for her kids because they cause autoimmune disorders. Her 2 sisters have chronic Lyme and her brother has scoliosis, all due to those nasty vaccines. Oh, and her grandpa and dad both died from heart attacks because they had had the flu vaccine the previous season. All these autoimmune disorders in one family. I just don't know what to do. She likes to bring me articles from Mercular and Health Nut News to prove her point. Yep, vaccines cause Lyme disease now, not ticks. Vaccines. Had a patient come to the hospital for possible heart attack. I asked if they had gotten a flu shot or the pneumonia vaccine. They went into a long rant about how vaccines are poison and they don't take any medication because they swim in the ocean and it purifies all the toxins that they acquire. Then they started having chest pain, so I gave them a nitroglycerine pill. They spat it out because they hated it. Well, you don't take your meds for high blood pressure and high cholesterol, you will have a heart attack. So not just anti-vax, but fully anti-medicine and science. Yes, the pneumonia vaccine is a thing. Technically called the pneumococcal vaccines, which protects from the bacteria Streptococcus pneumoniae. Their use can prevent some cases of pneumonia, meningitis, and sepsis. The hospital asks everyone over 65 if they have had one. Also, this person did leave AMA the next morning. And yes, nitroglycerine is an explosive, but smaller and less concentrated is a vasodilator that helps with chest pain related to heart blockages. Did you ask them why did they even bother coming to the hospital? They could have just gone to the ocean and swam until their heart attack went away. Veterinarian here. Had a client years ago who bred Salukis, and who fed raw, refused most medication cause chemicals bad, and didn't believe in vaccination. One of her dogs was exposed to parvo, and she brought it back to the kennel. She tried to treat it homeopathically herself at first, so by the time we saw it, the dog was already pretty far gone. Then the next day she brought in another sick dog, then another the next day, 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 then another the next day. All in all, After 6k in bills, 12 beautiful dogs died of a disease she could have prevented for $120. Also a veterinarian got verbally abused the other day for recommending that a puppy be vaccinated because veterinarians are dirty pieces of crap who just lie to make money. Client was asked to never come back immediately. After I sent out invites to my kid's birthday party, I found out one of her friends from dance was unvaccinated. My daughter's best friend is in remission from leukemia and is immunocompromised. An unvaxxed kid could kill her. I uninvited the dance kid and very nicely explained the situation. Her mother loses her crap and tries to get us kicked out of the dance school they attend. The dance school owner is an older lady and had no idea there were idiots these days that didn't vax, so she implemented a new rule that students had to be up to date and the unvaxxed kid had to find a new dance school. I felt bad for the kid, but her mother is a sociopath. Herd immunity saves lives when it comes to kids fighting cancer. This is the thing about anti-vaxxers that really drives me nuts. I feel terrible for their kids getting put at risk, but it's even worse than that. They are putting at risk anyone who is immune compromised, elderly, sick, pregnant people, newborn babies. It's selfish and irresponsible. Had a kid on a ventilator with a preventable illness at a major research hospital in California. The mom was anti-vaccine. The kid began to deteriorate and the mom spent a lot of time reaching out to her anti-vax community. One visited her in the hospital and said, "Honey, there was nothing you could do. I lost it at that point." By lost it I mean that I had to physically leave the unit before saying or doing something unprofessional. I didn't say anything to the mom at the time. The kid recovered. Before they left, the ICU had a long talk with the mom about vaccines and she agreed to do more research. God, I hope that woman and those like her come to their senses. Nothing you could do, except vaccinate your child, which would have completely prevented it. Well, we do have a measles epidemic around here every few years or so. Children die. It's getting worse. But I do believe the worst was my mother, pediatrician, coming home worried one day because Child Protective Services are looking into her. Why? She diagnosed an unvaccinated child with pertussis, turned pale, told the mother she is to immediately to go on infectious ward, called it in, like you do with most of these disease, just procedure, and then, the mother was never registered at a hospital. She just sank back into a minority part of town. I don't think my mother has still seen those patients again. It's likely the child survived or there would have been some sort of murmur, but yeah. Student nurse here. The most heartbreaking case I ever saw was a 2 or 3 year old who was facing all 4 limb amputations because he had meningitis and it entered his bloodstream, all because mom didn't vaccinate him. His limbs were completely necrotic. He couldn't eat, had an NG tube, and stopped speaking. You could tell he felt lonely and scared as heck. He got no visitors that I saw, even though he had 8 siblings, and couldn't play with the other kids on the unit because he didn't know how to play without his hands. Crushed my heart. Anyone commenting that the meningitis vaccine isn't given until you're 11 plus, routine vaccination helps prevent it as well. The Hib and MMR vaccines both offer some protection from meningitis, as well as not living with 8 other unvaccinated children. I work in a NICU and occasionally float out to the term nursery. Our neonatologists also work as pediatricians in the hospital and see the well newborns on top of the NICU kids. The neonatologist went to see a mom who was refusing the initial vaccines. When the doc told the mom the vaccines were recommended by the AAP and asked for reasons of refusal, the mom laughed and told her to do your research. Do you research? She told this to her doctor, who is both a neonatologist and pediatrician, double board certified. She also is our medical director, has a PhD in biochemical engineering, and is a mother herself. My eyes nearly rolled out of my head. It's amazing that these people seem to think that because they read it online they somehow know more than doctors or nurses who have devoted their lives to medicine. It's just mind-boggling. Obligatory, not a doctor, but my dad is an anti-vaxxer. I'm 18. He always tries to convince me not to get vaccines. When I was a kid my mom would have to take me in secret. My dad doesn't know I've gotten vaccines. It's always a secret. Wish I could convince him otherwise, but he doesn't trust any official research. To anyone who cares and to address some questions. 1. Yes, my parents are still together. My mom wants to divorce him though, but she doesn't make much money and he does. 2. He wasn't always like this. He became a weird conspiracy theorist after 9/11, a year after I was born. 3. I have no siblings. 4. I appreciate all the love for my mom, she is the best. All of my friends call her mom and she's a tough 5 feet tall cookie. 5. My dad isn't a terrible abusive guy. He's coming from a good place. He just lost his way at some point and won't come back down. Just took a wrong turn, and I'm trying to get him to rethink some stuff. 6. I'm an adult and he knows I've gotten vaccines because last time I got them I was very adamant about how they are helpful and not a government conspiracy. Good for you that your mother is sensible in this matter, and I hope she is just as protecting are your siblings, if you have any. Don't waste energy on converting your father if he isn't open for it. It warms my heart a little to know that this anti-vaxxer, your father, didn't get to harm any children. Not a doctor but a medic. Had a kid fall down onto hot radiator heater at home. 2nd to 3rd degree burns all over his back. Kid is screaming in agony, but I managed to place the line in and sedate him. We are off to the burn center. PD escort in place and I start asking mom about medical history, vaccinations, etc, etc. She says that they don't do vaccines because that would kill the baby. So we get to the burn center and I'm getting one-on-one with a doc and give him history and whatever else he needs. He lost his crap when he heard that kid hasn't been vaccinated. He said that the mother successfully just gave her son every contagious disease in that place. You can't just not tell us what the mom said. Kid comes in after a fall and gets scraped by some rusty nails. Surprisingly is okay after the fall. We want to give the tetanus vaccine since that's common to do after high risk exposure to make sure she doesn't get it. Learn she's never been vaccinated. Mom refuses. Call CPS but mom is connected to some big shot gov official. Kid goes home without vaccine. 3 weeks later, kid comes back in with tetanus, unable to breathe. Suffers irreversible brain damage. Now she is wheelchair bound and needs to be fed through a tube. This was not in the US. I'd imagine CPS in the US wouldn't care if you were connected to some higher level government official and would have let us vaccinated. Bet the mom still be not my fault. I work as a consultant in a palliative care practice. We help families navigate complex and often difficult decisions in acute illness. My worst anti-vaxxer experience was in the critical care unit. Woman in her early 60s and otherwise healthy. She got the flu from grandchild. Not vaccinated, neither was anyone in the family. Faith is strong. She was on a ventilator for hours. Respiratory failure. Then the vent was not enough and she was placed on ECMO. Heart-lung bypass. Her kidneys shut down and continuous dialysis was started. She developed a GI bleed from the acute distress. Eventually got off ECMO but needed permanent ventilation. Visitors could not comprehend that this was the flu. Her father became an ICU patient after a week of declining to wear a mask. Not sure if his exposure was extended family or the patient. His sister, PT aunt, also got admitted but stayed out of the ICU. They were 2 of 6 patients in the ICU because of the flu. As I met with extended family and discussed permanent ventilation, feeding tube, long-term dialysis, vent facility placement, lack of consciousness, they kept asking how could we have prevented this. One adamant Google Doc daughter kept spouting debunked autism claims relating to vaccination. I finally looked at her and said, your mother is not dying from autism. Dad was old and went into heart failure and died 2 days later. Patient struggled for a month before becoming septic and dying in full life support. Aunt survived as far as I know. Not sure if that meeting was a come to Jesus moment for the family. Yikes, 80,000 dead last year from the flu and now a chickenpox outbreak in NC. Darwin has an evidence-based practice from the grave. I'm a doctor but don't work in the NICU. Hubby does. Every time there's a crying mom behind the NICU doors who fell for the vaccines and vitamin K shots or evil crap on social media before giving birth and her newborn gets the intracerebral hemorrhage, bleeding inside the brain, that vitamin K prevents. He says it's just heartbreaking because it's something so horrible that could potentially be avoided with one little sting. Once the parents actually realize what they've done, or rather not done, it's just such a heartbreaking picture to look at. On the one hand you kinda want to think that hey you actually believe that these loons on your baby group or whatever FB quackery group that brainwashed you know more than doctors and scientists purely based on bad googling and inability to Differentiate between a decent research and just crap they put online and call evidence. On the other hand, you have this deep sense of sadness for the family and what they're now going through. Especially the baby, since none of it is the baby's fault or decided by the baby. Hubby says the image of these crying moms is something you never want to see and can never forget. I have one about homeopathy. Wife and I had a baby a month ago. We had a doula that was anti-vaxxer essential oil person. When they removed my wife's placenta, she began to hemorrhage. Instantly they bring a bag of pitocin and hook it up to her. I look over and the doula has angry eyes and is poking me to tell them to stop putting those chemicals in my wife. Frick that. I tell the doctor she does whatever she can to save her. Eventually they call in a surgeon and they take emergency measures to stop the hemorrhaging. She ended up losing 3 liters of blood, but the amazing professionals were able to save her. After, the doula told me the reason my wife hemorrhaged was because she couldn't rub some bullcrap essential oil on her legs. What a freaking idiot. Pediatric nurse here. This patient left a mark on me. 18-month-old, admitted to a community hospital's pediatric unit. Respiratory symptoms. I notice right away this kid is working hard to breath. She starts getting worse. I'm starting to worry. Kids don't give warning when they crash. They crash fast. I'm talking with the other nurse on and I mention she's unvaccinated. As soon as I say it, I realize it could be epiglottitis. I remembered in nursing school learning about how dangerous epiglottitis was, and the professor saying they used to see it all the time. Kids would drop dead, but how we would never see it because kids are vaccinated against what causes it. I call the doc. I say what's on my mind and that she needs to put in for transfer. She thinks I'm overreacting. I don't wait. I called the children's hospital. Go through the situation. I end with, send the helicopter. Now, doc finds out I've done this. Calls the helicopter overkill. The mom asks if this is her fault. Now, I had told her when we started escalating care that because she was unvaccinated it meant we were ruling out more serious things. The other nurse I was working with looked this woman in the eye and said, yes, this is your fault. I sincerely hope that led to this kid getting vaccinated. She did live, incubated upon arrival to the children's hospital, spent 2 weeks in the PICU. In respect to HIPAA, I should clarify, I started the call. The receiving facility decided to send the helicopter. I put the doc on the phone with the hospital, moving her along to transfer. She was a moonlighter, so I didn't have another way to impress upon her this kid was on her way to respiratory failure and would be super difficult to intubate. Correct. A nurse can't make that call. Honestly, I do make it sound like I'm the hero. I should be clear, the nurse I was working with had a lot to do with us getting her figured out and getting her out fast. I want to edit out it looking like I'm some hero. I helped, but I wasn't alone. Also, autocorrect got me intubated, not incubated, and I fixed epiglottis to what I mean epiglottitis. I went and took my Lo to get her flu shot the other day and somehow me and my family doctor got on the topic of anti-vaxxers. She's been my doctor since I was born and now is my daughter's doctor, so I know her well, and on top of that she's very candid. She told me that every child in her practice is vaccinated and if a parent refuses, after she tries to clear up their misguidance, to do so she advises them to seek another doctor because she doesn't work with child abusers. She says they usually don't come back after that. LOL. I mean, I agree though. I personally think there should be a list of mandatory vaccines that if not met the Guardian can be charged with child neglect. It actually kind of blows my mind this isn't the law already. There was a young female student at university who was very outspoken, opinionated, and a know-it-all. No one liked her because she would always have something to say about everything, and would speak over other students in class, and make classes drag on over the allocated time. Anyway, one day we had the university's medical nurses informing us of the vaccines we needed to prove we had, so that we can work in certain areas, hospitals etc., and that if we had not had the vaccinations, we could get it sorted out through the university. This girl pipes up and asks what do I do, because I've never had any vaccinations. The whole lecture theater went quiet for a second, then people started laughing. The nurse's answer was an obvious you need to get all the shots, then she ended up dropping out after the first year. Thank frick. Orientation for radiology program. A girl says she refuses to vaccinate herself or her toddler. The speaker said, well, Cool. You can leave them because it's required. The girl said she was filing a complaint with the program director. The speaker was the program director. Not my story but a family friend's. She was a nurse who'd go around and give shots around in Walmart and other large super chains. So one day she was doing her job as normal when a woman rushes in with a child and hurries over to her open station since the line was empty and asks her to quickly vaccinate her nephew for school. And she made sure they were really related, then gave him the shot. After this, the mother bursts into the store and begins yelling and screaming about how her son was doomed now, along with trashing the table she was using. As you can probably guess, she was removed by security, but not after screeching at her son about how he was going to be retarded and autistic. Too bad we can't follow up a few years later with Psycho Mom and ask sarcastically how she's coping with her son's autism retardation. Not a doctor, but have a story nonetheless. I was raised as a podunk. Super Mormon town with many anti-vaxxers. We aren't religious. I was vaccinated against pertussis. I got it anyways when I was 16 or so. I went to the local doctor, who properly diagnosed me, and since my case was mild, he sent me home with some meds and an order to stay away from others and to call immediately if things got worse. I was good, so I stay in quarantine as best I could, and none of my family came down with any symptoms. 3 weeks later, I hear about a bunch of other people in town coming down with the same thing, including the doctor, who was presumably vaccinated. I never got the whole story down, but I was apparently patient zero for a community of unvaccinated families and one poor doctor. Happy ending, since no one died. Family physician here. It's not nearly as dramatic as you'd think. I tell mom what vaccines are due, and if she declines or delays them, I ask why. Whatever answer she gives, I tell her that her conclusion is not evidence-based and vaccines are beyond safe. If she still says no, I move on. I encourage her to return anytime to complete the vaccine series if she changes her mind. I try not to be judgy because that only reinforces the resistance. I live in California, so declining vaccines has sadly become more common. I know several who ban people from the office if they won't get certain vaccines for their kids. This keeps them from infecting kids too young to get the vaccines due to the parents being pieces of crap. Also, California has laws about vaccinations and the ability to go to school. Frick anyone who won't vaccinate when they can. Frick anyone who says it's okay, too. Not saying you are. Actress Jean Tierney's daughter was permanently disabled due to prenatal rubella. She caught the German measles during a World War II USO tour, and because she was pregnant at the time, the consequences were devastating. Jean carries permanently the scars of the day, more than 4 years later, when she placed her daughter Daria in a school for the mentally retarded. The emptiness inside me was like a cave, she says. She was a sweet little girl, with golden curls and soft skin. Physically she looked just like any other 4-year-old. I cried for Daria and I cried for me until I didn't know where the tears came from. Now 35, Daria still has the mind of an infant and is confined to an institution in New Jersey. More than a year after the little girl was born, Jean was approached at a party by a former woman Marine who said they had met at a USO canteen 2 years earlier. The woman added that she had been quarantined at the time with the measles but had sneaked out to see Tierney anyway. I just had to go, the woman gushed innocently. You were always my favorite. Stunned, the actress said nothing. As part of my training a few years back, I had to do a GP plasmat in hippy dippy alternative medicine central of the UK. Most of the time wasn't any issues other than the occasional person insisting on the benefits of crystals ETF, but most would also follow along with what we would advise also. I did see my first and so far only case of rubella German measles in a 3-year-old. However, the incident that came to mind was a lady who had encountered a few times LS before. She was upper middle class, university educated, English degree, but convinced of the evils of modern medicine vaccinations. Said they had monkey brains in it. Anyway, one day she came in complaining of severe nausea, latex early in the morning and associated with certain smells and foods. Asked her if there was any chance she could be pregnant. She says no, she did have a positive pregnancy test a few weeks ago but that she had dealt with it. Intrigued, I inquired further. She stated she did it the natural way, On further question, this natural method consisted of putting a bunch of herbs up her fanny for a few days. She seemed extremely annoyed when I suggested we perform another pregnancy test just to make sure, and wouldn't you know, still freaking preggers. Crazy. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now. r/ask Reddit by Planet Reddit. Doctors of Reddit, what was the most shocking case of I thought that was normal you've seen in a patient? When I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after a hernia repair. Found out he had another, baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said my brother's hernias were painful but this isn't. So I thought it was just a quirky defect. I hope he was lying to save face, but we recommended he get it taken care of. Nurse here, 67 years old, thought she was pregnant. Gotta say, she looked pregnant in that it was all in her abdomen. Like some pregnant women who look like they're carrying a basketball when they are at the end. But she was 67. Turns out it was a 37-pound ovarian cyst. I asked if I could watch the surgery. That thing came out all in one piece. I'll never forget the sound it made. This was at a community hospital many years ago, before HIPAA, so naturally the lab announced that anyone who wanted could come down to the lab and view this incredible thing before it was dissected by pathology. The line at lunchtime was so long you'd think they were giving away free concert tickets. Holy crap, 37 pounds. That's a big imaginary baby. OBGYN here. I've pulled so many things out of vaginas that people claim they didn't know were in there or don't think it was abnormal to leave them in there. Old rotting medical devices, what looked like a plastic car wheel or bottle cap, used condom, old tampon, insects, you get the drift. MD here. A couple years back, had a walk-in complaining of a few months of abdo pain swelling. I crap you not. The man was Simpson's character yellow with jaundice and ascites, fluid filling the belly. He seemed shocked when I told him I was calling the hospital to arrange direct admission. Ahem. Please continue. When I was a med student we visited a clinic in the country where I studied. Lots of people get horrible injuries and use the local elixir of dirt motor oil spit from the local old lady to patch up an exposed arm bone, or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom ball growing through the skin into the outside world. Constantly bled anytime you touched it. Her family shamed any injuries or impurities and she thought she just needed to keep it covered until it got better. I don't know if this fits, but here's a story about my husband. We were messing around and he chased me through the kitchen, took a hard left turn and lost his footing, fell on his side. He's a big dude, so falling is a bit more traumatic for him. He couldn't put pressure on his leg and knew immediately he was hurt pretty bad. He was able to crawl to the couch, and once settled said he wasn't in too much pain. He decided to sleep on the couch that night so he wouldn't have to go upstairs. We made an appointment in the morning for the so we wouldn't have to sit there all day, but they didn't have an opening until 2. So we just hung out at the house. He was in a decent amount of ambient pain, but it didn't seem emergent. Once we got to the hospital, we find out that he had broken his hip, in this case breaking off his entire ball joint from the top of his femur. The nurses said they couldn't believe that he was able to sit up and had slept on it, implying that we should have come the night before, and probably by ambulance. It required surgery with some hefty bolts to put it back into place. But the crazy part is that apparently a healthy 30-ish-year-old man breaking his femur from standing is highly unusual. After several tests and an MRI, it turned out he was in the early stages of osteoporosis due to a pituitary tumor in his brain. So we discovered a benign brain tumor all because dude was wearing slippery socks. Edited to correct the type of tumor. I had the wrong gland. I'm making my internship and one night I was attending a TRIG. A TRIG is the area where you check the patients and decide how urgent is the attention they need. Context here. I'm in a third world country and I'm at a public hospital that attends uncovered population. And instead of one hospital with all the specialities we have 3. The main one, the Geo hospital, and the children's hospital. So I had this woman of late 30s. She started telling me that she had an extreme pain, 10/10, in the lower abdomen. No other sign that food could be involved, neither kidney stones or urine infection. I proceed to ask about last menstrual cycle. She doesn't recall the exact date, but she says it was like 4 months ago. Without hesitation and without asking more or anything else, I told them she and her familiar to go right away to the hospital that was crossing the street, because if it was something obstetric we didn't had any gyno in this hospital, and if it was something of general surgery they had general surgeons there. We got a call like 20 minutes later, lol. That woman delivered her baby at TRIG of the other hospital. An MD here. Had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast and then down it. Once we finally cast the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 maggots. I knew by the smell that something under there wasn't right, but wasn't expecting that. Patient seemed completely fine with it, whatever. Resident doctor here, although not an obgyn. In my obgyn rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness and it had been hurting to nurse on one nipple, so she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I had ever seen. It looked totally raw and macerated to the point that they looked like 2 large pepperoni slices. One of her breasts also looked like the wound had led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. OMFG, my vag just sew herself closed. Not a doctor but related story of major illness undetected. My son, 13-year-old, complained to me that his scrotum was unbearably itchy. I figured probably sweat. Told him to wash the area thoroughly and make sure to dry well. Maybe dust some baby powder on there too. A couple of days later he said it was still itchy and getting bigger. Bigger? He showed me his visibly swollen scrotum. No pain or anything, just itchy and swollen. So that's not good, but I didn't think it was anything more than a sweat rash that maybe needed some ointment. We go to the doctor and are sent off for an ultrasound. The scan shows 0 blood flow to the area. Immediate transfer to the emergency room. He goes in for emergency surgery where the urologist surgeon removes one necrotic testicle. It had become randomly twisted, testicular torsion, and died at least a week prior according to its necrotic state. The swelling was a major infection setting in. The itchiness was caused by the infection and skin stretching. He had no pain whatsoever and the doctor said that was amazing. For most boys, torsion feels like being kicked in the nuts continuously, and by the infected stage he was in, he'd expect crying and screaming level of pain. Much longer and he could have developed sepsis. We just thought it was a bit of a rash that got out of hand and are lucky I took him to the GP and didn't just go buy ointment OTC as I had thought of doing. He had a follow-up surgery a month later to insert a fake testicle and to stitch his remaining live testicle to the scrotum wall so it can't commit seppuku like its brother. Psychiatrist here. One of my first patients was a female college student that couldn't sleep because of the voices that constantly talked to her and she felt forced to answer them at all times. From what she was saying I gathered that depending on the particular voice, with name and identity, she was either cautioned about some people or situations or outright pushed towards violent acts. Her voices appeared when she was 16 if I remember correctly, and we've met when she was 20. So at that point for 4 years of her life she believed that it was normal to have such voices in your head, because, as she explained, many people talk to themselves. To some extent she was right, but I had to explain to her that they really talk with themselves, that there are no other identities in them, but only an internal dialogue to clarify or resolve issues that bother them in their own privacy, so to speak. She was later diagnosed with schizophrenia. It's interesting because obviously we have the phrase, talking to yourself, but for neurotypical people, it's assumed that you won't get an answer. Healthcare worker here. I ran into a patient who had one or possibly both heads of her biceps completely ruptured proximally and curled back on itself so she looked like Popeye. I sheepishly asked her about it and she just shrugged and said it didn't hurt so she didn't worry about it. You do have 3 muscles that flex the elbow, but still the biceps is pretty important. Ag. I can't express how much I dislike this. Patient here. Went to the doctor for a no to have a day off work since I didn't feel great and just didn't want to work. Doctor poked me in the stomach, said that's not normal and sent me off to have a scan, which took me 2 months to get around to. 2 weeks later I get the letter from the doctors asking me to come in. Change my shift so I go and the doctor went off at me for not coming in sooner and told me to go home and pack a bag. I'm off to the Royal Brisbane. It might be cancer. More scans later and it's decided that it's not cancer. It was a 4-kilogram cyst. My only symptom was an enlarged stomach and the "you're getting fat" comments from my mother. Shout out to the RBWH for being a tops place for various things. Always average to above good experiences there honestly. Not a doctor but have a story. My oldest son was 11 years old and needed a physical for youth tackle football. We had a new doctor so she went into more detail than most physicals. He had complained that his ankle hurt during the middle of baseball season so she asked if he could take off his shoe. When he did, She immediately points to the side of his foot where there was a strange bump and informed us he had a broken foot. I didn't believe her as I pointed out he had the same thing on his other foot as well. She took a look and said, "Oh, he has 2 broken feet," and sent us over to get x-rays from the hospital. I was laughing thinking this was so crazy, believing there was no way my son, who not only finished playing in a baseball tournament, but who was running and jumping at the swimming pool literally an hour before, had 2 broken feet. After the x-rays were completed, my smile quickly faded as the doctor was right. That is when we learned about completely flat feet and the damage stress fractures can do when they go undetected. 8 weeks of cast and special shoes and insoles for the rest of his life solved the problem. His feet are still deformed, but it never slowed him down. Work at a dentist's office. Patient presents for an exam. Concerned part of her tooth has chipped off. On examination, it is not in fact a tooth that chipped off, but rather a piece of calculus, which is buildup of hard tartar that covers your teeth over time when you don't brush them. It can be small deposits, or in this case, an entire bridge covering her actual teeth. She thought the calculus was tooth material and was quite shocked to learn we were actually unable to see her real teeth and she'd need an extensive cleaning to remove it all. A piece of calculus. I knew my suspicion that math was unhealthy was justified. MD here. Patient came in saying he was feeling a little tired and noticed he was having a harder time doing his job in construction, a particularly difficult type of construction. Turns out he had slowly lost 80% of his blood over the course of a few months. Dude was a badass to be working as hard and long as he was with only a fifth of normal blood volume. Hemoglobin was low 2s. MD here. I had a patient that had such uncontrolled diabetes that he lost all sensation in his legs. He came into the hospital because he saw some blood on his socks when taking them off. Turns out his foot was literally rotting off, almost completely gangrenous, and the blood was coming from a huge ulcer at the bottom of his foot, which had maggots living in it. Not a fun day. Not a doctor, but a patient. I went in for thigh, hip pain. I couldn't lie on that leg for more than 30 seconds without pain. I thought it was muscular and my doctor thought it might be radiating back pain. I had several x-rays and learned I had broken my hip sometime in the past, had a floating bone chip in my hip, degenerative disc disease, a birth defect in my spine, and mild scoliosis. I was the patient, misdiagnosed when I had Crohn's disease so bad, I was literally starving to death. Finally got to a gastroenterologist, and he ran the right tests. He actually told me he thought I was too far gone to recover. I was 21 years old, 6 feet 5 and 131 pounds. I am also 6 feet 5 inches with Crohn's. Mine was easier to diagnose because I went to the doc stating I have this symptom and 2 uncles and 1 aunt with Crohn's. Sent to gastro and diagnosed right away. The family history was helpful, because they don't seem to test for Crohn's early in the diagnosis process. This was 20 years ago. Glad you were able to get back on your feet. Patient here. I thought everybody got itchy when playing outside. Turns out I'm allergic to every pollen grass mold in the state, and I shocked the doctor during my allergy test when she came back and my whole body was red lumpy. Kind of similar to this. I always broke out in hives on my legs in gym class or when I would exercise growing up. In high school, a dermatologist finally discovered that I'm allergic to my own sweat. She said she had seen a couple cases of it throughout her career. I take a daily allergy pill now and I'm fine, but definitely a fun fact I can bring up. Not a doctor, but I was rushed to the ER when I was 23. When I got there, I was admitted as an undiagnosed type 1 diabetic. The I thought this was normal bit is that, while living undiagnosed for about a year, I dropped 100 pounds. I weighed 120 pounds and was as weak as I was frail. I had stopped going to the gym months beforehand, so I just thought, well, I was as skinny as a kid. Makes sense I would get this small if I stopped eating and working out. Patient here. My psychiatrist saved my life. I have always had heavy irregular periods, so when I had bleeding that didn't go away for a month, I pretty much just kept on keeping on. Eventually a doctor referred me to an emergency department because of the constant blood loss. I got told it's because you have endometriosis. So for 5 months I had a heavy period, with doctors just dismissing it. Eventually my roommate called an ambulance when I passed out in the shower. The doctors did a blood test and I was admitted overnight for a blood transfusion. Fun fact, blood transfusions make some people nauseous, which is not a fun way to find out you're allergic to an antiemetic. A few weeks later, at about the 6-month mark, I drove for an hour for my regular appointment with my psychiatrist. He took one look at me and told me proceed directly to the emergency room. Do not pass go. So I did, and was promptly admitted to ICU with a bilateral pulmonary embolism. I was hours away from suffocating to death. Turns out all the birth control that the original doctors had been giving me to shut me up and get rid of me had caused mass clots. The doctor that looked after me and ultimately saved my life wrote a paper on why it's stupid to ignore a nulla gravida, never pregnant, woman in her mid-20s with severe dysfunctional uterine bleeding. I would love to hand that paper out to all the doctors. I was that patient. I thought I just had some bad personality qualities. Turned out it was a rare kind of schizophrenia. I'm not a doctor, but I did used to work in the emergency department of a pretty big hospital. This one lady came in with complications with her pregnancy. Apparently, a lot of things were going wrong, but she just thought that was part of pregnancy until someone pointed out to her it was not. It turns out she had a miscarriage. That was not a fun day. You never forget the cry of a mother who has just lost a child. Paramedic here. Once saw a lady in her late 50s with a goiter a little larger than a fist. She had been otherwise healthy her entire adult life, and had not once seen a doctor about it because her brother and father had the same thing, so she assumed it was just a genetic thing that she had inherited. I was the patient and it wasn't as crazy as some of these stories, but I got my eyes examined and found out I have terrible vision. I'm almost legally blind in my left eye. When the doc had me cover my right eye and try to read the letters, I couldn't read a single one. The eye doctor actually laughed at me. I was 21. I just thought everything just looked the way it looked. Getting glasses for the first time was mind-blowing. Not a doctor, but I was talking with a few girlfriends and I casually mentioned that I hadn't had a period in 3 months, and that when I do have them, they're either 2 days or a month straight. I did not know that was not right. That's the same for me, and whenever I go to any doctor for anything and they ask when was my last period, they look so worried and give me a PT, and I hate it because I sit there awkwardly with that yep face while waiting for the results because I know I'm not pregnant, but they're staring at me like my life is about to change forever. I was the patient. I had Roux-en-Y gastric bypass in April 2017. After I went home from the surgery, the expectation was that I would be on a liquid diet for a week, and then slowly start reintroducing soft foods, etc. I even used a check-in app that reviewed how I was feeling, to monitor if something was wrong. 2 weeks in, and I still couldn't keep down an ounce of protein shake. My now ex-husband was getting frustrated with me because he thought I was being deliberately difficult, while he was gone to a city 3 hours away by plane. I woke up in the middle of the night heaving and dry vomiting. My mother drove me to the hospital in the middle of the night, where I spent the next 12 hours having every test imaginable run on me. Turns out within 24 hours after my surgery, where my intestine was reconnected at the Y junction had actually come apart, leaking anastomosis, if you want to look it up. And everything I'd tried to eat had just been draining into my abdominal cavity. I was septic, and had 4 large abscesses. After emergency surgery, I spent 10 days in the ICU recovering before I went home. The surgeon told my mother that if I'd been even 24 hours later getting to the hospital, I wouldn't have made it. Side note, less than 2 months later, my husband left me. Oh no, I can't even imagine what that must have felt like, and frick your ex-husband, sounds like a real piece of work. Patient. I thought I was having a really bad flare-up of my arthritis in my back. Finally went to the ER after puking for a few hours and only being able to either lay completely flat or curled into a ball. Turns out I was extremely dehydrated, had an inflamed gallbladder, a really bad UT, and my kidneys were starting to shut down. I bet you drink water by pound now. I had a few UTs and it knocked me out. I don't know how peeing hurts so bad like that. I'm the patient. I had extensive endometriosis that was never caught by my first gyn. I was having a CAT scan for kidney stones and they noticed shadows on my ovaries, so they advised me to get them examined. My second gyn did some sonos and they couldn't find one of my ovaries, so I said, like, you mean my ovary took a vacation without me or something? I went for an exploratory lap and the endometriosis was so bad they had to call a surgeon and to cut me open, and another obgyn in for an immediate second opinion. They did find my missing ovary stuck to my uterus with scar tissue, nowhere near where it should have been. LOL. That's a horrible situation and hope you're doing better. Your comment about your ovary going on vacation without you made me chuckle. Patient here. A few summers ago I was going into my 4th week with a headache, but since I suffer from migraines I figured it was just part of it and my medicine was beginning to stop working. My friend convinced me to talk to my doctor to at least get checked up, and it turned out I had a dent in my head towards the middle of my scalp, and a concussion. My sister and I had wrestled a month prior and I got kicked, but I didn't think anything of it since I've had concussions before and they felt different. I had to take time off of work and basically nap for a week to heal. Patient. One day my stomach area just started randomly hurting really bad. I thought I just had a regular stomach cramp. After 3 hours of the worst pain ever, I went to urgent care and it turns out I had appendicitis and my appendix ruptured in the worst way. I had surgery to get it removed the same night. That was 5 days ago. Get off Reddit. Don't make yourself laugh or cough. God, I shouldn't be reading these. I just got surgery on my dong a couple days ago because it was bent too much. It was specifically 65 degrees bent downwards, and that was my "oh that isn't normal" moment. But I shouldn't be reading these because I'm still scared something wrong is going to happen to my genitals. Also, now that I know that what I had wasn't normal, then why do people use bananas as sexual innuendos? I mean, bananas are also way too bent out of shape. In all seriousness, sending good healthy dong vibes your way. Patient here. I had been suffering from debilitating pains basically since I was 14 years old. They would be worse around my periods and kind of dull down a little after. I was told this is normal. At 18, I started searching for answers because the pain was getting worse. I went 7 different doctors in 6 years. I was either dismissed as it being normal period pains or being misdiagnosed. One doctor tried to tell me it was irritable bladder syndrome. I'm no medical student, but even I know that's not a real diagnosis. I was on all kinds of different birth control and pain medication which didn't help. At 23, I was finally able to see an OBGYN who specializes in pelvic pain. She barely even touched me before she was saying, "Oh my, you have endometriosis," and scheduled me for the first laparoscopic surgery in January. During that surgery, not only did they find that I have the highest and rarest severity of endometriosis with complications, but they removed several golf ball sized cysts that were ready to rupture. She told me I must have a really high pain tolerance because I should not have been able to walk upright into her office that day with everything that they found and removed. The most amusing part of this, before seeing the specialist, I had 3 ultrasounds and several other exams, but no one detected or even bothered to look for endometriosis or PCOS. It was that simple pelvic exam that saved my life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Hospital workers of Reddit. What was the dumbest thing you saw a patient do immediately after leaving? I work in medical imaging where patients have to drink oral contrast for their exam. Some folks really hate the stuff, and one patient, after being given the oral contrast, went outside and dumped it in the bushes and came back in and said that they had drank it. Our front desk lady actually saw her dump it in the bushes and told us about it, but we would have seen the lack of contrast in the image even if she hadn't told us. I talked to the patient and was like, we can see inside of you. We can tell if you drank it or not. I work for a medical device company that makes bone screws. We had a patient sue us for faulty implants. Apparently his screws broke less than a month after surgery. But this is a big deal, and not just from a financial standpoint. So of course we launched a full investigation. Turns out the dumbass decided to play tackle football less than a month after his major back surgery. Our bone screws are strong, but not tackle football strong. His case was thrown out. When I was a nursing student, I did a rotation on a transitional care unit in my first year of school, where people go to wait for a nursing home placement. Had an older man as a client who did not have any cognitive impairment complain about abrasions on his penis. Okay, all is well, and I call for a doctor to look at it to get some antibiotic ointment for it. The doctor can't come up to our floor for another few hours. I tell the patient this and leave to go do something else. About half an hour later, it's time to go take his blood sugar, and guess what I find the man doing? Jerking off in plain sight, and his hand and penis are bloody and raw. I literally had to have a conversation with a man my grandfather's age and have to tell him not to masturbate while the abrasions are healing and to take it easier once it was healed. Talk about burning the bloody rubber. That dude really loves his egg roll. Discharged a patient after hysterectomy, removing uterus, stitches at top of vagina, and she went home and had sex, busting her stitches and allowing for her bowel to protrude through the vagina. Had to have an emergency procedure to fix it. And that's enough for this thread. Not after leaving, but this elder gentleman had his wife bring him an L out the literal day after his open heart surgery. I couldn't believe it. Now retired, but one of the things I liked about my hospital was the food. We have a lot of immigrants in our area, and some wise person decided to hire a pretty diverse crowd of cooks. Jamaican ladies making spicy chicken, Japanese cooks making sushi, Mexican dudes making made-to-order burritos, local barbecue, etc. And it was all very clean from a nutritional viewpoint. All of it was inspected by our RDs, and just about every day I would see patients turn down this excellent food and have their families bring them crap from fast food joints in town. Being in a hospital is strange and fast food is familiar. You had me at jerk chicken though. I feel like I am that person. When I was 15 I broke my arm, went to the hospital, got a cast, went about for a few weeks and got it removed. Great, I have my arm back. Now I wasn't the brightest kid and needed everything explained to me. No one told me not to have an arm wrestle with my fresh out of cast arm. No one explained it was still healing. 4 hours after having my cast removed I was back in A&E and getting a new x-ray and then a new cast put on by the same nurse who just took it off. I have never seen such disappointment in the eyes of someone who wasn't my mother. Your last sentence is priceless. Countless COPD asthmatics coming in for wheezing, sob, rapid breathing. We treat them and the second they feel better they will state, I forgot something in my car, only to leave and light up a cig. A lady came to our for tachycardia and anxiety. The triage nurse, on a hunch, asked what she'd eaten that day and if she'd had any coffee. I haven't had time to eat. This now being mid-afternoon, and only 4 or 5 cups of coffee, genuinely clueless. Not a hospital worker, but I was in the emergency room due to a sports-related injury. Finally got let out after hours of x-rays and examinations as I was learning how to use crutches and watched someone with stitches on his arm start stretching like he was going to run all the way home. He turned around, walked towards the desk and yelled, "Your nurse is a crap," after the cut on his arm reopened mid-stretch. The woman at the desk looked so tired. Somebody lit up a cigarette in a no-smoking area with a nasal cannula on and lit their face on fire. Had to come right back into the air. Suru many smokers with cannula OMG. Always outside the main entrance puffing away beside their O2 tank. Jesus take the wheel. Guy was discharged from our emergency room and wanted a cab voucher to get downtown. We wouldn't give him one because he didn't meet our requirements. He walked outside, called 911, and told the ambulance to take him to a hospital downtown. I had a PT who left AMA that called 911 from our main entrance. They refused to pick her up and asked her to go to our ED. Go out to the car park, meet their dealer in a car, and shoot up through their IV cannula, then saunter back into their room as if we couldn't tell. That's why more and more hospitals won't let patients leave the floor. It's a huge liability, not to mention when doctors come to see the patient, they may not be in the room. In the Darwin Awards is a tale of a man in hospital with a skin problem. The staff coated him all over with a cream which is highly flammable, warned him about it and told him to keep away from any sources of ignition. He immediately snuck outside for a smoke, went up like a Roman candle. Not a doctor, but I knew someone that is a fitness freak to an obnoxious level. She had a medical emergency, intestinal blockage. One day that involved major abdominal surgery and removal of part of her intestine. The day she was released from the hospital, she went back to her insane workout routine, trying to make up for the muscle she lost. She claims her doctor told her she could. Her intestines ripped open. She barely survived. She still claimed after the fact that her working out had absolutely nothing to do with her body ripping open and it was just bad luck. Over-exercising can be a form of eating disorder, body dysphoria. She should get help. Inject H into their PICC line. Big IV. Leave to go smoke a cigarette and get hit by car. Steal from a 7-Eleven while in a hospital gown. Escape from the ER and steal an ambulance. How do you manage to steal an ambulance? Patient came in for shortness of breath. She was seen and discharged. A nurse saw her walk into the parking lot, jab herself in the leg with an EpiPen, and come right back in saying that she's short of breath. That's not dumb. That's a mentally ill patient. My brother works as a volunteer for the Red Cross. He mostly volunteers as a medic in ambulances. He told me how they picked up a guy because he crashed his bike after he didn't pay attention and got his tire stuck in some tram tracks. About 3 hours later he was picked up again after he tried to ride his bike with one hand in a cast. First time round he sprained his elbow. Second time round he broke his shoulder on the same side. Well, he didn't disable himself on both sides. There is that as a silver lining. I don't work at a hospital, but off the top of my head. 1. The patient who refused to get in an ambulance when he was having a heart attack until we let him have a cigarette. 2. The patient who while having a stroke insisted he was fine and was just going to go home and nap. We got his niece to come and bring him to the ED. 3. The patient who insisted he knew his body and was able to frighten his paralyzed limbs into working correctly, and that was why he did not need an ambulance to go to the hospital for the stroke he was currently having. His limbs were paralyzed because of his first severe stroke. This was his second. 4. The parents who when their infant had trouble breathing gave him a lot of milk to drink and laid him down. Kid was fine, but these people were clueless. I have way more. Can you believe the patient did that? Stories, but these were the ones I saw myself. As requested, more crazy patient stories. 1. The IV drug user who refused free vaccines cause they didn't want unsafe substances in their body. 2. The addict who wanted to know the safest way to use C because their dealer kept mixing C with H. We told this patient there is not a medically recommended safe way to use C. This person just decided to switch dealers. 3. The person who knowingly let, and I do not use the word let lightly, her child be sexually abused complained that we made their child sick and were not providing sufficient care for their child's reoccurring nightmares and depression. 4. The patient who had tumor grow to the size of a watermelon before they sought treatment. This person is actually doing really well now and last I checked expected to make full recovery. 5. The mother who was convinced her kid had hearing issues. Kids' hearing worked just fine, they just ignored their mom. 6. The patient convinced they had memory loss. They didn't. They did have 4 kids under 5 and a newborn though. 7. The patient who was frustrated that his 7-year-old was obese and not losing weight despite the fact he kept buying her junk food. 8. The patient convinced we were going to hurt him during specific minor surgical procedure needed to diagnose his health problems and just screamed that at us at different visits. We have never forced him to get that procedure, nor do we provide it on site. 9. The patient, who was very poor with no real assets, who refused to speak about DNRs and her will while I was in the room. The only patient who has ever refused to speak in front of me. I think she thought I was trying to steal from her. IDK, I'm just basic staff. 10. The patient who called me cute. He was completely blind in one eye. To date he is the only patient that has ever called me cute. I am a aggressively average looking person. I just find this story funny. Not a hospital worker, but my grandfather's wife tried to sneak KFC into the hospital for him immediately after triple bypass surgery. I am in IT and was working an overnight shift in the emergency room supporting a new software rollout. A dude was brought in because he had drunkenly stumbled out in front of a car and got hit. When my shift ended around 11 AM, I went to a little Irish pub down the street to have a beer and some lunch before I headed home to get some sleep, and lo and behold, guys, who is in there drinking again? Yep, same dude from the was already drinking whiskey again just hours after being released from the hospital with a broken arm and a few other injuries. This is just sad. Had a guy in his 20s come in with beef from a car accident. Decided to discharge against medical advice. Showed up the very next day after attempting to back out of his driveway and slammed into his girlfriend's car. I work in a COVID clinic and I had a patient come in who was just a ball of anxiety about all sorts of things, but mainly COVID. He had no symptoms either, just general anxiety. Anyway, he walked out of the clinic, immediately took off his mask and went into the Jimmy John's across the street. Seriously? You come to specifically talk about your fears of COVID and then you take off your mask before going into a store? Why? On my OB rotation in med school, we had a 32-week pregnant woman with cardiomyopathy, heart failure-like condition, and an ejection fraction of 15%. Bad. She's inpatient until delivery and everyone's worried she will die during or after delivery. One night a unit clerk calls and asks the nurse on duty, "Have y'all seen Ms. X tonight?" The nurse says, "She's in her room, I assume." The clerk then says, "Well, that's weird because I'm looking at her eating a funnel cake at the state fair right now." The patient just decided she needed a break from all of this hospital life. Okay, this was me. I had finished a sleep study, as to which I barely slept and had to redo it. I was 6 AM and I was leaving the hospital. I walked into a glass wall, which was clearly a wall. It even had the visibility stickers on it, twice. Twice I bounced off the same wall in my attempt to leave the hospital. Sleep depravity is a BLOL. A dentist had to put a little boy maybe 3 under general anesthesia to treat his bad teeth. Everything went fine until he was about to leave and I saw his mom getting him Gatorade. Turns out it was his favorite drink and it was almost all he was drinking. The parents thought it was a fruit juice and that it was okay for him to drink. No wonder he had so much problems with his teeth. Poor little guy. Patient obese enough to be in a wheelchair, went outside for a smoke. Cigarette in one hand, inhaler in the other. One puff of the cigarette, one puff of the inhaler. Inhalers are often used for bronchial dilation. I imagine that would increase the effects of smoking. Mind you, I'm not saying it's a good thing. I just recognize how it might work. This doesn't fit super well, but I once had a patient who insisted on leaving the hospital, discharge against medical advice, because it's hard to get a good night's sleep. Now, I will admit, hospital is not the quietest place at night. You have doctors going around checking on sick patients, machines beeping, etc. But they are there for a reason. We could not convince him to stay, so we turned to his wife. His wife said she agreed with us, but she can't change his mind. He died the next day. It was a very treatable condition. Serious, but he had a good chance of recovery if he stayed. I guess he got a good sleep after all. Holy crap, that was darker than I thought. I'm a pharmacist, and one of our patients has been coming in to get nicotine chewing gum regularly for at least 5 years now. Problematic in itself, I know. This time he really wanted to quit, so he asked about nicotine patches, but decided they were too expensive. As I was walking home from work minutes later, he rode past me on his bike with a lit cigarette in his mouth. We had an angry drunk that came via ambulance from a city about 30 minutes away. He left AMA, walked to the nearest motel, used their phone, and then called 911 hoping to be taken back to his city. but he ended up back in our ED. Needless to say, he left AMA again a few minutes later. When I was working in the hospital, I had a patient who had a central line, which is an intravenous line into a large vessel in his chest. He went in a wheelchair with a friend of his to the parking lot where his friend injected his central line with H. He overdosed. His friend pushed him into the elevator on the wheelchair and left him there. He was found in the elevator unresponsive. He was successfully resuscitated so that he could return to his life of substance abuse. They don't always wait until they're out of the doors to do something stupid. They'll have their friends sneak in drugs and shoot up on their bed. Addiction is a disease after all. When my sister was about 3, she refused to leave somewhere. Can't remember, and my parents were holding her and my sister went limp and popped her elbow out of place, so they took her to the hospital and they fixed it. I crap you not. I'm not lying. The second they opened the door and stepped outside, she was already throwing a fit and went limp again the second they walked out and popped her wrist. So they had to walk back inside and get it checked, and while the nurse was trying to get her to sit still, he accidentally popped out back. And then they investigated your parents for being abusive, lol. Not a hospital worker, but when I was 5 I was visiting my grandpa in the hospital, and when we left, I was walking backwards talking to my mom. I turned around and smacked my head against a parking sign. Had to immediately go back into the hospital to ask for some ice. I imagine the nurses watching got a laugh out of that one. My mom sure did. I know someone who fell and broke the bone above the eye by hitting the door handle. When her mother and brother were visiting her in the hospital, she shared the entire experience in great detail, which led to her brother feeling uneasy. He tried to leave the room but fainted, hit the door handle and broke the bone above the eye. I work as a respiratory therapist, so part of my job is to manage ventilated patients. Often I'll have patients who are in due to drug or alcohol overdose. I remember one patient who had been intubated because they were found unconscious in their own vomit. We had the person for about 2 weeks intubated to protect their airway while they detoxed. Long story short, they finished detoxing, left AMA against medical advice, went home and same day pounded a 2L bottle of vodka, vomited, aspirated and was found 45 minutes after and suffered an anoxic brain injury. They were back in the ICU same day, intubated again, and if they're still alive it's not without massive mental deficits. Happens often. People go through the whole detox cycle just to repeat the same mistakes. When I went through bariatric class, the instructor told a story of someone who, after surgery, ate a burrito on the way home from the hospital. They had to have another emergency surgery to fix the damage. Had a mom in the angry that we hadn't gotten to her daughter yet. Minor injury, already triaged and needed to wait for others with serious issues. She got so mad that she left with her kid, stood outside our entrance and called 911. The ambulance came about 10-15 minutes after it would have been their turn on to be seen. Would have been a grand total of 30-minute wait to see our doc. Had them take the kid to another hospital instead. Way to go, Mom of the Year. Had a patient get an extensive, and free to him, surgery to fix the arm he messed up by injecting M into it. He was motivated to stay clean since he went through such a big procedure. He had to wait an extra 2 hours for discharge on his day to go home. Got pee, had a full-on meltdown, said he was going to go home and get fricked up. He didn't want to stay clean anymore. Came back to the ED that night drunk as a skunk. Well, at least he stayed off the M that night, presumably. Not me, but a former co-worker had a patient who snuck out to puff a crack pipe in the parking lot mid-visit while they were busy with another patient. Got to the hospital with a heart attack, decided to start a healthy life the next morning, died in a hospital yard doing workout. That's sad. I had a patient leave AMA one night at 2 AM. He said he was walking home. He signed the papers and left. I was busy so I didn't get around to the computer documentation and discharging from the system. About 2 hours later the called the floor and asked if we had had a patient by a certain name. I told her he had left AMA. Turns out he walked a few blocks and realized he couldn't go on and called an ambulance. Since he was never officially discharged, he just came back to the floor and went back to bed. My granddad was this person. We had a family reunion trip to Cancun. Mexico in 2015 if I recall correctly. One of the days we were there, we took a day trip to a cenote, deep freshwater lake, and did some touristy things. One of said touristy things was a 30-feet cliff dive where you could get your picture taken as you leapt into the water. My grandfather wanted to do it, as it was a once-in-a-lifetime opportunity. He failed to tell us this before he did, and it wouldn't have been so bad if he hadn't had a quadruple bypass surgery just weeks before. He did a fat belly flop. It was admittedly pretty badass. As soon as he bobbed to the surface and doggy paddled ashore, his wife yelled at him on "En voila por." Confused Spanish-speaking tour guide paced around nervously. Grandfather was perfectly fine, but he wasn't allowed to go swimming for the rest of the day. I had a patient that had surgery to remove her intestinal polyps, then went out and drank a bunch of liquor and began hemorrhaging blood. Customary, not a hospital worker, but my grandpa ranks up there in dumb crap. He was in the hospital for lung cancer, ended up being on oxygen, and would stay on oxygen the rest of his life. As soon as he left the hospital, he pulled down his mask, lit up a cigarette, and started smoking. Personally, I think that this says more about how addictive nicotine is versus how dumb your grandpa is. You'd think he'd stop using the thing that's actively killing him, but addiction is a strong pull. We used to have this young guy come in frequently for diabetic ketoacidosis, DKA. For those not in the know, DKA typically occurs with type 1 diabetics when their blood sugar, for whatever reason, goes out of control, triggering a chain reaction in the body that, if left untreated, is fatal. Every time this guy came in, he was extremely sick and practically knocking on death's door, and he would do this every couple of months. One night, I headed into work but stopped at the lobby's Tim Hortons to grab a coffee. Ahead of me in line, I see that same guy. Our eyes meet, so I say, "Hey, they let you out today," as I knew he had been admitted to my unit over the last few days. "Yeah," he says excitedly. Then he goes up to the counter and orders a sugary donut. He literally chows down on it as he leaves and waves goodbye at me. In my head, I'm sighing and thinking, "See you soon." We haven't seen him in a long time, though, so I assume he's been doing better with his blood sugar control nowadays. Either he is doing better, or a lot worse. If you are new to the channel, you can subscribe. I publish new videos every day. Until doctors of Reddit, what patient made you go, "How the frick are you even alive?" Belligerent guy comes in a wheelchair. He doesn't want to be here. He's freaking fine. The party was good. Ems fricked his evening up. Ems brought him in from a bush party. The guy had a chainsaw stuck in his thigh and shin, literally jammed in his leg, and severe burns after falling into the bonfire on half his body. Guy was hammered, didn't seem bothered by the fact he was severely burned or had a chainsaw in his leg. He ended up losing the leg below his knee, and got a nasty infection from the burn. But still, if his leg wasn't completely fricked, I am convinced he'd have gotten up and tried to fight people. He must be an Aussie, and I can tell you, almost 100% certain, if he is Australian, he was drinking Bundy rum. That crap makes you do funny things. I still drink it though. I was on home call for her in a small town. Got a call from the nurse one night and she was like, "Ems brought someone in here and they think she might be dead." I was like, "Well, is she?" She was like, "I don't know." This was a seasoned RN, by the way, so I was like, "Well, guess we're treating this as a code blue kind of situation." So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1. For those familiar with lab values, the backstory was extreme self-neglect depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. For those like me who are curious, potassium levels of 3.65.2 is normal. Anything less than 2.5 is life-threatening. Seems like a relatively wide range for normal, but it doesn't take much to get into deadly territory. That's kind of scary. I'm going to go eat a banana. Patient here. When I was 2 I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CT scan. This was 1990, and when they were done, they turned me back over and I was blue. Had stopped breathing. CT revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my ribcage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages, everything but major organs. I made a full recovery. I am a healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. Update. Definitely didn't expect this to blow up. Dang. This was a teratoma, so it was never a viable human. What the frick? A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute subdural hematomas is 50-90%. Of those who live, approximately 20-30% regain any brain functioning. Due to the subdural hematoma, the bleeding in my skull was so severe that I also had cranial herniation. My brain tilted 5 millimeters, causing my brain stem to compress into my spinal cord. That I not only lived, but woke up and recovered well enough to go back to work, get married, travel the world, return to baseline physically is a straight up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day, and he says the same thing. Bro, I went back through your posts and I'm all choked up. That's amazing. I'm sorry you had to endure something so horrible, but so thankful you could overcome it. Congratulations on your recovery and marriage. I hope things will continue to be positive. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation. Diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg/dl. Normal is 80-120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64 ounces sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the frick did you survive that trauma disease, but how the frick do you even function on your own? I know a guy who keeps telling me that he never takes insulin and drinks 40 ounces of dew a day and his diabetes hasn't caused him any problems yet. Same guy also had his foot amputated a few inches above the ankle a year ago. Currently a med student, but was formerly a nurse. While working as a nurse, I had this one patient who was originally from the Congo complaining of right lower abdominal pain, with a subsequent diagnosis of appendicitis. Nothing crazy about that. See it every day. The crazy part was the story he told me next. He said that he didn't think it could be appendicitis, and when I asked him why he told me this, when he was in the Congo, he was out in the bush trying to poach gorillas. Awful. I know. When he developed right lower abdominal pain, nausea, fever, etc. Being out in the bush, far from medical attention, he and his buddy decided the best course of action was to cut open his abdomen with a machete and remove his own freaking appendix. After nearly dying from the surgery, he then went on to nearly die from sepsis over the next several weeks. I assume he was under medical care by this point. Somehow, he manages to overcome nearly impossible odds and survives, and years later immigrated to Canada where he develops appendicitis again. So after hearing this, I was equally amazed as well as skeptical, but he showed me his scar, which I thought was fairly validating. I told his surgeon the story and asked why would he still get appendicitis, and they said he most likely just didn't remove the whole thing. I know this is all hearsay and it is definitely possible it was exaggerated or even entirely fabricated by the patient, but if it's true, it's one of the most badass things I've ever heard and definitely belongs here. Seems possible. There's a cosplayer named Nightmage who was hospitalized for appendicitis twice last year. First surgery was uneventful, but apparently part of his appendix decided to go walkabout only to blow up again a few months later. Not a doctor, but I had a few doctors ask me that. Typically, if you get appendicitis it'll rupture and sepsis will set in within a day or so. And when that happens, it gets real bad real fast. So I got appendicitis. It freaking hurt so bad, but I didn't know I had appendicitis. I went to the doctor. He couldn't tell what was going on. Though I had compacted stool and wanted me to take stool softeners. So I did. It didn't help. Cause spoiler, it was appendicitis, right? And then a roommate who thinks he knows what he's talking about tells me that it's all in my head and I just need to physically get off the couch and exercise, because he feels much better after he exercises. Okay dude, I can't even get off the couch to use the restroom without almost passing out in pain. He tells me to just play a video game to get my mind off of it. I go to class, grad student at the time. I call the doctor and make another appointment. He doesn't know what's going on. I talk with another doctor. No clue. He thought maybe it's appendicitis, but I didn't have a fever and didn't have a recoil pain. So maybe it was gastrointestinal stuff. So I schedule an appointment, meet with them. All the while I'm going to class and taking the maximum dosage of all pain relievers I can get my hands on. And finally the GI doctor's scan showed that I had appendicitis. Hooray. I go to the nearest and I say, in a totally calm tone, "Hi, my name is," insert name here. So, my doctor said I should probably go to the ER because my appendix burst a while ago and it should probably be taken out or something. Turns out, my appendix burst and I held onto it for 3.5 weeks. I had a dozen doctors come in, and some of them even started by saying, "Hello, my name is Dr. Such and Such, and I heard that you're the guy who has had a burst appendix for nearly a month and you're still alive. I am not on your case, but I just wanted to meet you. How the heck are you still alive? How the heck did you drive yourself here and just waltz into our I got that alien bioengineering upgrade where the abdomen moves around and wall seals off the burst appendix so it doesn't leak everywhere. After my primary care physician learned I had appendicitis and he didn't diagnose it, he retired within a month. It was probably coincidental. It was probably coincidental. Alternatively, he fricked up so badly that he retired out of pure, unadulterated shame. We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s. He was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 AM and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile he's so coherent and alert as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the air, because I think it just reminded me that hope and good outcomes are still out there. To clarify some things, late 40s is young for this kind of case to happen. We usually see people dissect in their 70s to 90s. Also late 40s is a pretty young age to die, especially if you don't have any chronic illnesses. A couple of weeks ago, my ED lost a 30-year-old to COVID-19. A couple of nurses cried because we consider people twice his age still pretty young. This happened when I was still a tech and had only been in the ER for about a year. He was brought in by EMS uncomfortable, but definitely awake and alert. His ECG was normal, and he didn't have any pertinent history, just chronic HTN and a few minor surgeries. But he was hypertensive and really pale, and when we performed in US, we found what looked like a huge volume of blood in the abdomen, and a visible intimal tear. We pretty much immediately diagnosed him with AD and had vascular surgery in the room within a few minutes. I followed up on his chart a few days later and found out not only that he was alive, but he was already extubated and able to walk. I'll try to keep sorting through comments. I'm surprised that this isn't as uncommon as I thought. My favorite bit about this story is you called someone in their late 40s a young guy. As feel good as this story is, you've just made a bunch of other random people very happy. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her cycle during internship, man with police officers behind him came in the air. The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. My siblings and I all walked away from a car crash where our hatchback flipped upside down and backwards on the highway. The car was totaled. Ambulance guys couldn't believe we'd walked out of it. Seatbelts save lives. My sister was the patient, but every doctor who's gone through her whole file has had this reaction. When Wen was 9, she fell around 35 feet off a bluff and landed headfirst on bedrock. Shattered every bone in her skull. A very well-known neurosurgeon took a look at her when she was brought in, said sorry, there is absolutely nothing I can do for her. I'd say she had a 10% chance of surviving the night. Say your goodbyes now. 3 weeks in a coma, 3 months in an ICU, 6 months as an inpatient. She's still alive today. She has permanent damage of course, but holy cow, can kids' bodies recover from a lot? Yup, I got hit by a car when I was 4. The driver didn't see me run in front of her car. She knocked me down and kept going. I was dragged under the car and scraped on the pavement, so much so that half the hair on my head was torn off. Driver didn't stop until she ran over my shoulder. I was in a coma for 10 days. My dad is 87. He had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a 6-fold bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. If I were a doctor or scientist, frick, every 6 months, I'd want to see this guy weekly so I could study him and give other people his immortality. I'm a psychologist, not an MD or DO, but I work at a psychiatric hospital. Anyway, one of my patients a few weeks ago was a 15-year-old boy who was regularly neglected as an infant by his mother, who was an addict. When he was around 5 years old, his mom pimped him out to men for fricking in return for drugs. When he was 9, his stepfather gave him a skull fracture after beating him with a wrench. When he was 14, the same man shot him with a pistol for talking back. He's in foster care at the moment, and suffers from CPTSD and depression. But, he's the sweetest boy I ever met. I wish him the absolute best in life going forward. He deserves it. Something similar happened to my old boss nephew. She took custody of him from her drug addict sister. Poor kid was very sweet, but I felt bad for him. We had one of these at an eye doctor's office of all places. Patient was complaining about how her new glasses weren't working. So the doctor took her in back to check to see if the prescription needed tweaking. The doctor came up with a completely different prescription. Patient was overweight but claimed she was not diabetic. The doctor convinced her to let us take a blood sugar measurement with a staff member's personal glucose meter. All the meter displayed was high. With some arguing, we were able to get her to go to the local hospital right away. I don't remember what her blood sugar level was, but I remember it was the hospital's high score for a while. She should not have been conscious, let alone functioning normally. All the meter displayed was high. What a friendly meter. A guy, now passed away, who had incurable lung cancer from Agent Orange exposure during infantry service in Vietnam, and his wife had recently died. Cancer. Wife died. Guy was pretty positive, glass half full about chemo, considering the double whammy. Asked him how he managed to keep it on the positive. He said he was returning to base with just days left on his enlistment. Rookie pilot has a mechanical failure of some sorts in their UE. They are going down, and not the controlled kind of landing either. He assumes he is about to die. Says everything got real slow, real bright, and a sense of acceptance and peace washed over him. Rookie pulls one out at the last moment. Lands a bird with no casualties. Patient told me he felt he should have died that day, and every single day since was a complete gift. Maybe being alive has a lot to do with attitude. I believe it. My uncle survived 3 ambushes in Vietnam. He's a real believer in faith and God because of it. My dad was there too, him not so much. I was in the military myself and deployed 2 times and I seen some combat, and I guess it's how close you come and your outlook on life. My mother. We used to live in East Texas and my mom had this lady come in and had a huge infected wound in her leg. Like massive to the point they might have to amputate, and she had asked her why she waited so long before coming in when it was obviously festering. Well, turns out this woman was letting her dogs lick it clean because their mouths are clean, and she was soaking it in Dr. Pepper because doctor had her thinking it would help. Needless to say, my mother looked at her like a deer in the headlights when she said that. Talk to my mother, she also said there was a couple canine teeth in it because the lady had an old dog. My friend in nursing school was in charge of checking in and out a habitual patient that also was seen by a full nurse and doctor. On checkout she noticed a bandage on the guy. Oh, that's for my hole. The guy had an open sore that kept getting bigger and bigger, and he had stuffed 3 t-shirt in it. He had been having repeated health problems and they just listened to his lungs. Would give him an antibiotic and treating him. Yay. I've seen this before. Had a poor woman that had a wound on her back that was so bad, you could see her spine. I was so happy when she finally passed. Her family had been keeping her alive as long as possible to collect her social security checks. Obligatory. Not a doctor. I'm a funeral director and I received the body of a 90-something man. I could tell he had been sick for quite some time just by looking at his face. Another funeral director did the embalming, so I hadn't seen the rest of his body. Seeing that he was so old and just looked sick, I was surprised when I met with his daughter and she inquired about an autopsy. I asked her my usual questions and discovered that this man, for 40+ years, had unregulated diabetes. He was shot on 3 different occasions in his life. He had a history of strokes, bed sores, deep ones, in and out of the hospital for sepsis, pneumonia, heavy smoker, heavier drinker, suffered a major heart attack just days before. His vision was going and he couldn't keep himself awake. Horrible jaundice, cirrhosis, had an infected kidney removed, on and on. I don't think this man lived one healthy day in the last 20 years. I ask the daughter, so, you want an autopsy? Because she tells me that her father was not an ill man and it was not his time to go. She's furious. I even questioned her request. I'm baffled that this man lived for 90+ years. The denial people can experience in hand with grief is astounding. I was expecting the guy to wake up at some point somehow. 2 patients that give me faith in what medicine can do when I think about it, both quite young to be so sick. First was a woman who was very pregnant and some genius doc agreed to put her under twilight anesthesia for an elective procedure that definitely could have waited. Went into labor while she was under and from there had everything go wrong, ended up in cardiac arrest. Was transported to my hospital and put on VAECMO. She was in rough shape when I saw her first. Most people in her condition don't make it. I ended up seeing her a month later walk into my OP clinic and I got the creepiest feeling. It was like seeing a ghost. She was fine, not like most people who come out of the ICU after that kind of stay. The second was a young guy who bled out in the ICU of a sudden hemorrhage. He was pulseless for an hour. Without going into a bunch of details, he required several procedures after that which were risky on their own. It took weeks for him to reboot, but eventually he was responding to stimuli. After a couple months he walked out of the hospital. He wasn't dying. He was dead for an hour. That these 2 survived is a testament to modern medical science. That they walked out of the hospital on their own, needing little to no assistance, and with their cognition completely intact. That is a miracle. I remembered another one that was pretty wild. This guy had very advanced cancer which had invaded the major blood vessels of his abdomen and chest. When they took him to surgery, his vena cava was involved and it sounds like it just unraveled. They were not ready for a major cardiothoracic procedure, so they were just dumping blood products into him to keep him alive while they could get someone to repair this major vessel. I thought the op report had a typo because they said the estimated blood loss was 30 L. I forget the breakdown, but they had put hundreds of units of blood, liters and liters of crystalloids and plasma. It's about 6x the blood in a normal person. He was white as a sheet for weeks after this, but he made it. Holy crap. 6 large adults worth of blood. I wonder how many different people's blood ended up in him at one time. Quick calculations say it could have been 90 individuals' donations worth. give or take. I'm a hospital medic and my first serious trauma was a guy that got shot in the neck. Somehow it missed everything important and went right through. Minimal bleeding, no C-spine damage. Just a hole through his neck that didn't pierce his esophagus, trachea, or any major vein or artery. Dude was just chilling in the room. And then 2 weeks ago we had a gunshot that would not have made it to the local trauma center. Hit his femoral vein but was still gushing blood. One nurse stuck her finger in the hole and it stopped the bleeding, and I found a second wound in his chest. No bleeding at all, it just looked like a weird indentation. We couldn't even tell it was a gunshot at first, and I stuck an IV adhesive sticker over it to vent it and prevent a collapsed lung. The guy's blood pressure was in the toilet and wasn't even able to read on the machine. We needed a manual check. By the time we got him sort of stable and with decent vitals, and got a surgery team in early, we were drenched in this guy's blood. Pretty sure most of what was flowing through him was saline and other people's blood. He survived though. We also had one woman whose entire abdomen was fully open under her belly, and everything in her was horribly infected. We basically told her we can't stop that much infection and she opted for hospice care. She was in so much pain I don't know how her family even got her to the air. I lifted up a gust to look underneath since I was the first in the room to assess, and I was hit one of the most rancid smells I've ever experienced. Literally everything from the waist up was infected. There were some unnatural fluids draining right out of the completely open bottom of her stomach. I mean it when I say you could just lift it up and look right inside. If you are new to the channel, you can subscribe. I publish new videos every day. Doctors of Reddit, what patient made you go how the frick are you even alive? Type 1 diabetic in their 20s presented dead of DKA, unresponsive, no pulse, in VF, multiple rounds of CPR, defibrillated, eventually stabilized in ICU, self-discharged immediately after being extubated less than 48 later. When I was hospitalized for DKA I was really surprised by how I felt so much better in such a short time. I work in an area in Lebanon where the construction safety regulations are a bit lax. A few years back I remember that construction workers were falling off buildings like dominoes. One guy came in having fallen from a few stories up and got impaled by an iron bar that went through the back of his neck and out of his left eye socket. Guy was alive and talkative when he got to our rushed down to surgery. Apparently it had missed every vital structure somehow and the guy didn't even lose vision in his eye. My mother. We used to live in East Texas and my mom had this lady come in and had a huge infected wound in her leg. Like massive to the point they might have to amputate, and she had asked her why she waited so long before coming in when it was obviously festering. Well, turns out this woman was letting her dogs lick it clean because their mouths are clean and she was soaking it in Dr. Pepper because doctor had her thinking it would help. Needless to say my mother looked at her like a deer in the headlights when she said that. Talk to my mother, she also said there was a couple canine teeth in it because the lady had an old dog. My friend in nursing school was in charge of checking in and out a habitual patient that also was seen by a full nurse and doctor. On checkout she noticed a bandage on the guy. Oh, that's for my hole. The guy had an open sore that kept getting bigger and bigger and he had stuffed 3 t-shirt in it. He had been having repeated health problems and they just listened to his lungs. Would give him an antibiotic and treating him. Yay. I've seen this before. Had a poor woman that had a wound on her back that was so bad, you could see her spine. I was so happy when she finally passed. Her family had been keeping her alive as long as possible to collect her social security checks. I had liver failure. When I was 8 months pregnant, my baby had stopped moving for several hours, so they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body used up all its clotting stuff. I was in ICU for 3 days, in hospital for 2 weeks. My liver recovered. I went home with my son. We could both have died. The hepatology department and maternity department were working together, which is not a usual thing for them. It was acute fatty liver of pregnancy. So happy you're both here today. Patient here. When I was 7 I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how the frick I was still alive. Now 16 and haven't had any hospital worthy complications since. And god dang it, my mom is the most amazing and loving person on this green earth. I had been decidedly dead for about 10-30 minutes, which is why I wasn't transported to the morgue. Your mom probably never slept again, holy crap. I had a patient in the emergency room who had been involved in an awful car accident where firefighters and paramedics spent an hour trying to get him out of his car. Reportedly, he attempted to walk to the ambulance, and when he arrived he was awake and talking. Confused speech, but still. Then paramedics signaled the back of his head to me. His skull was popped open on the back so much that I could see inside. We paged the brain surgeon immediately and the patient was taken directly to the operation theater. Months later I heard from my colleague that he was still alive and had no damages other than some occasional balance problems. Not a doctor, but a patient. I was in the hospital after a pretty gnarly four-wheeler wreck. I was destroyed, fractured my skull, broke 3 ribs, my right shin, it was sticking out of my leg, broke my collarbone, my right arm, had some pretty bad cuts, bruising, fractured 3 vertebrae in my lower spine, and internal bleeding. I've had a pretty high threshold for pain basically my entire life because I've always been clumsy stupid, but that was god awful, even after I was given pain meds. At some point, IDK exactly when it was, I was in and out quite a bit. I heard 2 doctors conversing outside my curtain. One of them said, "I don't know how she keeps regaining consciousness. There's no way she should be awake right now." The other doctor replied, "Honestly, I don't know how she's even alive. I think they thought I was asleep." IDK, but that scared the heck out of me. Not a doctor, but was the patient. When I was in boot camp I developed an upper respiratory infection during second phase. I didn't want to get dropped back a platoon, so I gutted through, got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, "How the heck are you still alive? Your lungs are so full of mucus you should be dead." Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. I'm not a doctor, but I did meet a patient who fell from a 5-story building, landed on his upper back, woke up in the hospital the next morning and got up walking around like nothing ever happened. Barely a scratch on him. Think about it every time I'm in a building with at least 5 stories, just looking down like how in the world did this guy walk away from that like he fell off his bike and took a nap. Actually, I've seen worse injuries from someone falling off a bike, lol. I'm a midwife and we have patients who have massive obstetric hemorrhage, which is classed as any blood loss over 2 liters. This can happen for a variety of reasons. We had a patient who unexpectedly started hemorrhaging following an uncomplicated normal delivery and we just couldn't stop it. As soon as we pumped blood in, it hosed out. The doctors had to perform an emergency hysterectomy and the bleeding stopped. I think it's fair to say we were all shocked, not just at the incident itself, but at the fact that this woman lost 8 liters of blood. Also, that she spent just 1 night in intensive care before she was back on the ward, caring for her newborn, and she was home within a week. Women are bloody awesome, excuse the pun. For reference, women usually have between 4.5-5.2 liters of blood circulating in their body, hence 8 liters is very scary. This was many years ago, so I can't recall the exact details, but basically, we had a lady on ventilation with sepsis and multi-organ failure, renal failure, respiratory failure, metabolic acidosis, deranged liver enzymes, the whole works. We counseled the family and they agreed to withdraw life support, so DNR was issued and we took her off her ventilator. A few days later she's still around, unconscious, still in full-blown sepsis with multi-organ failure, but brainstem functions were there. I remember looking at her charts with my registrar, I think resident in the US, and my registrar going, "But how?" Then one day, maybe about a week on, during visiting hours, the patient's son approached us before he left to thank us for looking after his mother. His parting words were, And I kid you not, I don't know if it's relevant, but my mother practiced black magic. My registrar made the ward sister contact the hospital chaplaincy team to inquire if they do exorcism. They don't. My blood sugar was more than 1000 when I was diagnosed with type 1 diabetes. I was less than a year old. My mom had taken me to the doctor's office 4 times in 3 days, but the nurse called her a nervous mother and sent her home. Also diagnosed with Addison's disease a couple years ago. I'd probably had it for months and had been living on my own in a town where I knew nobody. The day I got home I basically had a conscious blackout. Happened a few more times over the next couple weeks and I lost the ability to sense low blood sugars. When I was finally hospitalized I was in Addisonian crisis. Took them 3 days to bring in an endocrinologist, and he knew what was wrong within minutes. They told me my heart would have stopped within a week due to low sodium high potassium. Not me, but it's this thing my dad used to tell my sister and I. My dad served during the Gulf War and said he had to work on a guy whose head got ran over by a tank. What happened was a Marine fell asleep against the treads and the tank drove over him. Guess the fact they were in a sand and wearing a helmet saved him, but only barely. My dad said the guy was still incredibly messed up. He never went into specifics. My old roommate's wife came to our apartment one night after working in the air. She is an NP now in a practice, but she worked in a hospital for a while. A patient had jumped off his 3rd-story balcony and landed in a bush and was totally fine. So naturally, he tried again. The second attempt, a branch got lodged up his butt. When they removed said bush from his butt, he lost the elasticity of his sphincter muscles. The man will never be able to not crap for the rest of his life. I'm fairly certain they can give you an artificial sphincter now. Not a doctor, but late last year, my dad went to the hospital early in the morning with terrible stomach pains, thinking he had a bad ulcer. My mom called me at 7 AM to tell me he had had a heart attack. A couple hours later, after an angiogram, the doctor tells us that he has multiple artery blockages, including the LAD, commonly called the Widowmaker. He has probably been having heart attacks for years, and he has just shaken them off like it's nothing. He had a quintuple bypass at 8 AM the next day, and he is almost totally recovered. We are looking forward to going to a theme park this summer and riding roller coasters with doctor's approval. My grandfather is a medical anomaly. His doctors hate him so much. He cut out a cancer lump with a pocket knife. I was like 9 and held paper towels. Cut his thumb in half. Stumpy. Then the pointer on the adjacent hand, the long way. Looks like a claw. Cut a hole in his middle. I was young and helped clean and bandage. Survived a stroke. Has a brain aneurysm, a hernia, and like 4 teeth. He's a frickin' mess, but still kickin'. My grandma was similar. Had aggressive skin cancer and bought carbolic acid from the vet and would burn it off the man. Then we cut and debride until we got to healthy bloody tissue. Like more than 20-30 times I helped her as a small kid until I got to be a teen and refused because I was scared I'd kill her. Just thought of a case I had while working in stroke rehab. Not a doctor, but I saw her scans. Like 60-70% of her brain is gone. The woman had a headache years ago when she's in her 30s. Went to the ER and doctors told her it's a flu, gave her painkillers, then sent her home. Needless to say, it got worse. She went to the hospital again after at least 24 hours. Think she waited 4 hours in a bed before getting an MRI, and by then, according to her family, she's already not that conscious. The doctors said it's a small hemorrhage that bleeds slowly and the tear got bigger. She got emergency decompression and clot evacuation, but it's still 36-48 hours too late. She lived because the op saved her brainstem, and her family is well off enough to afford care staff and continuous rehab. But her mentality is like a baby and she could not even sit up. Sometimes I wonder if saving her life is the right thing to do. I was very early in. This kid hit up a convenience store near the hospital where I was working. Killed 2 people, one a kid. He had been beat to crap, shot, and wrecked his car. Thanks to the magic of CCTV and video monitors, it was all recorded. That was his last free day. My job was to get him in and out. We go him up and running. And the real hard part was seeing a 19-year-old realizing life as he knew it was over. He made his choice. Dang though. This was last October. I am a medical student. I had a patient who was 103 years old hospitalized for sudden loss of consciousness. She woke up next morning, discharged 4 days later. She just had a hypoglycemic attack. She is a retired nurse who worked during World War II. Not a doctor. Former EMT. One time got called to a guy who had been stabbed in front of a bar. 30 odd wounds. Face sliced halfway off. Bowels out. Sucking chest wound. Impossibly severe bleeding. It was an absolute mess. Dude apparently survived. 3 days-ish later, different guy walks out of a different bar and trips on a curb and hits his head on a patio table. Talking to us on the way to the hospital. Dies 2 hours later from a brain bleed. Sometimes you just don't know. Nurse here. Took care of a man who had a platelet of 4. Yes, 4. Minimum is 150,000. I was literally surprised he didn't bleed to death from just turning in bed. Had to send him from nursing home to the hospital at that point. Then he came back and still had platelet of 4 when labs was done a few days later. Out he went again and came back. Did labs and platelet were 3. Sent him out again. He finally came back and was admitted to hospice. He had this rare form of thrombocytopenia, and while platelet transfusions were given, they didn't help much. I was amazed that those 3000, 4000 platelets keep him from bleeding out that long. Him and his family were very nice though. Forgot about the 10 circumflex 3 units. I had an adult patient who was missing the right half of the brain. He had a severe brain injury, likely a stroke during infancy. Infant brains are amazingly plastic. They do a great job in recovery. He had mild to moderate cognitive impairment. I saw him when he was in his 40s. He got a CT scan of head for some unrelated reason. I had a similar reaction to most of you around. Then I remembered. Brain is brain. It's weird. I know a dude with only half a brain. He's totally normal. Cardiac surgeon here. Had this happen twice. It's called an infarct aneurysm. After a severe heart attack, the dead heart muscle balloons outwards with every beat. Not completely compatible with life with progression of time. What was shocking was, the aneurysm ruptured in these 2 patients and was resealed by the pericardium spontaneously. It was literally a hole in the heart wall on the outer side being patched by a thin membrane. Ticking time bomb. One of the patients got operated, is now fine. The other one refused surgery. He walked home. Not a doctor, but my cousin was in a terrible motorcycle accident a few months ago. She had to be life-flighted to the hospital where they found out her ankle was broken. Her hip was shattered. I believe there may have been a tear in an artery somewhere, and the big one. She was internally decapitated. She was rushed into surgery to reattach her skull to her spine, and they had little hope she would ever walk again. It's now been less than 6 months and she's back to work as a nurse. Internally decapitated. WTF. Nad, a nurse. Guy walks into the ED, has huge long dreadlocks. Tells the trig nurse's neck is a bit sore. She asks where. He pulls aside his dreadlocks and there's a knife sticking out of his neck. Next, in the OR, 18-month-old had fallen from a change table. Open up his skull to pull out a ginormous hematoma. I peer inside and say up, where has his brain gone? I had been completely squished by the clot. They leave part of the skull off to account for swelling and put a huge piece of tape over it saying do not touch. No skull. The next day he is sitting up in the PICU having a nice bowl chatting to his parents. Kids, there is no way an adult would ever be remotely the same. I almost died 3 times while being a kid. First for illness, second because I had the bright idea to eat a poisonous office plant, and third because I managed to fall from the stairs cutting somehow my left wrist. All when I was 2-3 years old. As a bonus I could add a 4th time, when I had my sister saving me by catching me from the heels while I was going to fall off a window after my attempt to call the dog outside. I still ask myself how TF I managed to stay alive for 27 years. My mom once walked into the kitchen, and there was toddler me, happily munching on a broken jar. Apparently there was blood everywhere and I was just chillin', eating glass. Another time, I ripped out my entire ponytail, on purpose. Toddler me was an idiot. Maybe all toddlers are just dumb. My dad had aortic stenosis, which was so severe he had been fainting and falling. He left the hospital he was in because he wanted to go to the cardiac surgeon who had done his triple bypass 5 years earlier. He left the hospital on a Friday but made it apt on the following Tuesday. I went with him. We took the train into the city. My brother met us and wanted to take the subway, but I saw my dad was really winded, so we grabbed a taxi. When we saw the surgeon, he looked at my dad's scans and said, "How did you get here today? You took the train? Are you kidding me?" His stenosis was even more severe than the size they normally operate on. I think the surgeon was surprised my dad didn't drop dead on the train. Not a doctor, so a little shaky with medical terms. But you might be interested to hear about my grandmother. When she was 36, she had a debilitating brain aneurysm. She spent almost 100 days in the hospital, during which time one of her doctors just shrugged at my grandfather and said, "I don't know. Her heart just won't stop beating." A few years later, she had a stroke that paralyzed the right side of her body. She's been mentally handicapped and in a wheelchair since then. A few bouts of pneumonia here and there. When I was in high school, she got diagnosed with breast cancer, had a single mastectomy, survived. 2 years later, colon cancer, also survived. She's now 72. And a few months ago we found out she had bone cancer. She had surgery to plate her left femur because it was almost entirely eaten away, and since then she's been on a slow decline. We put her on hospice care a week ago and are preparing for her to pass peacefully, but it's like her doctor said, this woman's heart just won't stop beating. TLDR. My grandmother has survived everything. Not a doctor, but I met a few and curiosity gets the best of me, so I always ask, "What's the most freaked out thing you've seen?" I was hitchhiking across Canada, and this doctor picked us up, so I asked once again. Buddy said it was an inmate they had to have on suicide watch. He kept swallowing razor blades. Once he got cut off, no pun intended, he just scrounged in his crap to eat the ones he would pass. I was caring for a patient on the med-surg floor in nursing school whose kidneys were basically non-functional. His bun and creatinine were through the roof. I'm fairly certain his CR was in the 60s, and his GFR was 3. GFR basically shows how well your kidneys are filtering and is supposed to be above 60. This guy's weren't doing crap. I asked my instructor what kidney levels were supposedly fatal, and she said that before that day she would have said this guy's levels were. The guy was refusing dialysis too. The nurses made it sound like they had tried to educate him, but when I went in there and asked him about it, he sounded very unsure and said his main reason was that some of his friends said not to do it because it sucks. Found out those nurses actually just sucked and didn't educate him at all. So I told him, "I really think you need to at least talk to the doctor about that option because it is probably going to be necessary for you." I hope he took my advice. He wasn't there when I came back the next week. Not me, but a story from a friend. Patient came in having been bleeding from her anus for 2 weeks. Not, "Oh, there's a little blood in my stool when I poop." Actively dripping from her butthole to the point where she had to wear a diaper all day every day. She fainted 3 times from loss of blood, and only after the 3rd time did she think this might require medical attention. 2 years ago I fell 12 feet off a ladder. I had a fractured C3, brain bleed, concussion and 13 broken ribs. I walked out of the hospital 3 days later. My C3 is still fractured. My body built a bridge of bone to protect that area in my neck. Not a doctor, but I was a hospital chaplain. We had a guy come in on ice. He'd had a cardiac event and fallen off a roof he'd been working on and had been mostly without a pulse for nearly 40 minutes. We'd prepared the family that there was almost no chance the guy would make it at all, but the docs managed to keep him alive and he got a heartbeat back, though he was still in a coma. Docs told them he'd probably never wake up. After about a week and a half he did. Docs told the family he might be able to move his eyes around, but he would likely be so damaged he'd be able to do little else. Long story short, after 40-some days in the hospital, the guy walked out under his own power, with some aid for balance, speaking some Spanish and English again. Don't get me wrong, he wasn't back to normal and had a long way to go, but every single person on the medical staff agreed he had absolutely no business even being alive, much less that. Consensus seemed to be it just wasn't his time yet. Not a doctor but pharmacist. One patient heavily addicted to sleeping tabs and codeine. When I saw the full profile from the 6 pharmacies she got medication, she received 680 zolpidem in 1 month and 16 bottles of stop and ice still pain syrup. Don't know how she kept standing straight and lie straight to my face. Not a doctor. This is from when I was a patient at a hospital myself. So I was walking around with my crutches to sit outside when this man came to sit next to me and started a conversation with "How come you're using those crutches? They're awful. I left mine in the room." He went on to tell me about how this was his 6th total hip replacement surgery because the doctors always screw up, and under no circumstances did he want to consider that maybe, just maybe, he's screwing this up by not listening to the doctors. Sure, this wouldn't have killed him, but dang, I was shocked at how dumb people can be. Not a doctor, just a witness. 2014 on patrol in Afghanistan. Our platoon leader stepped on a pressure plate IED with the IED buried a few inches to the side of his foot. A big blast launched him to the side about 10 meters. The guy next to him back 5 meters. And another soldier nearby 3ish. Somehow nobody lost any life, limb, or eyesight. Those 3 had severe concussions essentially, and quite a few of us had minor ones. Best theory as to why they survived is the bomb planter dug it slightly too deep into the ground, causing the fragmentation to get buried and a lot of the concussive blast to be buried as well. This will probably get buried, but I still think of that blast and question what the heck happened. If you are new to the channel, you can subscribe. I publish new videos every day. Physicians of Reddit, what's the worst injury you've seen at a routine checkup? Not a physician, just a medical student. We had a guy come into our neurosurgery unit after he crashed and fell off his bike. After the fall he got up and felt fine and his bike worked, so he got back on his bike to ride 12 miles to his friend's home. When he got there he felt a bit of pain in his neck but thought nothing of it, and he rode on his bike again all the way back home. So good 30 odd miles. At home, he told his wife about the fall and she made him come into the A&E for a checkup. He had no visible trauma marks on his face or neck, but long behold, CT scan showed a atlanto-occipital joint dislocation. To this day I don't know how he managed to bike all those miles without noticing anything. One of my friends ended up writing up his case and presented at a conference. July 5, man fell off his bike, thought nothing of it and kept on riding his bike, only to find out later in the day that his skull and body weren't attached together except for the soft tissues, that is, spine and muscles etc., which could easily tear, resulting in instant death. Nurse here. Patient comes into outpatient clinic for a checkup post-surgery. His background: he got thrown through a plate glass window in a bar fight, slicing off his ear. Instead of reattaching it right away, they made a pocket in his abdomen to hold it for a couple weeks so it could revascularize. After they reattached the ear, they sent him home for a week or 2 before his next appointment. So he comes back for a follow-up. The ear looks great, but the incision on his abdomen is really red and swollen. Patient admits that he has gone surfing a few times since he's been home, despite us telling him not to. Doc presses on his abdomen, and a bunch of smelly PC water shoots out his incision. Patient's response: "Can't keep me out of the water, mate." TLDR. Guy goes surfing after surgery, gets seawater trapped in body leading to mega infection. Well, I'm not yet a medical professional. I'm actually a nursing student, but I had a large portion of my practice time in the emergency room. Anyway, we had a guy come with a shirt covered in blood wrapped around his head. The guy claims he was walking down the side of the road when someone threw a metal pipe at his face. I got a PA to remove the shirt so we could have a look. Turns out the pipe hit him right over the eye, breaking the frontal and zygomatic bone, rupturing his cornea and his retina. He also ruptured a bunch of blood vessels to where the accumulated blood was causing a constriction on the nerves and blood flow to the eye. Nurse here. I work in eye surgery. We had a 17-year-old come into the clinic for an exam BC. He was having trouble seeing the board at school. He has a detached retina. Strange for a healthy teen. They send him to our retina specialist, who realizes that this is an old injury with scarring. He and a friend made a potato gun. When it didn't fire, he looked down the barrel. It blasted his eyeball. He was afraid he'd get in trouble, so he told his parents he got a black eye roughhousing with said friend. He walked around for almost 2 years with a badly damaged eye. His vision will never be 100% BC. He waited so long. I went home that day and drove home the point to my boys that they would never be in trouble for coming to me when they get hurt, no matter what stupid idea they were executing. Had a mid-20s girl attend DEPT with a chest infection and generally lethargic, had her leg up with multiple bandages and sports socks over it and smelled terrible. On removing all of the dressings I found the remains of an external fixator used for treatment of her ankle fracture. She had never attended any follow-up after being initially discharged and used pliers to take the fixator apart. Pus leaking everywhere. I touched one of the screws and it fell out her leg. The ankle felt like jelly, no bone strength at all. She went straight from A+E to theater for amputation. Dermatologist here. I had a pleasant little old man come in for a routine skin examination. He had a large gauze pad on his right face that I, of course, asked about. He told me that he had a bad sore there for several months and he was treating with some Neosporin and wound dressings. I asked to look and underneath found a profoundly eroded portion of his face spanning from the right temple to the right lower jaw. I noticed a very clear visualization of his right zygomatic bone, masseter muscle, and trigeminal ganglion. For those non-medical folk, these are some very important deep structures. I also noticed he had facial weakness on his right side and speech slurring, which made it clear the nerve was significantly affected. He had no history of a stroke, so that was the only thing that made sense. What made this worse is that upon closer inspection the patient had several maggots and a botfly living in his face cave. I could see them wiggling right in front of me. When I mentioned it, the patient said, "Yay, sometimes I can feel something crawling around in my head." Otherwise, he had very little pain. He was more annoyed that it continuously wept. For those questioning, this is an extreme manifestation of advanced basal cell carcinoma. The only option was radiation, which made the sight much worse. As of now, I think the patient is still alive, but it's only a matter of time before this does him in, or at least contributes to a very slow, very miserable downfall. Gratuitous plug. Get regular skin exams. Not me, but my mentor. He just graduated from optometry school the year prior, and he was in private practice when an older gentleman came in complaining of discharge coming from his prosthetic eye. Now, immediately he smelled a little off, but sometimes that happens when the elderly don't keep up with hygiene. Upon further questioning, color of discharge, how long has this bothered you, etc., my mentor asked when was the last time the prosthetic eye had been removed and cleaned. The man stops for a moment and says, "Well, I was discharged from military service at the end of World War II back around 1945, so this exam happened in 1986. This man has left a prosthetic eye uncleaned in his socket for over 40 years. You are supposed to remove and clean the prosthetic eye at least every week. When he took it out, there was a loud pop and the entire socket was oozing with green and yellow discharge. The smell instantly permeated the entire office, and it reeked for the next 2 to 3 days. Safe to say the other workers didn't want to return the next day because the smell was so overwhelming." Family medicine RN here. One time a patient of ours checked in a half hour late for her physical appointment due to public transit issues. Because of how late she was, the doctor wasn't able to see her, so she rescheduled, but she mentioned she had a question for the nurse if one was available. I brought her into an empty exam room and she told me her urine had been a funny color for a month or so, a brownish orange she had never seen before. No other symptoms whatsoever, just the color change. I had been at that job for about 2 years and the docs trusted my instincts, so I told her I could send in orders for some lab work and see what was going on. I ordered a simple urinalysis and urine culture and a CMP, complete metabolic panel, basically a battery of kidney and liver function tests. Several rounds of testing visits, a CT scan later, she was diagnosed with pancreatic cancer and given 6 months to live. I work as a surg tech in women's surgery. I have 2 stories. One, had a patient come up from the ER with what we thought was a pretty simple ectopic pregnancy, when a fertilized egg begins to form in your fallopian tube instead of the uterus. Doctor decided to do a laparoscopic approach because we thought it was caught in time and her bleeding seemed minimal. After placing our camera inside to look around, we found out that she had 2 ectopic pregnancies in each tube and an appendicitis. 2. patient came in for a simple laparoscopic tubal ligation. Placing our camera inside, we found out that most of her large intestine had become wrapped around her uterus. Adhesions. The doctor took one look and said, "Frick no, I am not doing this here." She needed to go to a main or that would be able to handle the 3-5 hours of surgery that she would need done. TL. DR. 1. Ectopic pregnancy turned into 2 ectopic plus an appendicitis. 2. Came in for no more babies. Left with a consult for a longer procedure. I broke my friend's orbital cheekbone in 3 places. He didn't go to an because he was a hockey player and there wasn't much for swelling. He lost feeling in half his face a few weeks later and lost muscle control on half his mouth and his eye drooped. He had an MRI done later that day and the bone had pushed back on the nerve bundle as well as against the ocular nerve. He has partial blindness now and regained most of the feeling to his face. He was drunk and wanted to box someone and karma won. I had the half facial paralysis happen to me spontaneously. Went to the ER because WTF, that doesn't happen without some kind of injury starting it. It does happen. Bell's palsy. That was a bizarre couple of weeks. My dad almost fainted. He called in sick and slept in all day. The next day he was still weak, so he went to the doctor. Turns out he had a heart attack that also tore a hole in his heart. This is almost always fatal. It was caused by a blood clot. The blood clot got stuck in the hole and saved his life. He was in a special hospital for months hooked up to a machine that pumped blood for him. Not me, but my ex is a nurse and they once had a patient who came in with some stomach pain. During the examination he mentioned he was also having some shoulder pain for a few months. They looked into it and it turned out most of his shoulder had been eating away or was otherwise heavily infected with cancer. He died a few months later. Years ago my boss went in for a routine checkup and was immediately put in for emergency heart surgery. Surprise. Major heart blockage. Could have killed her even though she felt fine. Not a doctor, but once I went to the neurosurgeon with neck pain. Have a cage in my lower lumbar. And they found that I was walking around in the world with my C1 in my neck broken in half. I rated my pain a 3. To this day, I don't know how or when it happened. I am a physician. Patient came into the clinic to get a second opinion of his scalp injury that he got in September. He is a mechanic and had hit the top of his head while he was under a car. Scalp lacerations tend to bleed a lot due to the vascularity of the scalp, so he was initially told to dress it regularly and it would stop. Well, it did not stop bleeding and the laceration seemed to get bigger. Now he sees us in December for this continuously bleeding wound. What started with a 4 cm laceration had evolved into this massive 10 cm gash just above his left ear. It just oozes bright red blood. The skin around the wound had become black and purple. It was obviously abnormal, so we biopsied it. It turns out that it was aggressive angiosarcoma, cancer, which has a very poor prognosis. We are planning a massive surgery to excise about 1/3 of the skin on his scalp. You need to get clear margins. So the excision is much larger than the lesion, as well a major reconstruction with skin grafts. This treatment is primarily palliative, that is, not curative. This will buy him a few months, but we can be sure that he has already metastasized due to the nature of the cancer. So, what started off with a simple laceration turned out to be terminal cancer. He likely already had this cancer brewing in this area, but the injury made it obvious due to its inability to heal. He likely has less than 2 years to live at this point. When I was around 12 years old, I had to have a root canal. After the drilling and procedure was complete, the dentist was cleaning out the newly drilled hole in my head with a toothpick-like swab. When I left the dentist, I told my mom I'm pretty sure the dentist forgot to take that swab out. She assured me he wouldn't forget that. 3 years later, at a new dentist, the x-ray revealed a toothpick-like swab in my head. Another partial root canal to remove it. I worked as a doctor in rural South India many years ago. I was visiting a friend in the village when his dad walked out of his house. Something told me that, while this man had no complaints, or attributed all symptoms to old age, he did not look good. I felt his left supraclavicular fossa, area above the clavicle at the root of the neck, and promptly felt a hard swelling. I advised my friend that his dad needed a checkup. In less than 6 months the old man was dead from gastric cancer. The hard nodule in left supraclavicular fossa was a lymph node to which the cancer had spread, is known as the sentinel node, the lymph node that points to a cancer in the stomach. During routine checkup, once examined a young lorry driver, 30-40 years old, with vague abdominal complaints. On examining him, his liver was enlarged and felt lumpy around the edges. Performed an ultrasound scan on him and found extensive metastases all through his liver. He developed jaundice and died in a couple of months. These findings were not really expected, and stand out in my memory after 15 years. My mum is an orthotist, works with eye doctors, and she told me about this one experience of her co-workers where a lady came in with a large hat and very dramatic hair. After being practically forced to remove the hat for an eye check, the co-worker was horrified to discover that the skin on her forehead and hairline was kinda melted and dripping down towards her eyes, which is why she was having eye problems. There was a large patch of her skull visible. Her son just shrugged and said that it started a few years ago and they just never got around to getting it checked out. Not a physician, but the patient. Went in 4 night terrors and a high fever after swimming in warm stagnant water. I'm an idiot. Sent to her for possible brain-eating amoeba. 1 spinal tap later, test came back negative. Unfortunately, spinal taps hurt like a bee after. You can't move your back because it hurts so stinking bad. Also unfortunately for me, I caught the stomach bug from the hospital as well. So for the next 12 hours I had to bend over to throw up, scream from the pain, and choke on my own vomit until I finally got it all out. Worst 12 hours of my life. Not a physician, but as a 15-year-old I sucked up a small piece of rolled up wrapping paper from a chewing gum while goofing around with a friend. I was the human vacuum cleaner. After this thing got sucked up I started coughing for a couple of minutes and got the feeling something is stuck in my throat. Went to see a physician to make sure. He saw nothing and said, if this thing would still be stuck somewhere I would be coughing uncontrollably. Fast forward 3 years later. Due to a chronic pneumonia that I developed, I went to a specialist that found unsettling shadows on an x-ray of my lung. His diagnosis, tuberculosis. Went to a hospital to get a final biopsy to make sure. Received a general anesthetic. When I came back to myself they told me that they found a small object stuck in my bronchial tubes that was the reason for the shadows and the chronic pneumonia I developed. They removed it and I was fine from that point on. The end. This is my dad's experience, not mine. This was not in a routine checkup, but still a good story. A guy came in without booking an appointment and a head covered in bandages. The bandages were drenched in blood. The guy refused to take them off. After much persuasion, my dad finally got this guy to remove them. He had a massive cut cutting his entire face in half, down the middle. One of his eyes was hanging out of the socket. Blood was everywhere. He was a lumberjack, and his story was that he was cutting a log. The chainsaw caught a hard piece of bark and it bounced up and sliced his face in half. The guy lived an hour away and drove an hour to get here. He didn't call 911. My dad forced him to go to the hospital, but the guy said it was fine and he could just walk it off. He ended up going to the hospital. Pediatrician was doing what we call a well child check on a 2-month-old. Mom randomly asks, what do I do when he turns blue? Apparently this baby would randomly turn blue 1-2x a week. Stop breathing. Mother would shake him, also far from ideal, and blow in his face and he would get better. Turns out the baby had Brugada syndrome. MS3 here. Had to admit a patient for my internal medicine rotation. His chief complaint was I tried to take off my shoe and my foot fell off. Guy had terrible diabetes and his foot was literally in his shoe and you can see bone on his leg. He didn't feel a thing. I will never forget that odor. My dad has always had issues with his urethra. I don't know the specifics, but he's had surgery around 20 years ago and had to occasionally put in a catheter to keep things open. So, he goes into the doc because he wants to get it checked out again and they say they need to do some minor surgery. This wasn't unexpected so he says fine. That works, move on. He starts going through the motions of getting things prepped to get the surgery done and they pull some blood, notice a high white blood count. I think it was white blood count at least. So they start doing checks for WTF was going on with his blood. Unfortunately, they find that he has a mass in his colon. Docs do a biopsy and find that it's cancerous and they need to do surgery on it. Well, crap. For this one, they need to do a stress test to make sure he'll survive the surgery. 5 minutes into the stress test, they stop him and he's like, wow, that was quick. I was expecting to have this go on for a while, to which they responded, we had to stop it because we thought you might pass out or have a heart attack. Medical folks do some tests and find that one artery is 100% blocked and two are around 80%. How he didn't have issues beforehand is beyond everyone. Dad overworked himself, worked a full-time job, volunteered, managed his local American Legion post, was an alderman for the city, and helped as a mentor for a few local non-profits. It also looked like he had had multiple small heart attacks in the past, which he either didn't notice or just ignored, either of which is pretty crazy. Ended up having to have a triple bypass, back to work 2 weeks later, and then had the cancer removed the following month, which was all followed by chemo. I was the dumb patient. Where I work we have a huge slide, one with sleds that roll down on skateboard wheels. It's basically a snow sled with a board and some wheels on a track about 150 feet long, meant for kids and adults to ride on. One staff member up at the top to keep things orderly and help with pushes. One staff member at the bottom to clear lanes and make sure no one gets run over. It's a ton of fun. The kids can run up and down the hill all day, but also kind of unsafe. After all, it's basically a few teenagers in charge of a homemade roller coaster, and we've had a few injuries before. The worst, until me, was a sprained wrist. Anyway, I was at the bottom on a rather slow day, just standing around because the kids were big enough that they were clearing the lanes for me. I saw the sled coming down with no rider. Someone had let it slip. So I stick out my leg to stop it and it slams into the middle of my shin. I didn't feel a pop or a crack or anything. Just a solid thunk and then some hobbling around like I hit something in the dark. Few weeks later, I've got a bump on my leg from the stupid sled. Mentioned it to the doc during my physical. Touches it, feels the lump and asks if it hurts. Only when someone touches it ached. It was a cracked bone and it healed lumpy. Never went to the follow-up because it stopped hurting. Probably not the worst thing to have walked in during a routine checkup, but hey, compared to a cold or strep throat, a cracked lumpy bone is pretty interesting. Not a routine checkup, but there was a patient who was checking in the morning of his planned nephrectomy, removal of his kidney. He said, I slipped last night and I think I broke my ankle. Go to examine him and he has an open fracture, bone sticking out of his skin. He ended up getting emergent orthopedic surgery and had his nephrectomy delayed. No idea why he waited until morning for that. I am an internal medicine resident, and had a lady come in during my intern year for what she thought to be an asthma exacerbation. She smelled strangely. Thankfully I asked her to take off her bra to assess her breasts. Turned out that she had a fungating right breast mass and suspicion for meds lung on x-ray. PT was covering mass with tissues and said she thought it would go away eventually. Invasive ductal carcinoma stage IV. She was in and out of hospital for 1 year 6 months since her right lung contained a loculated pleural effusion and the lung had become so fibrotic SP multiple thoracentesis that she was constantly dyspneic and just recently passed away. Not a physician, but a nurse. Guy comes in for routine testing his primary physician had ordered. I'm checking him in and he asks me to please not put a blood pressure cuff on his left arm, because it might be broken. I look, and although I'm not in orthopedics in any way, it looks like it might be broken to me. It's purple, swollen to twice its size. Looks like he very possibly has a fractured ulna. Turns out he was cutting wood in his garage the night before, pushing it into a saw. Somehow a piece snapped back and hit his arm. Instead of seeking urgent or emergent medical attention, he decided to come to his appointment with us as usual. We ended up cancelling his appointment because the procedure we do often involves blood thinners, which could be a major problem for his situation, and sending him to the ER. I still chuckle when I think of that. Just his casual manner about the whole thing was very funny. When I was 14 I woke up with a puffy eyelid. My dad takes me to see the doctor, but a nurse was the only one available. She said I must have gotten into some weeds and had an allergic reaction. Here, put this cream in her eye. About 2 hours later I wake from a nap in agony and a temperature up to 102. Mum calls the clinic. Same nurse tells her to rinse my eye and I'll be fine. By that evening my temp was up to 104. I was having delusions. Still remember being on a boat with literary characters whose books I had been reading when they were told to get me to a walk-in clinic. Walk-in clinic turns us away to the all while I'm puking in the backseat of the car. I end up with MRIs and CT scans and a team of infectious specialists. Turns out I had an abscess in my sinus cavity which was pushing my eye out of my skull. My lid couldn't close over my eye. I was in surgery shortly afterwards and didn't lose my sight, although they were worried. We were doing a medcap operation in Baghdad, basically free healthcare from the army for locals, and this older guy comes hobbling in and says he's got fever chills, and his leg hurts. We ask him to lift his disdasher, long, sort of like a dress but not really, so we can't take a look at his leg and it's 100% gangrenous from the toes up to his knee. Turns out he got an infected wound in his foot and it spread nearly all the way up his leg. Sent him to the local hospital for surgery and they cut most of his leg off. Dude survived though. Some was tough as nails. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now. Doctors, medical examiners, morticians of Reddit. What is the weirdest anomaly you've ever found in a body? I worked in medicine as an X-ray tech medical assistant. One day we had a patient come in complaining of a stomach ache. Considering the time of the year, it wasn't an abnormal complaint to have come in our family practice. So we run him through the normal test, urinalysis, and an abdominal X-ray, cub for those medically inclined. Well, he was a shorter fella so I had a lot of room on the film. This kind of X-ray is one large shot centered on your belly button. It's mostly used to see how full of crap you are. I went to the dark room to process his film when something weird could be seen near his butt. There was definitely a lot of poop backed up but I couldn't tell what was causing the blockage. I showed the doc the film and she busted out laughing. The doctor I worked with was usually stone-faced and serious about these kinds of things. So it was odd. We were all confused. She asked me to go into the room with her while she asked him some questions. The first thing she asked him was what he shoved up his butt. I was so taken aback by this statement I almost missed what he said. You see, this 40-year-old man has diarrhea the week before and decided to shove a tampon up his butt to stop it. He tried to take it out but the string got caught, and then he simply forgot about it. We had to remove it. It was disgusting, and I never did another procedure ever again. In my anatomy lab, my group's cadaver had died from systemic complications of stage 4 lung cancer, and when we got to the lungs they were too rock hard, necrotic blackened masses that look nothing like the other cadaver's pink and spongy lungs. My anatomy prof took one lung out and wrung it, resulting in this putrid black goo flowing out of the lung. As he was draining the lung, he mentioned in an Indian accent, This is what happens when you smoke." Heard a story from a urologist when I was in medical school about a guy who came in for a vasectomy. During the procedure, the urologist has trouble finding the vas deferens, so he orders a few tests. Turns out the guy has bilateral congenital absence of the vas deferens, CAVD, but the guy had 3 kids. And Lucy had some splaining to do. She isn't dead, but this week I saw a patient with endometriosis in her lungs. Somehow, womb lining cells had traveled to her thorax and colonized on the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung, and a few weeks after that, 3 successive pneumothorax, collapsed lung. The womb cells had tried to shed and made a hole between the airways and the sac surrounding the lung, letting air escape. She's deciding now whether to let the surgeons cut out the part of her lung with the endometrial cells to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. That's like something out of an episode of House. Wild. I was a combat medic in the army. Not super uncommon. About 1 in 10,000 people have it, but I had a buddy with citizen versus. All of his major internal organs were reversed. Heart on the right side instead of the left, for example. As soon as he got to the unit, it was the first thing he told me. Wanted to make sure if he got hurt I wasn't curious as to why he had no heart, I guess. Had to look up the name and how uncommon it is, because it's been a few years since I got out and he's literally the only person I've ever met like that. I was honestly surprised at how common it actually is. I figured it'd be more rare. One of the cadavers in the anatomy lab my first year of med school had previously undiagnosed citizen versus. Super interesting but not a great way to learn standard anatomy. 3 golf balls in a man's stomach. His cause of death was lung cancer. Still trying to figure out how he ate golf balls, how long they were in there considering he was on life support for 2 weeks before he died. Apparently there's a new type of golf ball that rolls into the hole if you get it within 4 inches of the hole. He probably just tried to keep them in his back pocket. During an autopsy, we found a plastic shamrock that was about 3-4 inches big in some guy's stomach. Another guy had the biggest piece of steak in his throat. Cause of death was obviously choking. Pretty memorable to me. I'm a doctor, was working in OT, anesthesiology. An emergency came in the afternoon. Apparently the patient is a fisherman and got into a fight with his fisherman friend. Patient was impaled by a spear gun. The spear entered just lateral to his belly button and came out just above his right hip. He actually held this 6-featuring long spear going through his body and walked into the emergency room by himself. When it was time to put him under, he wasn't scared, anxious. He said, "Just fix me up so I can go find that guy." Friend. I don't think that word means what you think it means, LOL. I was a nurse for the year and a dude came in with a big vibrating corn cob stuck in his butt and it was still on and we had to wait for the batteries to die before we could even do anything. There were 2 big DD-sized batteries. He was there for like 3 hours laying on a table butt vibrating. Not a pathologist, but I work in a coroner's office. On more than one occasion we have directed a post-mortem on someone who has died abroad, often due to heart-related issues. I once got a phone call from the pathologist after he had opened the body to examine the heart. This person died from a heart attack. Yes, apparently so. You want me to examine the heart? Yes please. Where is it? Some other countries routinely remove organs when they are determining a cause of death. Then the body is embalmed and sent back to their home country. We still often have to confirm the cause of death, so I've spent a lot of my time chasing missing organs around the world. That job sounds like a great premise for a TV drama. Worked in a funeral home. Had a friend at the medical examiner's office. A father was thought to have died of a heart attack and he came to our funeral home. Next morning, the pathologist comes in and looks at the notes. Calls us in a panic. We rush the body to the medical examiner's office. A few weeks later, I ask my friend what happened. The guy was actually murdered and was shot. I thought this was gonna end with the guy still being alive. Had a kid, anus imperforate, not that uncommon. Basically, his intestines ended in a blind pouch. What was odd though, is that his genitals were rotated. When you took off his diaper, the scrotum sat on top. The dong was under it, pointing back. A fair number of cloverleaf head kids. An omphalocele that contained all of the large intestine, the liver, part of the small, and part of a lung. I am Ped's nurse. I didn't know a person could be born with rotated genitals. That's really interesting. I work as a statistician in a major hospital, so I see and catalog a lot of weird things. Worst thing I'd seen was someone come in complaining of leg pain and showing signs of septic shock. After examination, doctor orders scans and there's 2 metal rods, one in each leg, that weren't on their file. Turns out the patient has been to SC Asia to get a height-altering surgery, and the doctor had used items you'd pick up from the local hardware store to fix the bones after breaking. After extensive surgery, patient lost the lower part of one leg and was lucky to keep the second. I saw a patient with endometriosis, lining of inner uterus cells, in her nose, meaning that she would get epistaxis, bleeding from nose, every month or so related to her menstrual periods. I was a mortician for a religious organization, and I have to say that the butt plug conundrum of 2013 was among the more difficult issues I've faced in the field. A dissident arrived in my morgue with a bejeweled butt plug firmly in place within the rectum, which led to a very interesting issue. If the family had known that the deceased was likely to have had such an item, we'd be screwed if we didn't list it amongst personal effects to be returned to the family. But if they were as vanilla as most of the relevant religious community claimed to be, such an item would probably be considered a slanderous perversion. Fortunately, my boss was a member of the relevant clergy, so I simply removed the item and popped it into a biohazard bag for him to decide upon. I actually don't know what decision was reached, and alas, that boss has since shuffled off the mortal coil himself. Not me, but my boyfriend's mom is a doctor for people with special needs. One of her patients, an older man with Down syndrome, among other diagnoses, appeared to have extreme abdominal pains that lasted for weeks. They did several tests and tried some medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his trouble remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then suddenly one afternoon, my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens while she's not on duty. That this man had finally been able to go to the toilet, and among some stool was a blue latex glove. Over the following days he passed about 20 of these in total, and he felt better and better and luckily started eating again. Most likely he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing, seeing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like little poop balloons in his stomach. This really is one of the weirdest stories I've ever heard, but my boyfriend's mom said he had been known for eating weird stuff, like this one time he ate a t-shirt. TLDR. Man experiences abdominal pains, unable to crap and stops eating. After nearly 2 weeks of this, he starts crapping blue latex gloves filled with poop and feels fine again. My grandmother has 2 stomachs, like a cow. Her doctor asked if he could publish an essay about this, and she agreed. I have searched and searched and never found the actual article, but it's still pretty interesting. She is like 5 feet 2 and 100 pounds, so no, she isn't overweight or excessively hungry. She also found out she was pregnant with my mom after having a tumor removed from her stomach. We joke that they left the tumor and took my mom out, because she's kind of a human cancer, lol. Whoa, that was a roller coaster of a read. While working as a pathology tech, I began the post-mortem inspection process so the pathologist would have everything ready when I called him. The deceased had been admitted to have a bowel resection and later passed. When I opened him up, the entire body cavity and every organ was covered in small tumors. Everything. I called the pathologist and he said he wasn't ready yet and asked how I had completed all the necessary steps so quickly. I simply said, I'm barely past the Y incision and I'm not comfortable with going any further until you get here. Not a doctor, but my brother and I were the first for my mom's doctor. My brother and I are twins, but I was born a month premature. My brother was actually a few days overdue. My mom got pregnant with my brother and a month or so later she got pregnant with me. Her body released another egg despite her already being pregnant. Because of the way we were conceived, my brother shoved me up under our mom's ribs. Her heartbeat concealed mine. So a month before my brother's due date, the doctor finally realized that there were 2 of us. This was in 1985. Ultrasounds weren't nearly as good as they are now. Forgot to mention that I'm female. Another sort of rare occurrence. And I was born breech. My mom told me that the doctor had to pull me out because I wasn't coming out on my own. To add to my mom's luck, I was sucking my thumb into her quite a bit because the doctor didn't realize my elbow was sticking up. Luckily for her though, my brother had already been born. My Sil's mother was pregnant, had a miscarriage. Not sure of what happened if she passed the fetus herself. but for weeks afterwards she kept insisting there was another baby. Had to go for endless mental health assessments, since everyone thought she was just having a bad go of grief. Turns out, she was still carrying another baby, her eldest child, born healthy and happy some months later. First year of veterinary school, we're required to do a dissection on a dog, and can elect to do a cat as well. One of the groups in my class opened up the chest of this cat that had died of natural causes, only to see its heart completely swallowed up by the diaphragm. For those of you who don't know what I'm talking about, the diaphragm is a really thin muscle in your chest that is a main contributor to breathing. This cat was born with a hole in the diaphragm, hernia, and had proceeded to grow around the heart like a little tent, making the heart more pillar-shaped than heart shape, and somehow managed to live almost to adulthood. So basically, the heart was half in the chest and also half in the abdomen, just casually brushing against its liver. Asked this to an emergency doctor friend of mine a while ago. Patient comes in complaining of severe abdominal pain. Nurses take vitals, ask questions, etc. Eventually my friend sees her and, after a few questions, he has her lift her shirt. The severe abdominal pain on the chart was in fact due to a gash so severe part of her intestines was sticking out of her. No one had noticed and she hadn't thought to mention that her organs had started leaking out. In fact, she seemed just as surprised as he was. She was probably in shock. I'm a funeral director. I haven't seen anything too anatomically weird, but I did have an innocent seeming old man with a tattoo on his shaft. Also, we had an obese woman and when we were embalming bathing her, a sugar packet fell out of a fat roll. Just one of those little pink ones. It seemed like it had been in there for a while. Theater nurse here. Probably not too weird, but we started a gastric sleeve on a huge woman, stuck the camera in and she was riddled with cancer. Really weird, she had no symptoms. She ended up losing all her weight without a sleeve. When you said theater nurse I thought you worked at a fancy movie theater in first aid. Google set my uneducated self straight. Siren Amelia, mermaid syndrome. Born about 5 months premature. She didn't make it, and she was brought down to the pathology lab for examination. For those afraid to Google it, it's literally fusing of the legs into a mermaid tail-like appendage. Not too worrisome. IQ nurse here. Had to prep a patient with a rectal ladybits anastomosis, a connection between the vagina and rectum. Every time I would insert the enema into her rectum, all the crap water would come out of her glory hole. I honestly don't know if this is my weirdest, but it's the first that comes to mind. It's sad, but this isn't uncommon with pregnant women who try to self-induce abortions with a coat hanger. They rupture the pouch of Douglas and poop kind of sits there and gets super infected. Not a doctor, but my mother was born with a rare condition that, in 1968, should have killed her. A twin that failed never got fully reabsorbed into her body before she was born, which resulted in a massive cervical teratoma, as in, was crushing her heart and lungs as well as her throat. The only reason she wasn't stillborn was because her mother had a UTI which caused a premature birth by about 60 days, on Christmas. Nonetheless, only one surgeon was willing to even attempt an operation, and he just so happened to be passing through town for a medical conference. Due to the loss of almost her entire thyroid as well as oxygen deprivation issues, she was supposed to be mentally challenged, but she turned out fine. Couldn't put on any weight for most of her childhood and persistent temperature regulations issues. She's always cold, but other than that she's fine. A physician, and I think I've seen almost everything. Really, it's like anything anyone can think that is messed up they have come to see me in the air. Welded dong ring on for a week causing guy to lose his junk. Fingernail polish remover bottle in an 85-year-old man's butt that ended up causing him to get a colostomy. Multiple small celebs on and active, and a lady that said she couldn't reach it. Even a terrible case where I found a big butt square 6-volt battery in a woman's fanny. She came in because she thought her pimp had put an oil can in her because black liquid was coming out. But turns out the moisture caused the battery to make connection and shard the inside of her to crisp. In cadaver anatomy, the woman we dissected was just filled with tumors. That wasn't the way she died. One of her ovaries was basically entirely taken over by tumors. It was really odd to see, and odd that they had apparently never found out until after death. That was the big one. but there were so many weird small things that it makes you wonder what there is weird about your own body that you may never know. Work in theaters with lots of other nurses who have worked in her, and one told me about a woman who came in with a Buzz Lightyear inside her. She had been using it to pleasure herself and the wings had released and it got stuck. Not an anomaly, but my favorite what's the weirdest thing anyone has come in with story. Work in orthopedics. Kid had a fracture, we reduced an office and splintered. After a few weeks with proper healing he's transitioned into a cast. Usually we see them every week and X-ray it to ensure no displacement. First week post cast application as rays show two solid circular objects blocking the fracture. Turns out the 6-year-old was hiding 50 cents he stole and hid from his brother. Not crazy, I know. Just always found it funny how far siblings go to pee off the other. I thought you were going to say that you found that the break was getting worse because the kid was beating the crap out of other kids with his cast. In med school my anatomy group had trouble transecting the dong on genital dissection day. Turns out the cadaver had a dong implant. Two thick braided wires coated in plastic. We couldn't figure it out, but the instructor came by and recognized it immediately, liberating the shaft with a vigorous upward thrust and leaving the implant protruding from the pelvis. He also had some hernia mesh, but that was less interesting. Liberating the shaft with a vigorous upward thrust. That sounds like fancy speak for ripped his dong off. Not a medical professional, but I have one. Bit of background info for clarity. I was born with a potentially fatal kidney condition and had a few close calls in my childhood. By time I reached my teens my doctors were really concerned that I would end up needing a kidney transplant before I even reached adulthood. Now my dad is a universal donor, so he volunteered to go ahead and give me one of his if it would even give me a chance. Doctors were game and he had to get examined and stuff, only to find something really odd and kinda upsetting for both of us. Turns out that my dad was born with only one kidney, so that wasn't happening. Lucky for me I ended up not needing a transplant anyways, but my dad was really upset about that for a while. A few years back I had a woman overdose by shoving 7 fentanyl patches inside of her vagina. I'm a medical death investigator. This was an accidental overdose. People do weird, unfortunate things when they are hooked on sweet lady H. That actually sounds like a not bad way to go. Not in the biz, but my granda went for an ultrasound at 80. His first. Turned out his liver was twice as big, only had one kidney, and his gallbladder and some intestines were all twisted and backwards. But the doctors felt it should have caused problems earlier. They just removed his gull and some other stuff and he lived another 8 years. Not in the biz. Impeccable twist on the old classic knotted doctor butt. 5 stars. Maggots in a guy's suprapubic catheter. They were burrowing around the tubing, and the urologist had to flush maggots from the guy's bladder. None of the above, but a nurse. This made me think of 2 interesting ones. A woman unintentionally dyed her skin blue from her homemade concoction to treat a skin issue. Another woman who, when laying down flat, had one perky breast and one lumpy lopsided one. It turned out she fell somehow and managed to pop her implant. Worked for the local medical examiners for a few years. Got a guy who died at home and wasn't found for a couple days. His cats had snacked in him a bit. Not super uncommon, but still unnerving in concept. In his pockets, found a receipt for cat food. Must not have been fancy feast. If you are new to the channel, you can subscribe. I publish new videos every day. Until then. People who work in hospital, what is the worst thing you have seen a patient go through? Had to take X-rays on a dead 3-year-old who was supposedly beaten to death by her parents. I found partially and completely healed fractures of wrists and ribs, indicating long-term abuse. It'd say she had it the worst even though most of it happened outside the hospital. Word on the street was she had been dead for a day or 2 before the parents even bothered checking on her. I think they shook the crap out of her and caused some internal bleeding, and just left her in her room for a day or 2, then finally checked because she was so quiet. Then they brought her into the air. Good job, guys. Had to testify in court. The dad was just laughing and smiling with his lawyer. She was a really cute little girl. Really messed me up for a while. Then a work colleague had a baby girl and named her the same name as this girl, unbeknownst to her. So I feel like she is getting a second chance with a real mom. I was in my second clinical rotation as a nursing student. We were assigned patients and the patient I was assigned to was a grumpy old guy who was 79. He had a good sense of humor but you had to tread carefully around him. He had chronic pain and was diagnosed with colon cancer. His son would visit in the mornings just in time to talk to the doctors doing their morning rounds. His wife had passed a few years earlier. I was helping him get ready for breakfast when the doctor walked in. This was pretty typical, but he was anxious to see the doctor today as he just had a bunch of tests done and was hoping to hear some results so he could be discharged to go home. I usually just finish up whatever I am doing and leave so that the patient and doctor can talk privately. That morning his son was not able to make it in and my patient asked if I could stay in the room with him to hear everything, in case he missed something. I said sure, no problem, as long as the doctor is okay with it as well. Some doctors don't like dealing with students. The doctor just got right to the point. The cancer had spread and there was nothing more they could do. The palliative team would be coming to meet with him this afternoon to discuss where he could be transferred to during his final days. My patient thought the doctor was joking and started to laugh and then just sat there with a completely blank look. As a student I was not prepared to know how to comfort someone in that situation as it was something I didn't have experience with. I felt awful because 10 minutes before he got this news he was telling me he couldn't wait to see his cat once he got home. For the next week he did not get out of bed, refused to eat and take medication or shower, and then I came in one day and he was transferred out. Hearing the news that their newly transplanted heart is being rejected by their body, early stages are treatable and the protocol for testing is there for a reason. But even knowing all of that, it's scary as crap to be given another chance at life and then have it all be hanging in the balance again so soon. I do hope we reach the point where this problem ceases to exist. Stem cell technology allowing us to grow permanent replacement organs compatible with our own bodies instead of transplants with a limited lifespan and a cocktail anti-rejection drugs. This isn't from me but my mother. She is a surgeon. This little girl, probably 6 or 7 years old, had some form of spinal cancer. My mother had met and talked to her a couple of times. On this particular day she was excited because her dad was coming home from a business trip to Bali. This little girl was so happy because he was bringing her back a toy. The next day were the Bali bombings which killed her father. She was distraught and spent the next 4 days just crying with little bits of sleep in between. Her mother spent most of that time with her daughter. About 2 months later the mother passed away in a car accident while driving to the hospital to visit her daughter. So her grandparents got the duty of care for her but she passed away 2 weeks later from the cancer. The poor girl suffered worse than I could think in her last 2 months of life, losing most of what was important to her before dying herself. I hope no one goes through anything like that again. My mother thinks she just gave up after her mother passed. This little girl lost everything just by some form of crap luck. My mother donated flowers on her and her parents' grave every year on the anniversary of her death. Sometimes I really do not understand how my mother deals with being an She is quite possibly the strongest person I know just because of that. Jesus freaking Christ. That is horrible. 19-year-old who was 38 weeks pregnant stabbed 9 times in the chest. Emergency C-section was done in the trauma bay. The doctors were losing their crap. There was blood everywhere. Everyone was losing their crap. Mom died a few days later and I am not sure if the baby made it. Last I heard about it the baby was in NICU having frequent seizures. I was a patient in a hospital for a heart issue when I was 22. They kept me for 3 days in the cardiac ward and I shared a room with an older gentleman who I believe was around 80-85 based off his visitors. I never saw him behind the privacy curtain. I was completely okay and sitting up in bed working on schoolwork most of my visit. When his family came in I could tell the situation was bad. His whole extended family came. Everyone from his wife to his grandchildren. He was also on a ventilator that was keeping his breathing up. I'm not a medical person but as I understand this tube is down in your throat. On the same night after they all visited he tried to pull everything off and it set off an alarm and a nurse rushed in. All I could hear from a very muffled voice as the nurse tried to tell him he needed this equipment to live was what kind of life is this? It made me question my own issues and cry in the dark next to him. Patient got in a bad car accident. She ended up with brain damage. Her 2-year-old child ended up passing away. Every day she would wake up and not remember the accident. All day she would ask to see her child and walk down to the gift shop to buy toys for them. Her husband would have to go back and return the toys later. Some days he wouldn't tell her about the accident because it was just too much going through the grief and the crying over and over. This breaks my heart. I can't even imagine the pain. That husband is a true hero in those moments. Dang. Got sent to the pediatric ICU to watch over a 16-year-old who tried to shoot himself in the head in a failed suicide attempt. He broke the bones that hold his eyes in and lost all function of his eyes, for obvious reasons, and also shattered the part of the skull holding the brain out of his upper sinus. He was very confused and obviously terrified. He had just learned he was going to be blind for the rest of his life and need a new skull fragment put in to keep his brain in place. On top of all of this, his divorced parents were fighting. The dad blamed the mom because he used her gun. The mom then refused to let the dad visit by not giving him the special code you need to get on unit. It was the single most fricked up night I've worked, and I refused to go to that unit ever again. I was a nursing student in ICU. An older guy had been beaten and violated so badly that the doctor's official diagnosis was abdominal catastrophe. It was the first time I understood how someone could be devastated at the prospect of recovery. The look in his eyes when he found out he would have to live with severe permanent complications stayed with me for years. I remember thinking all the trauma therapy in the world wouldn't be enough to help him. Saw a couple lose their baby very suddenly one day before the due date. Saw a man get all of his affairs together and quit his job with a rare terminal illness, then live. Second bit reminds me of Breaking Bad, where Walt reminisces on the day he should have died. While a student, family was hit by an 18-wheeler. Both children and wife were killed instantly. The husband wakes up 2 weeks later, and first thing he asked is about his family. Watching them break the news to this poor guy. Doctor here. Saw the previously very well old lad in A&E who had fallen in his small bathroom and become trapped between the toilet and wall with his knees flexed. His thighs were pressed against the edge of the bowl and his feet were squeezed up behind him. Paramedics found him after about 48 hours in that position. He came to hospital with 2 completely black legs, rhabdomyolysis, muscle breakdown, and renal failure. Vascular surgery wouldn't amputate, it wouldn't take him, and he died about 2 hours later. I had rhabdo at 39. I'm lucky to have kidney function. Heck, I'm lucky to be alive. That crap is no joke. A guy got in a car accident and broke his back and was told that he'd never walk again. When they tried doing therapy, he started wiggling his toes, so some hope came back into the picture. The transport dropped him when transferring him from the bed to the stretcher and broke his back all over again. That was 20 years ago now and he has never moved a toe again. Don't forget to lock the bed or brace the stretcher, kids. ICU. Lady who was roughly 40, paralyzed from the chest down due to car accident years prior. Currently on a ventilator through a trach and had a permanent feeding tube inserted in her stomach. When I saw her, she had a bleed in her stomach that was seeping out through the tube and she kept pulling out her trach in an effort to end it all. They ended up having to sedate her pretty heavily to keep her from repeatedly pulling the tube out. Seeing her pulling the tube loose, and watching her actively begin to suffocate with a totally blank look in her eyes was chilling. I cleaned the rooms of the year in my local hospital as a summer job. This woman in her 40s was dying from cancer and she had a room in the year for a couple days to wait for another room in another service. She looked fine for someone who was dying. I mean, she was bald and looked ill, but she was nice and lovely to be around, cheerful, etc. One time I was cleaning the corridor when I heard cries from her room. I opened the door and there she was on the floor. She fell from her bed after trying to walk to the bathroom. I helped her to the bathroom as she was crying, in pain and in fear because she realized she could not walk anymore and that her end was coming. She broke my heart. It was the first time I realized where I was really working. I had a 94-year-old woman who had been beaten by her niece so horribly that she was intubated and in the ICU. This woman was in pure agony and her family wanted to do everything for her. Come to find out, they were keeping her alive and collecting her social security check. While cleaning her up, she grabs my arm and holds it tight. Huge tears well up in her eyes. She looks at me and mouths over the ET tube, "I want to die, please let me die." That night I sobbed the entire way home. This was one of my last days in the ICU. I was a young nurse and emotionally I could not handle working there, and this was the last straw. I had nightmares about being at work and trying to take care of patients. I would wake up and see my husband laying next to me, and it took me a minute to realize he was snoring and not a patient who was on a ventilator. It sounds silly, but it's horrifying if you actually think you're in that situation. I wish as nurses we were able to talk about what we experience on a daily basis, but because of HIPAA we aren't allowed. Years later I am now a nurse and I love it. I see awful things quite often, but I have a better way of coping with those experiences. Frick that. That poor woman. Mother backed out of her driveway and didn't notice her toddler had crawled into the culvert under the road. The culvert collapsed and crushed her daughter. We tried to keep the daughter alive while the mother was hysterical and the father was in shock. That was the worst. I've seen worse graphically but not emotionally. I was doing a clinical rotation in the air. The ambulance called and said they were about 10 minutes out with a 19-year male with a close-range gunshot wound to his upper left chest area. Think, the front of your shoulder, just below the collarbone. He came home early and some guys were robbing his house, so they shot him and took off. His parents had to wait in the lobby for the police to finish up with him before they could see him. The angry look on his father's face and the wailing sound that his mother was making are not things I will soon forget. Kid made a full recovery. BTW. He's got a small scar and story to tell. I am so happy there is a positive ending. I have seen many people die, but the worst one by far was a man with active bleeding, hemorrhaging from his esophagus due to long-term alcoholism. This was many years ago and there are better ways to treat it now, but at the time the treatment for this kind of hemorrhaging was putting an inflatable tube down the throat into the stomach. It was attached to some kind of helmet that you had to put on the patient afterwards, which was tough. You would inflate the tube to stop the bleeding but also aspirate the blood out of the stomach with a huge syringe. Just putting it in was horrible. The patient was so scared. There was blood everywhere. He was vomiting blood, crapping blood. He couldn't hardly talk due to the bleeding. This was in the air. We got IVs in him. Started transfusions pouring into him as fast as they'd go. We worked on him for a long time, but he didn't make it. What I remember is how hard he fought, how scared he was and how much blood there was. And this was before rubber gloves were worn for everything. I just threw out my uniform. Everyone's shoes were soaked. I never saw anything like it, before or since. Don't become an alcoholic. Don't get cirrhosis or esophageal varices. It's a bad way to go. Not exactly something I saw the patient go through, but I saw the sweetest old lady who was suffering with chronic kidney problems because, when she was younger, she worked as a maid for some evil twisted people who forbade her from using the toilet at work, i.e. 9-5 not including travel. So she had to force herself to hold a full bladder daily for hours at a time. This is a great way to get stones, which in turn can cause obstruction and damage the kidneys. She was so sweet and lovely, and it just really got to me that people could be so needlessly maleficent. I volunteered in a children's hospital throughout high school. There was a 16-year-old patient there who had spina bifida and had no feeling beneath the waist. He had routine surgery and expected to be in the hospital for about a week. The worst thing I've ever seen was the look on his face when he told me that the doctors had found MRSA on both of his legs, and he wouldn't be leaving the hospital anytime soon. Hospital trips are kinda funny. The first week everybody wants to visit you, but after that guests seem to taper off dramatically. I remember him stating that the hardest thing for him was the lack of social support beyond his family, and to a much lesser extent myself, as this was like the year before Facebook really being a thing that everybody had. Happy ending though, he eventually did recover from MRSA after spending around 6 months in the hospital. Watching a new mother bleed out while her mother held her dead newborn grandchild. Frick me, that still screws with me. All these stories are terrifying, but that one sentence painted a worse picture in my head than any of the others. That poor woman. I worked at the hospital in high school. I delivered food trays to hospital rooms, so it was a very easy job. We were encouraged to have brief conversations with the patients to try and cheer them up a bit. The hardest one to deal with was our high school principal. Our principal dealt with 2,700 students but was beloved by all. Not often you find a person like that. Well, one day she got real sick and had to go to the hospital. I walked into her room and saw her in there. Somehow she remembered my name after I had only met her maybe twice. I saw her every day I worked and saw her degrading for months. All during this time people in school had their rumors that she was getting better. Somebody's mom saw her shopping. People heard she was coming back next week, etc. I couldn't say anything obviously, but it was very hard to deal with watching so many people have hope and me knowing that this truly wasn't looking good. She died about 3 months into being in the hospital. The school was devastated. Worked in an orthopedic clinic and we had a woman come in to have her shoulder replaced. She was pregnant. A man broke into their house with a shotgun, killed her husband, shot her in the shoulder, and then killed himself. I don't know the reason. All I know is that she was now a future single mother with a dominant arm that was basically non-functional. That's devastating. Basically anytime a patient, especially elderly, is hanging on with every possible form of life support, vent, dialysis, repetitive coding, and the family refuses to make them a DNR. I know it is a hard decision to make. I know you don't want to see them die. You also don't want to be in the room when they code. You don't want to be in the room the third time they code, wondering if we will be able to bring your loved one back again, just to see his chest rise and fall mechanically, to see him being turned every hour and leaving the room so that your modest dad can have some privacy while we clean him up because he can't control his bowels. Please think about what the person would have wanted. Two of them, both senior citizens. They both haunt me, years later, because I don't know what happened to either of them. The first came in as a homeless woman in the winter. She was fine, medically, but homeless because her husband died, and her absolute demons of children took the family home out from under her, leaving her on the street. Somehow ended up in my city. They put her on a psych hold, just so she had somewhere to sleep while they figured out where she could go. She was in her 80s. Her entire life was in a grocery bag. The other was a transfer to Iro after being medically cleared elsewhere, because ours has a psycha, and the other main hospital in the area does not. Also in her 80s, I believe, she was the sole caretaker of her very ill husband, and reached a point where she felt it was impossible. Just everything. Life. She was so tired, so she drugged her husband and herself, so that they could die together. He died. She lived, and was sent for a psych eval. I assume there was a criminal legal discussion as well. I wish I had remembered her name, just so I could try to find the outcome. Work in a mental health hospital. Freaking dementia. Horrible, horrible disease that affects the people you love more than you because, on the good days, you don't know you have it. I've seen people screaming out for their husband who died years ago. What do you tell them? They're dead? Why put them through that again? Do you lie and say they're on their way out shopping or something else, knowing that will placate them for 10-15 minutes until they ask again? Frick dementia. I don't think there's an illness worse. Advanced and inconsolable dementia. Dying of respiratory failure. Young mothers dying of cancer. CPR on the elderly with rib fractures and resulting trauma. Suffering from mental illness following terrible sexual abuse, assault. A physical assault exam after a physical assault. It's invasive and exhausting. People having to choose between keeping their home and having adequate medical care. Seeing the neglect in long-term care. Patients left untouched, unturned, unchanged, unfed for an entire shift. Reporting it and seeing no response. It's freaking brutal out there. Wasn't employed by the hospital but worked as an inter-facility transport EMT at the time. Had one patient that had terminal bone cancer and was morbidly obese. I was transporting her from the hospital to a radiation appointment. I developed a rapport with her and she opened up and told me how she is just buying, maybe, 6 months by treating the cancer, otherwise she would have died already. Well, as some of you may know, bone cancer is one of the most painful and terrible ways to die, so for her to extend that misery for just a little longer so she could experience life and see her family a little longer was very inspirational. We get to the facility to do the radiation treatment and I told it should only take about 45 minutes. Then we get to the room where the magic happens and the table she's supposedly on is the same size a small adult would use. They have no modified version for morbidly obese adults. The only way to keep her on are extra straps they use to tie her down to the table. They constantly have to stop the procedure to adjust her for comfort. 2 hours in her fentanyl she was given at the hospital has completely worn off and the facility isn't authorized to administer meds like that. Appointment ended up taking about 4 hours longer than it should have and she was just miserable but still so sweet and apologetic the whole time. I felt awful for her, and after it was done there was a huge sense of relief in her voice. I told her how inspirational she was to me to see how resilient she was being. Okay, so technically I worked at a nursing home and I myself wasn't a nurse, but one of the kitchen workers who fed the residents. How it works is I brought up carts of hot food, served the meals on plates according to residents' cards which specified their diets, what they could and couldn't eat. Resident has no teeth, no hard foods, resident can't eat salt, etc. And then the nurses would bring them to designated resident. Sometimes they could eat on their own, sometimes they needed a nurse to feed them. Typically these meals come with a dessert. Depending on their needs and diet, it could be a piece of fruit, or something like a cake or pudding. So during one of my shifts I had just served dinner to the 3rd floor and was packing up to go back to the kitchen. As I was packing up, there was an old lady who I knew was someone who needed to be fed because she had lost a lot of coordination with her arms and was wheelchair bound. Her nurse, who was supposed to be feeding her, was too busy yammering away at another nurse. So this resident who was obviously hungry tried to feed herself the blueberry pie and naturally kinda makes a mess on herself. Poor lady has blueberry all over her face and shirt, and the nurse, who should have been feeding her, gets upset and decides the resident doesn't get to eat dinner since she can't behave and wheels her into a corner like she was in timeout, all while she's covered in food. The resident is obviously so embarrassed and just wants help being cleaned, but the nurse walks away before she could even finish her sentence. It isn't unusual for residents to not eat food because it was pretty gross or maybe they weren't feeling it. It happens. So I went downstairs back to the kitchen and cleaned and did my tasks. I usually come back up the floors usually 2-3 hours to collect dishes and drop off overnight snacks. I come back up to the 3rd floor and to my freaking horror that resident is still in that same corner covered in the blueberry sauce. Walked over to the nurse's station and told them about a resident needing help, and thankfully another nurse came in and took her back to her room and cleaned her up because her crappy designated nurse was nowhere to found. I cried that entire night after my shift. This poor woman is in a facility because she needs constant help and care, and she was treated like a freaking nuisance by this butthole nurse. Frick that hospital and frick that nurse. That place was literal heck on earth. Thank you for saying something. Please report this stuff if possible. In clinical on a burn trauma unit, guy had 3rd-degree burns on 80% of his body. He had very little skin left. I could actually see part of his tibia. Fingertips were necrotic. He was heavily medicated, but still, I can't even fathom the pain. IDK if he made it BC. He was quite septic last time I was there. I now work in the NICU. Most of the babies end up doing pretty well and going home eventually, but some aren't so lucky. I could go on about the medical stuff, but really the worst is when their parents don't give a crap about them. But some parents live far away and have other kids to take care of, so it's understandable if they aren't there every day. But then there are others who never call, never visit, and no one can track them down. So the kid ends up being discharged to foster care. It just burns deep in my soul sometimes. One day I might hand a perfectly nice couple their baby to hold one last time while we withdraw life support, and the next day I'll be trying to sue the baby withdrawing from the drugs his me and mom took. Despite the challenges, I still love my job, though. My son is in NICU and it kills me he isn't home. I wonder sometimes if he dreams of my voice and my heartbeat. I'm counting the days till he comes home and drive almost an hour round trip to see him daily. I can't imagine forgetting him and leaving him there. Not one particular patient, but a common occurrence. I work in the post-op unit, and often people have an NG tube. The purpose of these is the removal of fluids from their stomach due to having a bowel obstruction. Often patients become confused due to meds, age or whatever. Often they pull it out and somehow end up vomiting diarrhea. That must be one of the most awful things to experience. I'm done with Reddit for the day. When I was in high school I took a CNA course. We did our clinicals at a state-run nursing home. There was one patient who was 89 years old, had stage 4 pancreatic cancer and dementia. She was married at one point, but her husband had died. They had 8 children. All of them had died. All of her siblings, friends, and close relations were dead. She first entered the home about 4 years before she died once she realized she really couldn't care for herself anymore because of age, general health problems that accompany living for 85 years, and later developed the other ailments. By the time I got there, most days she didn't know where she was. There would have days where she was lucid. She would remember her cancer and that she was alone. Those days she would cry out. As the lucid days got further and further apart as her physical health declined, she got to where she would only eat if I was the one feeding her. I went in on weekends and after school to try and get her to eat and drink something. Watching that poor woman have to face the reality of her cancer over and over again, then realize she was alone and the world was horrible. The day she died I walked by her room as they were cleaning out her things, and saw a picture of her sister. We didn't look identical to one another, but we favored each other. I think she thought I was her sister. People imagine horrible ways to die, but dementia is by far the worst way to go. It is wonderful that you were there for her. Most people don't know their impact on others. That username made me chuckle after a heartfelt story. I'm a children's nurse. I worked on a ward that specializes in brain and spinal tumors in children, amongst other specialities. The worst thing I can think of was a little boy. I think he was 3 or 4 years old. He'd been in a different hospital for 2 weeks with a weakness to his legs that was seeping up his body, eventually causing incontinence. The other hospital hadn't scanned him, which was the first thing we did, and we found his brain and spine were covered in tumors. There was literally nothing we could do. He had weeks if not days left. On my shift he was incredibly poorly and I was trying to push for him to get moved to the ICU. He was barely conscious and there were a few times whilst I was waiting for the medical team I actually thought he'd died in front of me. Being with his poor parents as they went through this, watching their typical, previously healthy child fade away with no information was the worst. The mum asking, "Will he live? Please save my baby." It was truly awful. Thank you for what you do. My cousin passed away at 8 from rhabdomyosarcoma. She had a tumor the size of a peach in her brain. Her nurses were absolute angels and made every admission she had as bearable as possible. Psychiatric hospital, definitely dementia, as is covered throughout this thread, but also patients in deep psychosis, non-stop energy, paranoia, delusions, violence, aggression, the whole works. Strangely enough, these patients, once sane, are usually the nicest people on the floor. The look of horror and regret when they learn what happened to them and what they did over the previous days kills me every time. Emergency room. An old lady came in, I don't know for what, but she came in from a nursing home. There is no way to describe accurately how horrific this woman's condition was. The patient didn't go through this in the hospital, so I DK if it really answers your question, but here goes. Her hair was so matted and dirty that it seemed like the bugs who lived in it couldn't even get to the center of the dreadlock. They ended up cutting most of it off. Her skin was just straight up open, infected, oozing sores. Picture like maybe if you took someone's skin off and laid it flat, then took a hole punch to the entire thing and put it back on. It was hundreds of small round infected smelly gooey painful sores on her entire back, butt and legs. Now, her mouth. The decaying and missing teeth were nothing. What was something? Something that we couldn't figure out was the mold. Just straight up, mossy, mold. Originally we thought she had a napkin in her mouth or was eating toilet paper. Nope, just mold. I had to leave the room because I kept throwing up. This is on top of the regular blood, poop, and pee that they always come in with and smelling like. This lady smelled worse than a dead body. Thank the Lord Jesus and all of his men for nurses, because those people handled the situation like champs. They cut her hair, patched her up and cleaned her mouth. She looked and smelled and spoke like a new person. My brother-in-law's grandma died from neglect in an expensive nursing home. They were putting shaving cream in her pants to keep the smell at bay instead of bathing and changing her. Her only health problem previous, the reason they put her in a home, was dementia. It's a sick world we live in. I had a patient who was an escaped flesh slave. It was a younger individual in their 30s who was dragged into their situation through a drug addiction and was actually supposed to be killed because they were sick, but ended up finding a way out somehow and landed themselves in a local psych ward. Because of their physical health they were sent to the hospital where they died not long after. I forget why. And as I was helping to clean up the patient for family viewing, I saw their rectum was stretched to a point I've never actually seen before or after. They had been waiting until their condition improved to schedule surgery. It was awful, especially with this person being so young. They were swollen all over and bruised before they even died. When the family showed up, they just talked over their body like it was a Sunday dinner. No tears or anything. The whole thing was a mess. Jesus Christ. There've been a lot of rough stories in this thread, but ones about awful, cruel people and totally uncaring families make me especially sad. I think I'm done for the night. There was a young girl who came in with maggots in her infected Achilles tendon. Wasn't fun for either of us. 2-year-old boy born to mentally challenged parents who brought him to the hospital at the 11th hour and kept taking him off of his oxygen and have him lie flat even after I patiently explained why he couldn't play. His lungs filled with fluid and oozed out of his nose and mouth as I desperately tried to suction it and give him CPR. Still haunts me. Not a patient, his mom. She brought him in with a high fever, saying he wouldn't wake up. Kid was brain dead. Meningitis. How do you tell parents their only son would never wake up? Operating table. Guy let his abdominal stitches fester and ulcerate. I could see his intestines inflamed and glued together. He somehow survived. Young girl comes in unconscious. We diagnose her with malaria. Do a blood test. Find out she also has type 1 diabetes. No one knew. Treating her was tricky, but I was adamant to make her better. She was literally burning from a fever and was in a deep coma. Third day, she wakes, asks for water, dies that night. God help me, I have never cried more than I did when I heard Fernie's gangrene. That's all I'm saying. Guy had a twisted spine and an enlarged heart. He could barely breathe. Pregnant woman specifically was told she could never safely carry a baby to term due to a heart condition. Got pregnant. Heart was overloaded. She struggled with every breath. Schizophrenic woman gave birth. She was off her meds to allow for breastfeeding and was instead on a course of family support and reassurance. She knew she was sick but wanted to take care of her baby. At the same time, she knew she couldn't. It was heartbreaking. She wouldn't nurse her infant. She kept telling me with tears in her eyes that her baby hated her for not being able to take care of her. I'd been a nurse a few years and thought I was pretty awesome. A patient in the ICU was unstable with a heart problem, but with meds, was pretty stable when my shift started. She was a DNR with heart failure. The family had been there for days. Husband, adult sons, daughter-in-law. They were the nicest folks. They were contemplating going home for a few hours to shower, eat, and rest. I told them her heart rhythm looked good. Go home and get some rest. I took their cell phone numbers and told them if anything changed I would call right away. Well, they traveled at last an hour through a dead zone because as soon as they walked out the door I was struggling to keep her alive. Her heart was all over the place. Pressure kept dropping and dropping. I got them on the phone an hour later and told them to come back. I spent 2 hours desperately trying to keep her alive, and they ran back in the door 5 minutes after she was gone. I couldn't stop crying. I felt so bad. There was no professional boundary there at all. We all knew a young stupid nurse took their last moments with their mother, and mom died alone, with a few scattered staff doing what they could, but without her family by her side. That family comforted me more than I comforted them. I was beside myself. They told me I did my best, and it was okay. The grace and kindness they showed me was incredible, and affects the way I treat every family now. Honestly, sometimes I think people wait until family leaves to pass. My grandpa had a room full of people surrounding him most of his last days. Most of his kids, my grandparents had 9 very supportive children, had left to get coffee or a shower or a nap, leaving my mom with grandpa, and that's when he died. I don't work in a hospital, but while I was in a hospital post-op from a surgery on my stomach, I was told to walk around and try to get my strength back. While walking I found out that I was the only kid in the whole wing that wasn't in a huge bus crash that left almost 24 elementary school students butchered, like missing limbs, intestines sticking out, faces and chests crushed, on ventilators and in comas. I found out when my mom asked what happened and the nurse explained there was a horrible bus crash. In residency I took care of a young boy, 8 years old, with E. coli 0157, H7. No one knows where he got it and it wasn't part of a bigger outbreak. I'll never forget the screams of pain from the severe abdominal pain and bloody diarrhea, but then I'd go in the room to check on him, and when I asked him how he was, he'd just say in a weak little voice, "I'm okay," even when doubled over. Such a tough kid. There's no treatment besides supportive treatments, fluids, pain relief, because antibiotics make renal failure more likely. Unfortunately, he did go into renal failure anyways, and he died before dialysis could be started. In medical school, I took care of a middle-aged woman with advanced uterine cancer. She was extremely obese, 400 lbs, so it was too difficult to do her hysterectomy without first doing a paniculectomy, basically removing her pannus, which is excess abdominal fat. This involved an incision in a circle around her entire abdomen, which was extremely painful as it healed since her whole abdomen was involved, so she was essentially bedridden post-op. Because she didn't move, she developed terrible pressure ulcers in her back, a couple of which ulcerated all the way to her bone. She had a ton of fat on her back too, so these ulcers were deep. I could get my whole arm up to the elbow inside of them when changing her dressings. She'd scream and sob anytime we moved her. I don't remember anyone ever coming to visit her, and I'm pretty sure she eventually died alone. I went to see a patient during clinical rounds a few years back when I was a med student. I think it was for dermatology. Guy was just a year older than I was, remarkably fit, fairly good looking, and from what little I got to see of him was also pretty mild mannered. Well, so his story was that he loves to play basketball, and he did just so on that fateful day. A quick shower and a wipe down, and he finds blood on his towel. Blood came from his scalp, from some weird scab-like growth. No prior symptoms. Freaks out, goes to a neighborhood dermatologist, and is told to go to a bigger hospital, which is where I ended up meeting him. So apparently he's taken some tests. The prof and I go over to the station to check out the EMR. He grills me a bit on what exams I would have ordered, knowing what I did. One of the answers was a PET CT, and so we checked that out first. Now, for those of you that don't know, a PET CT checks the uptake of radioactive glucose that has been injected for the test. The more active metabolism an organ has, the more radioactivity it shows, meaning it shows up black. Cancer has a lot higher metabolism than normal tissue, so it's a pretty neat way to check the entire body for metastasis. When we loaded this guy's PET CT, we were both struck, momentarily speechless. His whole spine and both hips were fully covered in black. Bones should not be black. The cancer, which the prof later told me was a melanoma, a particularly aggressive type of skin cancer, had spread across his whole body. The prof gave him about 3 months to live, at best. The guy was just 1 year older than I was, and a heck of a lot fitter. It was really eye-opening to see that my young age didn't mean I was immortal or invincible. Since then, I've adopted the motto of Memento Mori. I still think about him every once in a while. Well, I'm gonna try and lighten the mood in here and be a bit self-indulgent at the same time. The nurse that worked in the hospital said that this is one of the funniest things she's seen. I had brain surgery and a huge wound, about 10 inches, across my skull. It wasn't stitched, it was stapled. I hadn't had a dump for about 3 days after the surgery, and the nurses gave me some tablets to soften my stool up and coaxed me out of bed to try and bust the crap out. I sat there and strained and slowly but surely the turf inched its way out, but the problem was it was like concrete, and after straining for so long I fainted and fell forwards onto the bathroom floor. Anyway, the nurses came in and found me face down and a big turd protruding from my fully intact. So apparently anesthetic can back you up a bit. The nurse put a glove on and literally pulled the iron bog out of my ass before they cleaned me up. She said it was one of the most satisfying things she has done, and even better that picking Saint get boyfriend's blackheads. Legend. This comment was almost the very last one out of all these horribly sad stories, and I'm very thankful for that. Thank you for making me smile after all that sadness. Lol. Stories from last night. Aiku, bed 26, comes in for elective colostomy reversal. Post-op has significant bleeding and goes back to ward to take care of bleeding. Repeat bleeds X3 with repeat or trips X3. I just came in to help turn her and see this woman with eyes that look dead inside. Tracked on a ventilator. Massive abdominal wound with wound vac that will obviously never be closed. Massive blisters all over her body from being so edematous. She's wrapped in chucks from head to toe because she's draining so much serous fluid through her skin. The worst part was she only elected for the procedure because her family was mad at her for smelling so much due to the colostomy bag. Bed 16. I just went in to check the alarms. Patient on CVVH, a type of slow dialysis for hemodynamically unstable patients. Toes are purple. I say to the primary nurse her toes are purple. She replies, just wait till you see her arm. I look at her arm. Her arm is black from the fingertips to the elbow. Black like my PlayStation is black. I say to the primary nurse, she looks dead. Is she with it? Nurse replies, she blinks. Family wants everything done. Bed 19. Possibly cursed room. Steamy. Heart attack. Coming from cath lab. The report. Patient has coded 3 times during procedure before patient is stabilized and they are running levo-fed wide open. Cath lab calls, hey, we're coming and doing compressions en route. Gown up. Gurney comes flying around corner with someone doing compressions on top of frail old man. Blood is everywhere. More staff than I've ever seen at a code ever show up. Easily 10 doctors. Residents. Too many people for me. I offer to get the family. Family hopeful upon seeing my stupidly smiling face because I stupidly smile when meeting someone. Tell them he's not doing well. We're doing everything we can. But he's not going to live much longer. You need to see him now. Could literally see the smiles and color drain from their face as I spoke the words and tears forming in their eyes. Even my emotionally dead IQ nurse self got choked up breaking the news to an audience of 20 plus family members. 20 plus family members rushing in while 10 plus staff trying to do CPR. People trying to collapse on floors. People crying. Praying to God for a miracle. Telling us not to stop. 10 plus rounds of EP given. 2 crash carts of drugs emptied. Floors covered in blood. No miracle. Bed 19. 1 hour after previous patient wheeled out by funeral home. Rapid response from med-surg floor. Patient with hemorrhagic stroke now having mental status change. Shows up snoring heavily, not waking up. Patient vomits and aspirates. Concern for airway. Patient is a DNR. Also beginning to have obvious decerebrate posturing. Patient no longer able to speak for self. Family rescinds DNR. We intubate. Anytime we have to watch or put a patient through unnecessary suffering is probably the worst thing they go through. Family should not be able to rescind a DNR that the PT has requested when they are able. God dang. The head and neck ward has a carotid blowout kit for people with neck tumors that are invading the carotid artery and can't be removed. It has towels in it, nothing else. I'm glad to say I've never seen it used, but I once saw an old woman with a nosebleed that no one could get to stop. Just seemed unbelievable that you could die from a nosebleed, but she did. Obligatory not me post. A friend's stepdad was training to be a nurse, so he got all the gross stuff that came in because, newbie, a homeless man came in complaining of stomach pains. When he told the guy to undress, he didn't want to take off his jeans. When asked about it, he said, I can't take them off, my leg will fall off. Sure enough, his leg was rotting and had maggots crawling in and out of it. How do you reach the point of having a rotten leg but you go to the OR for stomach pains? You have been visited by the romantic doggo. Comment love is magic so you never fall in the free. Doctors of Reddit. How often do you see patients after they have tried to self-medicate? What's the worst mistake you've seen? I was working in a clinic when a man came in with his blind wife. She is diabetic, and during my questioning I found out she had had a few episodes of low blood sugar in the past few months. And I mean low as in unable to ingest food to raise her blood sugar. The husband told me he had to inject his wife to bring her around. Usually, in these cases you would inject glucagon, which is basically the opposite of insulin. It raises blood sugar. He proceeds to tell me that the glucagon is too expensive, so he has been dissolving sugar in water, drawing it up, and injecting it into her thigh. I tried to hide my shock, but it must have been obvious. He just looked at me and said, well, it worked, didn't it? I tried telling him all of the reasons he should use glucagon and not sugar water, but he wouldn't have it. I even told him that the pain of the injection is probably what woke his wife up, not any increase in blood sugar. He said the glucagon was too expensive. I called around to a bunch of pharmacies and found it for $20 for 2 injections, but he still refused to buy it. We ended up calling Adult Protective Services, TL, DR. Husband injected his blind diabetic wife with sugar water to revive her from low blood sugar episodes. Good job. I am very glad you called Adult Protective Services. Lady in her mid-60s comes in with a terrible burn on her hairline and scalp. I ask what happened, and she said she was coloring her hair with the leftover dye from a month or so ago. Needless to say, she had a third-degree chemical burn all over her scalp. Okay, that's problem 1. We ask her if she has any allergies because we want to give prophylactic antibiotics. She says no. We ask about her daily meds. She rattles off a bunch including 1000 milligrams of amoxicillin, Augmentin. We ask how long she's been taking the Augmentin. She replies 2 years. Every day, for 2 years, she's been taking massive doses of antibiotics. Her reasoning: to keep myself from getting sick. We went hunting for side effects, found oral and vaginal thrush, massive yeast infection in her colon, malnutrition, stomach ulcers, and multiple open sores on her feet and knees. Plus, she got a super infection on the burn site a few days later. No fun. TLDR. Don't take antibiotics if you don't need them. Seriously. Not a doctor, but when I was about 16, I started having these little red irritated spots show up on my arm. My mom was immediately like, "You have psoriasis is all, just go tanning." So I tanned for about a week, and they just got worse. Now I had them all over my body. I had spots on my eyelids even. So I go to the doctor finally. Turns out I had ringworm, and by tanning, I was basically rubbing them all over with the lotions and incubating while I tanned. Thanks, Mom. I posted in a thread above this about how I got ringworm from a tanning bed. IT was you. Pathologist. I've seen a few cases of patients who basically wreck their livers through use of some sort of herbal remedy, like for weight loss or something similar. Be careful with unregulated dietary supplements is what I'm saying. We got given a case in a lecture of a man who had a rash on his foot, googled it and decided it was eczema or some similar inflammatory disease, so ordered and applied a steroid cream. For those who don't know, these kind of steroids act by dampening the immune system, the overactivity of which is the cause of diseases like eczema and psoriasis. However, he in fact had a fungal infection and was just reducing his body's ability to fight it off. If I remember correctly, by the time he got to the doctors he needed it amputated. TLDR. Go to the doctor. I have a weird rash that I can't diagnose on Google. This just convinced me to schedule a doctor's appointment. Pharmacist here. Patient came in and wanted to self-medicate his cat's Pinky. He wanted to know what the vet would prescribe and if it was available somehow over the counter. After a long and trying discussion, he is insistent on putting generic Neosporin in his cat's eye. I repeatedly instructed him that it wasn't safe due to sterility reasons and that it could harm the cat, worsen the cat's condition, or cause some other problem for the animal. His reply to me: "Well, I'll try it in my own eye first and see." And just like that, as mysteriously as he arrived, he was gone. A doctor. First one that comes to mind, although probably not the worst, was a woman who came in with worsening back pain. She had fallen the previous day and filled a gallon-size bag with ice and placed it on her back. She fell asleep with it on her back, and a few hours later she noticed that her back hurt even worse. So she took another bag of ice and put it on, and once again, fell asleep. When I examined her, she had 2 large areas of burns with blisters on her upper back, each about 6 inches in diameter. When I took a picture and showed it to her, no, I will not post the picture, her eyes welled up with tears. She couldn't believe that ice had given her a 2nd-degree burn. Less than 15-20 minutes at a time every 2-3 hours maximum for heat or ice packs. TLDR. Patient left ice on her back too long, got a nasty burn. I work in a dental office. Most common thing we see is people placing an aspirin on their gums next to an aching tooth. All that does is severely burn the gums and makes the pain worse. I've also met a few people over the years who have taken their own teeth out with a pair of pliers. One guy we saw had a problem tooth. Went to pull it out, pulled the wrong one, then tried again and pulled the problem one. He shattered the alveolar bone in that area and had to be sent to an oral surgeon immediately. Resident physician here. I've had numerous patients who've rejected medical treatment for a small, localized, and easily treatable cancer in favor of naturopathic homeopathic remedies. Inevitably, they re-present years later with diffusely metastatic cancer in their brains, liver, bones, it's everywhere. By that point, the conversation shifts from how I can cure them to how I can make them comfortable before they die. For example, woman has progesterone receptor positive breast cancer. This means that the hormone progesterone will make her cancer grow faster. She goes to her naturopath, who prescribes her tubs of progesterone cream for years, which most certainly made her cancer worse. But it's okay, she tells me. It was years of natural progesterone. Nurse here, at a get-together with friends, where the wine drinking got out of hand. I had a friend burn himself on the oven while making pizza, then try to cauterize that wound with his lighter. I'm an EMT. One of my first calls was an 80-plus-year-old man living in an assisted living facility. He had bought at least 150 bottles of some naturally lose-weight quick pills that he saw late night on TV. He had been taking an excess amount of them for at least a day straight. We got there and his mental status was clearly altered. Didn't know where he was, etc. I wish I still had the picture of the stacks of cartons he had in his small room. I still wonder how he got them inside of the facility. Med student here, literally all the time. I've seen super overdosing OTC meds guy with bloody stool and abdominal pain who we found out used 4 goody powder packets a day for over 5 years. Patient who had someone try to nail file his hemorrhoids. Not sure how he thought that would help. Massive infections from people literally stapling a wound shut with an office stapler. I had a patient who came in saying that she had a sore throat, so she took her cat's expired antibiotics and wanted to know why she wasn't getting better. Well done, they'd expired. Geez, talk about stupid. Physician here, the one that stands out from among the rest of the field. Life-threatening problems with OTC acetaminophen, ibuprofen, naproxen happen all the day long. Happened many years ago while I was a medical student. I was serving my rural medicine rotation at a primary care practice in the sticks. A man came in for an urgent appointment for a rash. I went to see him first to get working on the history. In the exam room I met a very nice, young, fit man sitting bolt upright on the exam table looking very uncomfortable. During the history, it was revealed that he was a telephone line repairman and was working, in late summer, out on the telephone lines around the county, climbing them to reach the wires. He had been exposed to poison ivy this way over both arms and much of his torso, which had happened before. However, this time the rash was worsening with time. I asked him to remove his dark-colored shirt, and after he did I almost fainted. He had open wounds all over his arms and chest. All of the blisters from the poison ivy had unroofed and the tissue underneath was destroyed. Everything was bright red, bleeding, and weeping. It looked intensely painful. I'm having a hard time describing it. It was the worst skin findings I'd ever seen. I thought for sure this was Stevens-Johnson syndrome or 10, so I started asking about medication use. He told me he takes no medications at home, but that his grandmother gave him a gallon of solution to put on the rash, which he had been using regularly since the poison ivy began. He didn't know what was in it. We called grandma. What was in it was bleach. He got to go for a fun trip to the burn center. Poor guy. TLDR. Man treated really bad poison ivy with bleach. Lots of skin was lost. Heard the story, but didn't see the patient. A woman in her 60s presented to the OR with episodes of passing out during sex. She underwent a full workup, cardiac, neurological, when she was admitted, and no cause was found, so she was discharged. She returned again with the same complaint a few days later, and divulged that this had actually happened during sex both times. Upon further questioning, it turns out that her husband had been using topical nitroglycerine paste on his penis for erectile dysfunction. When they had sex, the medicine was absorbed into her bloodstream, causing her blood pressure to drop precipitously. Her husband was advised to discontinue this practice. TLDR. Stick to Viagra. People with tooth pains trying some miracle remedy, and when the pain stops they think they are healed. What they don't know is that it means their nerves have been infected. In fact, So serious that the nerves died and rotting below the gums. Only until the pain starts again and their so-called remedy doesn't work do they go to the dentist. By then there is no choice but to remove the teeth and probably some additional surgery too. BTW, dentists poke sharp objects at your gums for a reason. It's to check for periodontal disease. Most dentists also don't fool with making payment arrangements. This means people with no money get no dental care. Given the risk that I've heard comes with untreated abscess, I find it really concerning that dental insurance is not mandated by the ACA. I did an MRI on a patient who had treated her breast cancer with sodium bicarbonate. The patient presented to them with numb hands and neck pain. The MRI showed extensive bony metastases and a pathological fracture of C2. Basically, the cancer had spread all through her body and had weakened her bones to the point that they were disintegrating, putting her at risk of damaging her spinal cord, or worse. It's more just sad that people want to believe that these simple remedies can treat complex issues as opposed to modern medicine. I'm a medical student. I have two that stand out. First, we had a guy come into the free clinic complaining of knee pain. He is a larger guy, an ex-football player who developed a bit of a gut after he stopped playing. He said that he has some old injuries, torn meniscus, chronic arthritis, etc. He used to go to his doctor in another state, who would drain the knee and give him a steroid injection every so often. When he lost his job, he lost his insurance too, hence being seen at the free clinic. Before he decided to come to us, though, he decided it was a good idea to take a needle and try to drain his knee himself. 4 times. On physical exam, the knee is massively swollen, tender, bright red, classic signs of a septic joint. We weren't equipped to treat it in the free clinic, so we strongly encouraged him to go to the ER. He didn't want to go because of his insurance situation. We tried to explain the gravity of the situation to him, but he refused to listen. Without prompt treatment, he could end up losing his leg. We offered to call him an ambulance to take him to the ER, but he refused and left the clinic. Never did find out what happened to him. Second, this one I heard second hand from a classmate. We had a firefighter come in with some burns on his leg. I believe they were incurred from a drunken cooking accident rather than any on-the-job heroics, but I could be mistaken. Anyway, the burns were serious, but he was expected to make a full recovery quickly enough. He was discharged and instructed to eat a lot of protein to help him recover. He interpreted this as get as much protein into your body as possible, by any means necessary. He goes home, takes some protein powder and mixes it up with water, and sets it up in an IV. Needless to say, he developed a pretty serious bloodstream infection. It prevented his burn from healing correctly and he ended up needing a partial amputation of his foot. He eventually recovered, but it took way longer and there were so many unnecessary complications. I'm a pediatric nurse. Parents brought their child in with weakness. Through the general admission questions, we discovered that they were into natural treatments. When their infant child developed tummy problems, they decided to give her a bottle of honey water to help with that. The baby was diagnosed with botulism. It says right on the honey bottle not to let kids under like 2 eat it. We had a patient come in who was using duct tape to treat various skin ailments. Not the end of the world if you have a wart and just use a small piece of it only on the wart. This woman was using giant strips of duct tape that she'd leave on for months at a time, on her face, her arm and foot. When the duct tape was removed, huge square portions of her skin came off with it. She has a long, rectangular scar on her face now from it. Not self-medicating but something even worse, ignorance denial. Woman came in with a tennis ball-sized tumor extending out of her left breast. When asked why she didn't come in earlier, she said she thought it was normal. Worst mistakes I've seen are patients coming in for treatment when it is too late and the disease is way too advanced. My mother-in-law, rest her soul, had finished menopause previously and was bleeding vaginally for 2 years before telling anyone. Kids, doctors. She fought for 6 years but cervical cancer took her life. When she was first diagnosed it was at stage 4 already. Please people, don't be freaking stupid. If there's something wrong, get some help. As a veterinarian, the holy trifecta are giving aspirin to cats, giving ibuprofen to dogs, giving estrogen to dogs, usually done by MDs or nurses. All 3 of these run a good chance of killing the animal. Not a doctor, but I was observing in the year for this. During my senior year in high school, I did a program called New Visions that allowed seniors to skip half their day at school and instead spent it job shadowing doctors, surgeons, nurses, physical therapists, etc. I scrubbed did surgery, saw a bunch of births, vaginal and C-section, assisted during codes, and was eventually certified as an EMTB through the same program. It was awesome. Man comes into the year after trimming trees on his farm and a very large branch had landed on his head. He had split his skull and instead of going to the ear, he had his wife clean his scalp with vodka and staple his scalp shut with a staple gun and thick sewing thread that they used on horses. According to him anyways, it was severely infected and nearly gangrenous. Several of the staples had created microfractures on the skull too apparently. The doc's face when the man nonchalantly described how he just got drunk and had his wife use the staple gun on his skull was hilarious. Guy had to go into surgery and it took about 6 hours and several skin grafts to repair the damage. That sounds like an awesome program. You were really lucky. Only semi-related, but the gym teacher at my junior high had a student who broke his arm during class, and the teacher's response was to insist that it was only a sprain, and that the student should do jumping jacks to help it feel better. His classmates had to call him an ambulance. My uncle is a doctor and a few years ago, when I was trying to figure out if I wanted to go into medicine or not, he let me shadow him in his office for a day. Well, this one girl came in to see him. She was absolutely beautiful, mid-20s, perfect makeup, hair, everything. She was in to see my uncle because her toe was in unbearable pain and she could barely stand to walk anymore. Well, my uncle has her take her shoe off, and I almost threw up. He had to take a second and turn away to collect himself. Her toe was like 3 times its size, and the outside looked slimy and like the skin was about to drop off. After a few seconds of stunned silence, my uncle asked what happened to it. She said she was walking one day and she cut her toe pretty bad on some glass while she was at her apartment. She called her grandmother and asked if there was anything she should do to stop the bleeding and heal the infection. She said her grandmother was a shaman, and apparently she went to her for all medical advice. Well, guess what the grandma told her to put on it? Mayonnaise. Yep. She didn't even clean it or anything. Just plopped some mayonnaise right on it. We asked her how long she had been doing it for. 2 weeks. Constantly. The smell was absolutely terrible, and when my uncle even slightly poked it with something, she would almost scream in pain. He immediately told her to go to the hospital and told her that one of his buddies would be waiting there for her. So later that day, my uncle's friend calls back and said that they had to do surgery on her toe, and that there were 2 or 3 pieces of glass embedded deep in her toe. He said that when the surgeon made an incision, the toe basically exploded and pus went everywhere. They had to remove all the dead skin, and almost had to remove the toe because the infection was so bad. But apparently she made a really great recovery, so that's good. Me and my uncle will never forget that though. I'm not a doctor, but I work at a pre-post surgical eye clinic. The worst I think I've ever seen was someone wore their contacts for 3 months straight. It was gross. Remember guys, take out your contacts at night, and wash them like you were told to do. After my mother's friend had her cornea fall off, I'm very protective of my eyes. I just can't understand how they do that. Mine get dry and uncomfortable after half a day, and sleeping with them and just makes it even worse. Just take 5 minutes to change them for God's sake. Guy came in with a deep laceration to the leg. Genius decided he would super glue the wound shut. It became infected and then gangrene set in. He then waited until his leg was a greenish black before coming in. He lost the leg. I work as a caregiver. I had a patient who tried to holistically cure Parkinson's for 10 years. When I started caring for him, he was a human statue who could only communicate by blinking. His crazy hippie mother was behind a lot of it. She brought in shaman, healing gazers, oil enemas, you name it. After 6 months of this, I dragged his butt to a neurologist to be put on meds. Today he walks, talks, plays piano, goes to a local college, and even puts on concerts. When I think of those 10 wasted years, I just shake my head. To this day, the minute someone starts yammering about alternative medicine, I shut that crap down. I've seen what it does to people. I am not a doctor, but this is important. About 10 years ago, my now mother-in-law had what everyone thought was a severe panic attack or mild heart attack. They rushed her to the hospital and found out it was her gallbladder. She said it was nothing serious and didn't get it removed. About 3 years later, same thing happens. Possible heart attack, turns out it's her gallbladder. Her husband, my wife, and I were all there in her room when the doctor is recommending taking it out. She says no. The doctor then tells her no more spicy food, junk food or fast food. After he leaves, she starts going off about how doctors just want to cut people open to make money. And I swear, she says, I just need lemon juice. That will fix it. Fast forward another 3 years later, of not listening to her doctor and taking lemon juice, my wife gets a call around midnight from her dad, who is mumbling incoherently. After about 30 minutes, he explained to my wife that my mother-in-law had woke up screaming painfully and he had rushed her to the ER and was scared she was going to die. The hospital had told him that she was going into emergency surgery. About 4 hours later, we found out that they had removed her gallbladder and that it had actually ruptured. She is still alive and still tries to give my wife and I medical advice. Don't you just love that part with the being incredibly wrong and yet still they have to know better than everyone? It is amazing how many people truly believe DRs are all buttholes. MD here. Patient a few weeks back came in very yellow, jaundiced, and had hundreds of marks over his entire body from scratching. Severe pruritus. His liver function tests were through the roof. Total bilirubin 28. We did the full workup, labs, ultrasound, MRI, even liver biopsy. Nothing obvious. Turns out the guy was taking supplements by the handful from GNC. He had acute vitamin A poisoning. Great case. Gynecologist friend in Lebanon told me about women trying to abort by themselves due to abortions being illegal. So you have the patients coming into her with hemorrhages due to knitting needle insertion, and that is a classic. But a very frequent case is massive septicemia due to the insertion of a raw piece of meat, or sometimes a dead bird. The crazy part is that those cases happen quite frequently. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Doctors and nurses of Reddit, what is the dumbest cause of injury you've ever seen? I had a young man come into the ER one evening with a sex toy lost in his ass from the previous night. Turns out he didn't have any more sick days at work, and spent the day framing a house with a dildo wearing away in his sphincter. He came to the hospital right after work. He was really glad when the batteries died somewhere around lunchtime. Hahaha. Holy shit. Dave. What's that humming noise? I have no idea what you're talking about. Dave slowly vibrates off the scaffolding. Had a university student who ignited a firework in his anus while drunk for the amusement of his buddies. It exploded, causing full thickness burns of his rectum, and injured his external sphincter, resulting in him needing a colostomy. None of his buddies told him that sticking a lit explosive in his asshole wasn't a good idea. With friends like that, who needs enemies? I don't see any friends, just a lot of straight up douches. Not a doctor or a nurse, but I was an emergency medical responder for a remote oil and gas site. Workers would go up there for a month at a time, and while they were there, all they really did was work and sleep, with a couple hours downtime at best. Just so many things stuck up asses. Some guy slipped in the shower and ended up with a soy sauce bottle. You know the type, with a short, fat base and a long, slender neck. Up his butt. No need to make fun of a lonely worker. Don't kick Oman while he's down. That's brilliant. This is secondhand from a friend who used to be a nurse in the Royal Navy. Apparently a sailor managed to impale his scrotum with a hockey stick while playing deck hockey on an RN vessel when it was docked in Portsmouth. Apparently one of his nuts was the size of a honeydew melon and had gone black. This caused quite a stir and all the staff came round to have a good gawk under the pretense of viewing a rare injury. I believe he was okay in the end. My dad is currently based in Portsmouth with the RN. Anyway, has told this story. Man was having night with the lads. Gets shit-faced. On his way back to the base he needs to piss, so he just goes. Turns out he pissed on, I think it was a battery or something of high voltage. His cock went all black and got burnt, or whatever. His life went to shit. and he drove his motorbike into a wall, killing himself. That was sad. Operating theater. This woman came in with a frozen chicken stuck inside her vagina. Apparently she had a habit of buying them, inserting them and then pulling them out, as she really had a thing for going through childbirth. But on this occasion, she hadn't allowed time for it to defrost properly adequately. Seems slightly unsanitary. Salmonella causes really bad UTIs. Shudders. Guy was camping with his frat buddies and they were firing air rifles at each other with a baseball glove on. The pellet was lodged well into his hand. Like, how did you think this was going to end? Baseball gloves aren't bulletproof. No kidding. You'd think it could stop an air rifle pellet. I guess that's one less experiment I have to do myself. A few stand out. Person somehow swallowed a spiked dog toy. Someone tried to reverse his circumcision by cutting more of his dick off with a pair of scissors. Guy who stabbed himself in the dick multiple times. About every object known to man up the bum. If you like it then you shoulder put a string on it. WTF was the logic behind number 2. I didn't even know you can reverse a circumcision. You can't. Unless you do skin grafts from skin somewhere on your body. One of the doctors my mom worked with almost got kicked out of his residency program because of a question he asked a patient. Guy came in with a dildo stuck in his rectum and the doctor asked him, "Do you want us to take it out or change the batteries?" Apostrophe. The patient thought that was the funniest damn thing he'd heard, but one of the nurses had an issue with it and reported him requesting he be dismissed from the program. They didn't do that and told him it was because the patient found it to be funny that saved him. They also told the nurse to lighten up since the patient found it funny. The patient probably appreciated the fact that the doctor didn't seem judgmental. I cared for a guy who injured his penis during sex and yeah, a little levity definitely made him feel less embarrassed than he was before. When I was in high school, the class clown had a big pool party at his house and decided to show off to everyone that he could jump from the roof of his garage into his pool. Keep in mind, that would have been an impressive jump, even for an adult in good shape, while this kid was a scrawny 15-year-old who was slightly intoxicated. No one thought he would actually do it, especially when his sister started screaming at him to get his ass down before she got them on. The laughing quickly died when he hit the ground and started screaming. He had broken his arm in 2 places when he landed on it. The doctor said he was actually pretty lucky it didn't hurt anything internal when he hit. He did have a long talk with him about how hard it will be to impress anyone if you're dead though. Jeez. I was so relieved when you said he only had broken arms. A young man in my country jumped in the wrong direction from a 10 meters diving platform and died. I was expecting that kind of story when I read that he jumped off a roof. My mom landed in the air last Christmas after falling while impersonating Kramer's in trances and scene filled for charades. Your mom sounds like a fun person. Hope she's recovered well. Oh, she's very fun. Luckily nothing was broken. She just has some knee trouble now. I've seen an internal vaginal laceration from someone climbing a fence while trying to see something happening down the street. Fuck, that hurt to read and imagine. My poor coworker had to hold her open, while an equally unlucky PA had to stitch her closed. I was the dumb injury in the air. I stepped off the sidewalk wrong and rolled my ankle so bad I tore all 4 ligaments. Because I was distracted by seeing a really cute puppy, I cut the tip of my finger off with a power saw because I saw a hummingbird for the first time in real life. They are beautiful birds, but my god it wasn't worth the pain, haha. Username checks out LMAO. Nurse here. We had a girl come in, and who knows what she was doing, but she had one of the thin glow sticks in her bladder. Maybe some fun finger/glow play during a concert? I don't know, but pretty wild. Also I had a Spanish speaking only gentleman explain why a shoe polish bottle was in his anus. We had to use a video interpreter due to the language barrier, but it was pretty wild to hear the interpreter say I have a bottle of polish in my anus, after expecting him to just explain why he had belly pain. We also proceeded to print out multiple pictures of common types of shoe polish. He used to ask him if it was this one or that one. It was hilarious when he identified what one it was based on the picture. He had to go to the lol wait, why does it matter which specific one does he have? Is it because like certain ones might be more dangerous than others if they leaked? Bottle shape, contents, and if it has a cap. Things like that. I had a patient come in with lacerations to her fingers. Her blender got clogged and she stuck her hand inside to clear it. She cleared it and the blender resumed blending. Luckily, she had long acrylic nails. This helped lessen the impact. I know a guy who lost 3 fingers in a snowblower like that. It got jammed. He stuck his hand in. The jam was released. Lost his fingers. Drove himself to the hospital. Passed out in his car just as he arrived. Edit typo. Same but with a lawnmower. Guy came in. After being concerned the bedsheet had stuck to his lower leg. Turns out he'd been using a petrol mower the evening before, and it had exploded. Full thickness burn to his calf. No pain. He wanted to go home to feed his cows instead of being transferred to burns and plastics. Man, it looked like white leather. Did it just burn deep enough that the nerves died so he couldn't feel it? Yeah, all the nerves were gone as was most of the fatty tissue and muscle. It was really indented. They used a needle to test sensation and there was none. He needed excision of the burn and reconstructive surgery. I remember him just wanting to see to his cows and having to tell him if he went home he'd probably lose his leg. Not a medical professional at all, but my boyfriend has a story of going to the hospital to see his mom, a nurse, and getting pissed off with the parking meter eating his change. So he punched it and broke his knuckle. Gave him another reason to be at the hospital. Now that is a good way to learn violence solves nothing. Mayo. Inhaled a blue gun dart. I work at a quilt store. I've heard horror stories about ladies who put pins/needles in between their teeth or in their mouth and get spooked by something or breath in too hard and accidentally swallow it. Having a machine needle through the finger is my biggest nightmare. Yeah, I've just added another thanks. I've stepped on a small needle. That was painful enough. Had a patient come in who had a light bulb wedged down his pee hole, who had apparently tried to run an electrical current into his anus to see if the light lit up. Apparently it did. But was it worth all of the ass burns? Question mark. How do you fit a light bulb there? Question mark. Question mark. He had a monstrously wide pee hole. It was pretty much the same circumference as his penis head. His rod basically just looked like an open tube. Former mental health worker here. Guy showed up who castrated himself with nail clippers. Nail clippers. This wasn't a quick slice with knife or a couple of snips of scissors. Had to take some time. Edit typo. This thread needs a spin-off for just genital injuries that make you cringe, even though you don't even possess the relevant set of parts. Apostrophe. Well, neither does he anymore. I was in the ER as a patient next to a guy who was brought in via ambulance because he superglued his eyelids shut. He was high as a kite, but so was I from the pain meds had been given for my own injury. Whatever meds I was given made me think everything was hilarious. I got yelled at by the nurses for laughing hysterically in the next room. He was being a pain in the ass. I was on diversion already, and they were not amused. A relative of mine did this, and it was a shorter visit. They just snipped his eyelashes off. Friend of mine as an eye document. When he was doing clinicals, he had a patient who, for reasons unclear to anyone, had superglue stored near his eye drops. So, guy grabs the wrong bottle and glues one eye shut. Guess it burned so badly, he didn't do the other eye. If I recall correctly, the water in his eyes kept it from sticking to the eyeball itself, but the lid and lashes were stuck together. The ophthalmologist on duty basically took surgical scissors and cut the lashes off, and then very carefully cut the lids apart. It makes me shudder to think about it. Obligatory, not a doctor or nurse, just support staff. But the one that immediately comes to mind was the guy that practically got his hand degloved because he wrapped a horse's lead rope around it. One would think it's probably not wise to tie an animal that weighs 1,000 pounds onto something that's attached to you. I'm afraid I don't know all the details that occurred between tie-up and the guy being hauled into my ear, but I guess you can call it the rope burn to end all rope burns. And this is why, when teaching new riders, that one of the first things they learn before being permitted to move with the horses is that lead ropes are always folded in the hand, never wrapped around. Degloving is one possibility. but so are missing fingers, broken or dislocated arms, concussions, and even death. Looping the lead rope might be easier, but it is one of the least safe things you can do around a horse. Second to walking behind them without letting them know you are there. And the best, calmest horse in the world is capable of one bad moment when a bird / bag / squirrel / ghost scares it into a sudden movement. We had a prisoner come in because he decided to put a plastic butter knife in his urethra in order to get out of the prison. It broke and he needed surgery. Another prisoner, who had been recently rearrested for assaulting a relative after previously serving 20+ years for murder, decided he just wasn't going to use the bathroom at all and came in with some damaged kidneys and such. He did it because he intended to escape from the hospital, not considering that he would be literally chained to the bed. For some reason one of the guards let him use the bathroom in his room and he tried getting away through the ceiling tiles. That was super fun. Not a doctor, but I broke my arm playing golf. I tried to do a Happy Gilmore type swing, hit the ground hard, and was holding the club wrong. Snapped my arm, so bad bone was sticking out of the skin. This may or may not have been an alcohol related incident. Alcohol may or may not have been related to many of my similar dumbass accidents. These seem to be mostly men doing dumb things to their asses. When I was 10, my friend's mom told me about how a patient came into the ER with a TV remote stuck up his ass and he claimed he accidentally tripped and fell on it. Ha 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 ha. Exclamation mark. Exclamation mark. Exclamation mark. Well, I guess we've all been there. Not a doctor, but freshman year of college. My friends and I went sledding in the dark. My boyfriend at the time and I were sharing my sled, and it got stuck on a tree root and threw us off into the snow. While we were trying to get the sled off the root, BF said, guys, it's a little breezy back there." He had been violated by the tree and was bleeding out the butt. I went to the ER with him and couldn't stop laughing as the poor nurse examined his taint. I felt like a horrible person. Wow, a true "I fell on it, that's why it was in my ass" story. For me it's typically young men who insert objects too far up their rectum and then lose their grip on those objects and can't pull them out. That is why commercial but plug toys typically have flanges at one end which prevents the object from disappearing beyond the sphincter. Young men who can't get access to commercial adult toys often use carrots. You can imagine how serious this is, as it will block defecation. It is also a very embarrassing emergency to explain to the parents, and not an ideal way for a young man to have to come out the closet. My friend's mom, who worked as an ER nurse, told me about how a lot of guys in that situation try to say they accidentally sat on it. I can just imagine how embarrassed that one guy who just happened to have fallen on a carrot for real must be. My cousin was a super horny teenager and gay as duck. I remember when I was like 12 and he was 17. He prolapsed his rectum using his mum's 10-inch dildo. I don't really know the details aside from that, and it's not been mentioned since. When he went to the hospital, we told our old relatives, great uncles and aunts and etc., that he had a rectal abscess, because if they found out he was gay they'd try and strangle him with their bare hands. It seems like a substantial amount of our visits are from men shoving things up his ass. Even if you're not gay, it is physically stimulating. But the stigma is that anything in a guy's but makes him gay. So dudes are out there playing with their own buttholes for the pleasure, but feel the need to hide it. That usually means using improvised sex toys as well, and those too often do not have flared bases. Guy literally ripped his own eye out cause his bud is dead him. Yes, drugs were involved. What the fuck? Exclamation mark. Question mark. Exclamation mark. Question mark. Or nurse here. We had a gentleman want to surprise his lady by using his wedding ring as a different type of ring. Almost lost his little buddy, but we were able to cut the ring off with no injuries. Deleted. It's probably the other way around. I was expecting bud stuff. I was not disappointed. I've seen someone put nail glue in their eye thinking it was eye drops. Another person came in with a Polly Pocket in their vagina. The doctor had to explain that her vagina is not a toy box. LMAO. Hard disagree with the doctor on that one. You just have to make sure you're using the right toys. Obligatory. Not a medical professional myself, but a friend who was at medical school at the time told me about the competition they had for worst things pulled out of orifices. The winner, unbeaten for a while, was a cocktail umbrella shoved, canopy end first, up a man's urethra. When it was pulled out, the umbrella opened a bit, so that the little extended sharp tips scraped along the walls as it went. Not a bloke, but hearing that hurt. / unbeaten for a while. What story beat his? I'm really sorry, but I don't remember. I know that at one point another item was an old Nokia brick phone though. Whilst skip raiding, dumpster diving, outside a closed down hospital many years ago, I found some accident and emergency unit medical records. The one injury which stood out to me was a poor chap who was impaled through his scrotum by a cast iron railing whilst trying to break into a school. Oof. I'm neither a doctor nor a lawyer, but that sounds like a serious HIPAA violation. If I knew what that meant, I'm sure I'd agree. Back in the 1980s, I'm hot sure there was data protection, like we have now. The number of people that burn their face by smoking with oxygen on is amazing. I saw one guy who had done it, and he had a burn that looked like Dallas mustache. I went to nursing school a few years ago, and my instructor told us this story about how a guy shoved a potato up his ass, was too embarrassed to go to the emergency room, so he just left it, ended up getting infected, and by the time he decided to go to the half of his ass had necrosis, was dead from the inside out. She said it was by far the worst smell she could ever smell. Did the potato grow roots? It probably wasn't being fed enough nutrients for that LMAO, but who am I to assume he wasn't shoving multivitamins up there too? My mom, who is a nurse, told me once about a guy she had to take care of who needed surgery to get a cob of corn that was stuck in his ass while he was trying to use it as a dildo out. Did it still have the corn on it? Asking the real questions. I'm not a nurse or a doc, but an ed tech. My favorite was the guy screwing around with his gun. He was practicing quick draws from the back of his pants. He shot himself through the ass. The dumb/funny part wasn't that guy, but it was his buddy that came in behind him, shot through the foot. The first guy shot the second guy on accident. They looked like frat buddies greeting each other in the lobby, haha. I'm the patient in the scenario. I broke my hip chasing my 1-year-old in the garden and landed on a brick. Nothing more, nothing else, just a brick that broke my hip. A nerd oct lived across the street from me growing up. The worst story he told was a woman who got an infection of some kind of crustacean parasite in her vagina. A really bad one that ultimately killed her in the hospital. She would take a lobster while sitting in the tub, insert the tail and stab it in the head. It would spasm and make the tail flip repeatedly, giving her pleasure. There was some kind of parasite that lived in the hinges of the lobster's tail that infected her. Ugh, it still haunts me. Huh. Well, karma got her for torturing animals, I guess. WTF. Not a doctor, but the victim. Nearly cut off the tip of a finger with a razor blade. Doing what you ask. Trying to cut a child safety tab off a bottle of antifrizz. Had to get one stitch after stabbing myself with scissors. I was trying to cut a zip tie holding a child's toy in its packaging. I'm not a doctor, but a kid I went to day camp with shoved a Lego in one ear and a calculator button in the other. Found Ralph Wiggum's account. Got to take it at face value, but a man came in bleeding all over the ear, shot himself with a shotgun, took out his entire right kidney and half his liver. He said he was leaning over and was cleaning his shotgun. He wouldn't go to the police because he didn't legally own the shotgun. That night we sent him off to a level 1 trauma center. He's lucky he didn't actually bleed out whole getting to our hospital. We were doing a back every 20 minutes in the ambulance. What are the different levels of trauma centers? And here I thought an old guy with a huge dildo rammed up his ass might qualify, but your posts are way nastier. That's just a typical Tuesday. One time I was walking and tripped over air, twisting my ankle to the point of breaking my fibula. One time, I was in my wheelchair, with one foot hanging off the side a bit. I move and feel my legs just fine. So normally this wouldn't be a problem. I use a wheelchair because of a balance problem. Got my foot caught on a chair leg in the room, and twisted my ankle. To top it off, this was at a BJJ class. Yes, I hurt my ankle at JIU Jitsu. No, It wasn't while I was actually doing jiu-jitsu. I'm super intrigued at how you perform a martial art with severe balance issues. How'd you get into it? I'm no nurse or doctor, but there was a dude who ran over his foot with a motorcycle. One of my brother's high school teachers decided to ride his motorcycle while wearing Crocs one day. For whatever reason, he dragged the top of his foot on the ground while riding and tore up the shoe and his toes. He was also diabetic and refused to take care of himself correctly, so his toes ended up having to be amputated. My sil was RN and worked the ER. She told me that one day a guy came in with his finger stuck in nose. By stuck, it well planted past the third knuckle. Seems he was sitting at a red light picking his nose and got rear-ended. I will never again pick my nose while driving. My dad is a doctor. One of the many ducked up stories he tells is from his residency. A woman presented to the ER with a chief complaint of a vine growing out of her twat. Yes, you read that correctly. This woman had a plant growing out of her vagina. Turns out she put a potato in her vagina to use as a diaphragm, a form of contraception. She apparently was told this would work to prevent pregnancy, but left the potato in there long enough for it to grow a vine. The smell of that potato must have been putrid. I mean, homegirl basically turned her vagina into a greenhouse. Not a doctor/nurse, but the cause of a dumb injury was cutting stuff on my table saw. Turns out I didn't have the guide square to the blade. Made my cut. Shut saw off. Saw grabs cut piece and pulls it back through the saw that was spinning down. Saw finishes spinning down by getting stopped by my finger. Tell my wife I'm going to the hospital cause I think I cut my finger with the saw. She asks me how I could think and not know. So I say it could have been the jagged wood. So I go in with the tip of my finger almost cut off. Trig nurse asks what happened. I explain. She asks if I'm allergic to anything, and I immediately reply table saws. Had the entirety of the ER laughing at me, either for my comment or my brilliance at stopping the saw with my finger. My wife works in the operating room. She came home one day and told me that they had a patient with mental difficulties who wrapped an elastic band around his penis until it necrotized. The doctor had to perform a pinectomy. Then he grafted skin from the patient's leg onto the penis to fix it up as best as he could. I always wondered if the hair follicles would continue to work after the graft, so his organ would always have hair growing on it. They do. Patients going into planned reconstructions like trans people get loads of electrolysis to remove hair from graft areas. We had a teacher in junior high who had a skin graft on the inside of his ring finger and onto his palm a bit. Grew hair and he would constantly show us. It makes me want to grind my teeth thinking about it still. People getting things stuck in their anus, vagina, penis hole. Medical assistant here. We had a patient who tied his scooter to the back of a Jeep by using a rope. The handlebars ended up detaching and flying off, resulting in what I assumed was a pretty epic crash. He lost a couple teeth, had road rash, and a bad enough break that his arm needed plates and screws to piece the bones together again. It was hard not laughing in his face when we asked how he was injured. Guy was huffing a can of compressed air duster and passed out. He landed on top of the can and was out for some time. Well, those cans get pretty cold, so he ended up with some pretty bad frostbite on his arm. He had been huffing out in his driveway, so someone spotted him passed out and called the ambulance. We had no idea what was going on with him or why he had frostbite in the middle of summer. His buddy called looking for him as we were getting him settled in. He clued me into his friend's huffing habit, so I walked into his room and without saying a word I pulled 3 cans of dust off he had hidden in his pants. I was gonna say that my dad jumped off a picnic table, but now that just seems pathetic. Trying to break a windscreen. Got a cut, laceration, through the elbow, and decubital fossa, and bled from all the vessels. Eventually operated on by a vasc surgeon. Had a patient come in with a full cucumber stuck up his ass. He claimed his roommates pranked him by sticking it up there while he was sleeping. Judging by how deep it was and the scratches/breakage on the end, it was clear that they had been trying for a long time to get it out. A guy bled to death after a baboon bit his dick off. Full disclosure, I'm not a doctor or nurse, but I did work closely with them for many years while living/working overseas and got to see some really messed up stuff. Close bracket. Why isn't this reply higher up? I ran up a set of hardwood stairs in socks, slipped, jamming my toes into the stairizer, broke 3 toes, and ripped the ligaments from the other 2 with a sliver of bone. No treatment except ice. I was like 30 years old. Also dropped a waterlogged railroad tie that probably weighed several hundred pounds about 6 feet onto the bridge of my foot. Couldn't walk on it for 3 weeks and it still hurts 30 years later, especially in ski and snowboard boots. My buddy was the dumber injury. He tripped going up a set of 6 stairs and somehow cracked/fractured his sternum. I do not work in an ed, but I had a patient who had a stage collapse on him. I don't know how this happened. He was at a very famous place, you would assume it was solid state, and the ceiling fell on him. Guy was a stagehand. People screwed up the rigging, and bad things happened. Nice patient, though. He was in horrible pain, and just worked through it, and I got him up and running. He was one of my first patients. I used to work in the addition. Woman came in CO stomach pain. N/V/D. S/P trip to Mexico. As she was being D/to home, she mentioned this always happens when she goes to Mexico. And did I have any suggestions? Yeah. I said. Don't drink the water. Haha. Right. Close bracket. Turns out, she had no idea about ice in drinks. Eating only peeled fruit. The whole thing. So I got to do some ed on visiting places without potable tap water. I think the multiple trips qualifies this as a bonehead illness. The peeled fruit thing is new to me. Why? Because the peel will have all the pathogens your body isn't used to on it, and you handily throw that part away. Knife through the palm of a hand from cutting an avocado. Why would you have it in your hand with the knife? Place it on the cutting board and roll it as you cut. There's currently an epidemic of avocado related injuries in the Netherlands. Apparently. To the point where doctors are making appeals on national news to be careful and use a spoon to remove the pit instead of stabbing it with a knife. Well, my mom is a nurse and she once had a man come in and said he rolled over in his bed and got a curtain rod stuck in his ass. I had a couple of doctors and several nurses come to laugh at me. I was in with a suspected broken nose. I was trying to see if the light in our chest freezer went out when you close the lid. I bent right down to line up where I could still see the light. My hand slipped and the lid dropped straight down, trapping my nose. I was 12. A childhood friend impaled his scrotum sack playing backyard tackle football on a small stick that his nerdy cousin set up to make a sundial in the middle of the backyard. One of my friends is an emergency doc, and she told me about a dude who came in with his penis stuck inside a shampoo bottle. They had an extra hard time cutting him out of it. Head waited so long to get help that a ton of blood had pooled in his penis. The moral of this story, and lots of others in this thread, is to buy real sex toys rather than improvising with household objects. Not a doctor, but I had a really embarrassing situation. I fractured my ankle freshman year in pet. Sounds cool, right? Wrong. I was playing soccer and the ball went out of bounds. As I was throwing the ball back in, I rolled my ankle to the point it dislocated. My mom always told me to walk off a sprain, so I stepped down, and the minute I did, it popped in place and fractured. My classmates thought I was faking the screaming. I went to school the next day high from the artsy with a cast and crutches. Walk off a sprain and not even a doctor, and I know that's awful advice. Haha, yeah, my mom never said that again. I have weak ankles and rolled them a lot. I tend to especially roll them when I'm drunk. I fell off the sidewalk leaving a club and rolled both my ankles and was so drunk I didn't notice. I woke up the next day and couldn't even walk, lol. We had this group of Facebook friends all come and so sick we had to put them in the ICU. Most of them got out with a bill close to 100k if they didn't have insurance. All had long-term side effects. The others died alone in hospital. All these idiots had to do was wear masks and not hang out with people till the vaccine came out. So easy. So stupid. Pencil in the urethra. Drunken truth or dare with high school students gone horribly awry. Parents came in, and it turned into a full-blown shit show from there. Definitely not the dumbest. but hella funny. At a 4th of July party, a drunk mom tried to teach the kids a 90s hip hop dance in attempt to embarrass her teenage son. She misstepped and ended up breaking her ankle bad enough that it required surgery. Task failed successfully. Her son was embarrassed. Not a doctor, but dying from accidentally tasting yourself in the testicles as you storm the Capitol has to be up there. I was an anesthesiology resident then, had to stop for health reasons. Ironically, some bumbling person decided to drink until stupidity at a 6th floor of a building that was in construction with his pals. Why, we know the story is basically this guy's. When they left, he decided he didn't want to live. So he tied a rope on an open window frame and hung himself on the 6th floor. The frame broke, making him fall 6 floors directly into his face. Good news, he survived the impact, and every meninge protecting his brain and the good old spongy grey one were intact. Bad news, his cranium was broken beyond recognition though, and his arms were broken in several pieces. Can't remember the exact number of fragments, more than 50 in total from both the cranium and the arms. But the first reconstructive attempt, just to save him, took 16 hours. 2 surgical teams working at the same time. Many bags of blood and a lot of equipment, leaving the hospital almost with no metallic materials for any other intervention. Then he was sent to the Neurology and Neurosurgery National Institute. Not sure what happened to him. Edit, some clarification. Working as an X-ray tech in a local 2 in the morning. 16-year female with parents are placed in one of our close trauma rooms. This was around 2005, when X-rays were still plain films that had to be hung on light boards. Her MD ordered a stat pelvis for possible foreign body. Sure enough, there is a small mag light that has gotten itself kind of stuck. Parents brought her in due to the concern of a burning sensation. Light must have been turning off and on with movement. I hang the films up on the light board in the trauma room and the MD walks in. Parents are beside the young lady. Doc looks at the films, turns to the girl and says, "Well, I can do one of 2 things. I can remove the light or change the batteries." Apostrophe. You could hear the girl turned red. I work at a vet clinic, and one day we had the cutest little puppy come in for a mass on abdomen. Owner said he already popped it at home, but now the dog just isn't doing right. The mass on abdomen was a hernia. This dude popped his dog abdominal hernia. Can you imagine having your guts just popped like a pimple? I'm not a nurse or anything, but I have gotten hurt many times and had to go to the ER many times. So one day I was chilling in my back room with some family and friends. We have a pull-out couch. That's important, remember that. So I folded the bed with the sheets and everything on it, so me, my cousins and friends would have more space doing stuff. I can't remember what we were doing. After like 10 minutes everyone had left the room but me. That's also important. I was sitting on the couch on the bed part. It was stuck because of the sheets, so I was sitting on the top of the folded bit. The slash mark this is an example slash. My foot was on one side of the couch and the couch fell on my foot. My foot was stuck between the metal bed frame and the hard couch base. I couldn't stand up, so my knee was by my head. I was not going to get my foot out. So I tried screaming, because nobody was in the room. Well, I can't scream, so I started yelling till someone heard me. I told them to get help as I somehow got my foot unstuck. I was taken to the ER and had sprained my ankle. But when they asked what happened, I just said I got stuck in a pull-out couch. Moral of the story: don't trust the couch. I don't work in an ER, but in middle school this guy turned around quickly and accidentally hit a girl in between the legs with his knee. She ended up ripping her vagina. Getting hit in the groin hurts regardless of what you're packing down south. I mean, there are those zany things people do, all the stuff up the butts you are already reading, etc. All the 100 miles per hour motorcycle accidents, and what generally falls into the what did you think was going to happen stuff. X. Never flown a hang glider. Let's steal dads during this winter hurricane force wind. Also, obviously drugs to terrible things to people, who then do awful things to themselves and those around them. I guess that's dumb. Suicide and attempts are generally just sad, but some people just have no idea how to kill a human being, especially themselves. For instance, if you want to leap to your death, a freeway overpass probably isn't going to do it. You might die. but you might just break 15 bones from the waist down, including opening your pelvis like a book, get some spinal compression fractures, a punctured lung, and ruptured spleen. Don't buy 50 feet of cheap ass 3/8 foot rope, tie it around your neck, and try to decapitate yourself by driving off real fast in your car. Your car isn't that fast, and cervical collars are even worse with a bitten off tongue top, broken hyoid bone, and crushed larynx. One lady tried to shoot herself in the temple twice and missed both times, jerking her head away, except for some powder burns on her eyebrow. Having scared herself sober, she jammed the gun into her coat pocket. It went off. AMD, she gave herself an in and out through the front of her right thigh. Finally, don't put a 22 in your mouth and pull the trigger. The thing about a 22 bullet bouncing around inside your skull doing more damage isn't really true. You'll probably flinch, blow your ability to smell away, lose an eye, and one of your frontal lobes, and they'll probably save you. Fuck. From extreme depression to extreme depression and trauma. My mom was an admissions worker. My two favorite stories are: a homeless man came in with a beer bottle and took cans of beer up his bum. He freely admitted what was up there, and she asked him why he had done that. He said, "Well, I was high on meth, and it seemed like a really good idea until I was sober." A man was exchanging tires for a gun. The gun owner swore the gun wasn't loaded, saying, "See, it's empty," and proceeded to pull the trigger and shooting the tire owner in the arm, completely shattering the bones. Had a part get gangrene on his scrotum from trying to get rid of a pimple using apple cider vinegar and an onion from his garden. Within 2 days there was no skin nor fat in a foot radius around his scrotum. It was the gnarliest thing I've ever seen, but he and his family were incredibly nice. I had the dumb cause. Got hit by a reversing car because I thought it was a friend and needed to put my bag in the boot. Turns out I had the wrong car. On my first day working at a regional hospital, we had a 76-year male come in with a screwdriver stuck in his no-no. Just to be clear, I'm referring to his penis here, not his anus. Apparently he had been taking part in this practice for quite some time and simply took things a little too far this time. He needed numerous surgeries and likely never regained adequate function or sensation. You mean besides all the easily avoidable accidental discharge injuries I treat every year? Seriously folks, stop waving your guns around in the house. Not me, but my mother. In college she worked in the filing staff, getting basic information from patients, etc etc. One day a woman who she claims had to be around /700 pounds, just morbidly obese, to the point where it took 4 grown men just to roll her over. She came into the by ambulance, complaining of abdominal pain. They assumed she was constipated or something, and they truly weren't taking her seriously, because she was a huge bitch who continuously bossed people around and probably was being overdramatic pain-wise. So my mother comes in to ask if she needed water or something, and because she was having abdominal pain they didn't want to get her anything to eat quite yet until they knew what was going on. The lady starts losing her ever-loving shit that my mother will only get her water and not the 10 cups of pudding she requested. She continued to throw a bitch fit until she eventually rolled herself out of the bed, full well knowing they couldn't get her back up. She ended up cutting her head on a tray on the way down, requiring stitches. Also the abdominal pain caused by a lost remote. Where do you ask? In her rolls. Which rolls? In between her tits. Not the dumbest, but certainly the funniest for me. So this young kid, early 20s, comes in Tridge all panicked like and nervous. Chief complaint was lung infection. We bring him back, and before I can even ask him his name, has yap in a mile a minimum saying has gonna die and has so stupid. I finally get him to slow down and ask what happened. He just keeps swearing has got a lung disease. Long story short, his girlfriend had bronchitis and gave him oral sex. She told him after, and he freaked out. He wanted us to check his penis for bronchitis. I'm trying my hardest not to laugh in his face. BC, he was first off dead ass serious and almost in tears. Secondly, trying to be professional. So I do the only logical thing. I grabbed my buddy, also a nurse, and asked the guy to tell him the story, cause it's always better to get a second opinion. Once he hears the story he starts cracking up. I lose it, and this guy's crying saying we don't care if his dick gets bronchitis and falls off. We eventually pull it together and tell him he needs to see a doctor right away. Walked his dumbus back to fast track, and he was discharged in 10 minutes. Lol, fun times. Ertridge is sometimes the best free comedy you can get. Can't make this shit up. I read pretty far down and have yet to come across anyone who had to deal with gerbiling. I'm surprised. I was told several stories from a long time Aaron about having to pull dead ones out of guys. JFC, how is that not animal cruelty? Question mark. Mostly because it's an urban legend. Just reading this thread hurts so bad. Not me, but a story from my mom. The patient's partner had stuck a loaded gun inside of her during foreplay and accidentally shot it off inside her vagina. Apparently she was a very sweet patient, made a full recovery, and her boyfriend was very attentive and apologetic. It was really funny watching my very sweet Christian mother retell this story though with a look of horror. How is that even possible? That she made a full recovery? I feel like there would have to be some irreparable damage. Not a doctor/nurse, but my friend who is once said someone came in with an infection in the abdomen, where their colostomy bag was attached. After some investigation, I can't remember if the patient eventually admitted it, but apparently they thought it would be kinky for their partner to try and have sex with the hole. This burned an image in my mind that will never leave. I had a buddy once cut his nutsack open while climbing a metal fence with pointed tips. He had run up to the bathroom and cried for his mom. Knew he was in real bad shape. Told her he had cut himself shaving there. He went to the and his mom proceeded to tell him that a lot of women prefer some pubic hair. I think I've had enough Reddit for a lifetime. Had a man come into he dropped a burning match in an empty wine bottle and put Captain Winky onto the top of the bottle. Turns out the bottle will break when you smash the bottle, but the bottleneck is surprisingly strong. The guy went to the toilet outside and accidentally sat on a hedgehog. Patients who got covered after large gathering. I once broke my arm falling off the stairs sliding down. This is from my grandma. One night a man came in with a broken glass ketchup bottle shoved up his ass. He was bleeding and it was stuck. Please click subscribe if you enjoyed this video. Doctors and nurses of Reddit, what's the worst thing you've seen on the job? My mother was once lifting up the folds of fat on an obese person to check for abnormalities and found a biscuit. Not a doctor or a nurse, combat medic in the army. This is a story a PA told me. A girl came into the clinic complaining of veal pain, and when he went to examine her he found she was having thick grey oozing veal discharge. He tried to prescribe her medication for it, but she refused to take it. Why? Because her boyfriend liked the taste. A homeless paraplegic woman was brought into the ER for pneumonia. We had to strip off all of her dirty clothes and put her in a hospital gown. As I took her pants off, I noticed a cockroach, which I thought was weird. As we took her panties off, out came the swarm. Roaches had nested in her V and she couldn't feel it because of the paralysis. Nursing student here. Had to insert a catheter into a pretty obese lady. Saw a black string hanging from her V. I asked her if she had a tampon in and she said, "Oh, I hope it's not still there." I ended up having to pull it out and the stench will be with me forever. Not to mention the white pus and brown slime covering a now black tampon. Apparently she hadn't had a period in months, so who knows how long it was in there. Edit. What a great post to call my first Reddit contribution. My sister, gynecologist, told me this one girl comes to hospital, complains that she's unusually smelly down there. Sister takes a look. Sure enough there is something not right there. Upon further inspection my sister notices there is an object deep inside her. Sister, there seems to be something stuck inside your V. Do you know what it could be? I'm going to take it out. Patient, no please don't touch that. It's the cap to my deodorant. I'm keeping it there as a contraceptive. Sister, what? Not as gross as some stories I've read, but this is one my mother told me after a night working the ER. A guy came in with his D broke sideways. He said my girlfriend got a little too excited. Another one where my dad was driving an ambulance. It was time to remove the cast for a very large woman who broke her leg. He was sent to pick her up. She never got up from her chair since getting out of the hospital. For months she ate and pissed herself in her recliner. My mother is the one who removed the cast. The cast was full of cockroaches and roach eggs. They said the ambulance and the exam room smelled for days. I am an EMT, so not a doctor or nurse. But this story makes even my ER surgeon friends nauseous. A few years back I got a call over my radio saying that there was a trapped woman in her home who needed medical assistance. I was the first responder, so I go into the house with my bag and immediately I'm hit by a wall of stench. Now, this odor is not just the, oh god, you need to air this place out, odor. It's the sweet mother of God. I can taste it. It's in my eyes. I have to burn the clothes I'm wearing. Odor. Obviously this woman was some kind of hoarder. There were cats everywhere. They were just sitting on top of it that had piled up in the house. There was cat on the walls, the floor. I saw families of cockroaches skittering around. Disgusting. So I called out to identify myself as a paramedic and I hear this woman calling me from down the hallway. As I pick my way through the house the odor just gets worse. It was like someone covered themselves in baby vomit and then rolled around in a field of rotting flesh. I come to an open door and lo and behold there is the woman. Or should I say whale. This woman had to weigh at least 450 pounds. She was naked, covered in it, and wedged between her toilet and her bathtub. I nearly lost my goddamn mind. The desire to vomit was so intense. I asked her what happened, donned my gloves, as well as a mask, and started to think of how the duck I was going to get this woman out. I'm not small, 5 feet 8, 155 pounds woman, but damn I'm not Hercules. It's about this time that more EMTs start arriving, as well as a few cops. This rookie cop comes racing in, sees this woman covered in it, and vomits right onto her. This sets off a chain reaction. The woman begins to vomit. More EMTs and cops come in, and everyone is ducking vomiting. I'm standing in an inch of vomit juices that is now mingling with it, and I'm just trying to figure out what to do. Turns out we had to call the fire department, get the jaws of life, and rip the toilet out. We didn't have a stretcher that could support this woman's weight, so we had to improvise. When we got to the ER the doctors and nurses looked so incredibly disgusted. Now, keep in mind we're covered in it and vomit, with that horrible odor of the house clinging to us. We had to go into a decontamination room to get cleaned. Worst day ever. TLDR. Some grossly obese woman got wedged between her toilet and tub. She was stuck there for several days, had explosive diarrhea, and I was the first responder. Cops and other EMTs started vomiting everywhere. I was covered in it and vomit by the time I was done. I honestly wish this was a fake story. Mom in the ER. Guy came in with a pencil and a straightened cloth changer up his urethra. Both stuck good. Apparently, the pencil was for fun and the hanger was to attempt to dig the pencil out. When I was doing my OB-GYN rotation, we had a woman come into clinic that had a condom in her V. Apparently it came off during sex with her boyfriend, but they didn't take it out, and she waited like 2 weeks to come in to get a doctor to remove it. She stunk the entire office up so badly. I found a nursing forum once that had a huge thread of also worst things stories. The one that stuck in my mind the most was a patient who was recovering from a colostomy operation and went into cardiac arrest. As they were doing chest compressions, semi-liquid was spurting from the brand new colostomy hole. I'm an EMT, and some of the worst things I've seen are the atrocities committed at nursing homes. Just as an example, we picked up a guy last week to take to the hospital who had chewed down to the first knuckle on his index finger. When I asked why he had done this, he replied, "So I could get out of this place." I truly believe that nursing homes are the worst places to send the elderly. Care for your parents when they get older. Don't send them to these holes. Edit. Spelling. A friend of mine worked in a psych ward. On a night shift, a guy jumped from the second floor. Not sure how he got out. I never asked. The nurses ran out, and was surprised to find him standing on the lawn outside. He was screaming his throat out. but was still standing upright for some reason. As they got closer, they realized why. He'd snapped both his legs straight off in the fall, causing his splintered shins to impale the soil like a couple of organic javelins. My friend still shudders when referring to the blood, the creaking of the bones, and the screamingus. I've been an RN for over 5 years. The story that sticks out in my mind is this elderly woman who had colon cancer. I was newly pregnant, very bad morning sickness all day long. She was on the verge of death and started vomiting the contents of her bowels. When the bowels stop working, the stuff can come up out of the mouth. We had to get a tube down her nose ASAP to start sucking the stuff out so she could no longer puke it and die in peace. Those are hard moments. Watching someone dying and you are almost physically unable to help them. And usually I pride myself on being able to handle the most disgusting of situations. Someone had to come in and help me. Thank goodness. And we got the tube down her nose. A friend who was a field medic in the army told me this story. While he was in training at a military hospital, they would provide free medical attention to civilians that couldn't afford it on their own. He said that a black woman in her 70s came in with what turned out to be a prolapsed rectum dart, but that's not the interesting part. When they went to roll her onto her side, one of the guys grabbed her arm and it just flopped freely like it was just hanging on by skin. They freaked and said, "Are you okay? Does it hurt?" She replied, "Nah, that's no big deal. I just have a bad arm." As it turns out, when she was 16 years old, she fell down and completely dislocated her shoulder. They didn't have access to medical attention, so she just lived with it like that for 50+ years. She just conceded that she would never use that arm. He said that it could have been reset very easily without surgery, if they would have taken care of it when it happened. This story makes me so sad every time I think of it. After reading this thread, I feel like the picture of health. Thanks, Reddit. My dad is a doctor in the intensive care unit. One day he had a lady who was crossing the street when a coach bus ran her over. She was dragged for 2 blocks before someone stopped the bus. She came into the hospital missing like 80% of her skin and was disemboweled but conscious for the whole thing. Most disturbing thing I can remember in recent history was someone with cysticercosis, tapeworm infection, of the brain. I got a script for a duomo with a ridiculously high dose. I called the DR thinking it was a mistake and he told me what was up. We both agreed there was very little chance of it working, but he said there were absolutely no other alternatives. A woman came in with complaints of abdominal pain, screaming about how her baby was dead. Her record showed absolutely nothing about being pregnant. After having her change into a gown, the most ungodly stench filled the room. My doc began a pelvic exam, with me as a standby. I will never forget his face as he removed a pinkish brown clotted mass, a chicken leg. Turns out her baby was an uncooked chicken she chopped up and inserted into her V. Her baby might not have been dead, but that chicken sure was. Guy came in with severe abdominal pain. Turned out he had painful hemorrhoids which had led to him being too scared to take a dump for 1 month. He couldn't tolerate any of the normal treatment, laxatives and enemas, so he ended up being taken to theater where I, the most junior member of the on-call surgical team, had to claw out this monstrosity of a turd with my fingers. It was this dense mass about 4-5 inches wide that felt like hardened clay and smelled exactly how you might expect a ball of it that's been brewing for a month to smell like. Took a good half hour before I managed to clean him out, all while the nurses tried to stand as far away as possible and my seniors pissed themselves laughing at my horrified expressions. Mine is not a story of genitalia nor hilarious STDs. I'll warn you now. Both my parents are doctors. They were working on the 11th of September 2001 at military hospitals in DC. When the planes hit the supposedly less populated half of the Pentagon, there were hordes of burn victims. I was relatively young at the time, but their faces when they came home is something I won't soon forget. They told me about a burn patient who was literally covered in 3rd-degree burns across his body, from behind the ears to his tear ducts all the way down to the soles of his foot. From what they recounted, he was absolutely silent when they brought him in, despite in essence having the raw meat of his body exposed to air, something that should be excruciating. Skin, it turns out, is the biggest defense the body has against infection. Within 24 hours his body was covered in massive black bleeds and infected sores. He still didn't say anything, not even a moan, or so I'm told, until he died. TL. Doctor, sometimes it is worse to live through a terrorist attack. Here's a story from my cousin, who's in med school currently. There was a PCP who went to some part of Africa, I don't remember where specifically, sorry, for the Peace Corps. When he came back, he found he was always more tired than he was when he left for Africa. One day he felt a pulsation in his eye and went to the ER. Once there, the doctor found a small worm wriggling around in his eye. The worm normally lives near the brain, but had somehow made its way out from there and into his eye. The ER doctor hadn't seen anything like it and called in another doctor to come and look at it. By the time the other doctor got there, the worm had made its way back out of the eye. Cut to about a month later and the PCP feels the pulsation again. But instead of returning to the hospital, he decides to take care of it himself. He takes a needle and heats it up using the stove. He then puts it into his own eye in order to remove the parasite. Over the course of the next year or two, he removes, if I remember correctly, around 5 of the worms this way before feeling better. Girlfriend and nurse. Early one morning a man came in with a broken off plunger up his butt. He was sodomizing himself when it somehow broke off, splintered his sphincter and lodged itself deep within his rectal cavity. Needless to say, it was quite gross to remove and looked incredibly painful. An ex of mine is a physician. His holy ducking it, you'll never guess what I saw. Today's stories always involved fat people and poor hygiene. Like cheesy infected smelly folds often harboring remnants of snacks and the like. Also, he was present at a birth once that involved a stillborn. He said that was pretty horrific emotionally and physically. I'm a pill runner at a hospital on Long Island. I've seen gunshot victims, stabbings, car accidents, etc. But these gruesome injuries aren't the worst I've seen. A young guy overdosed and was in ICU with a coma for a week. Throughout that week it seemed like hundreds of people came to visit the kid. It was extremely sad seeing how many people cared for him and how much he was loved. I'm a pediatric ER nurse. The worst stuff I see relates to abuse. 2 weeks ago I treated a baby who had been beaten so severely that his skull bones kept shifting under my hands when I assessed him and assisted in putting a collar on him. A few months before that I saw a 3-month-old girl with a torn V from being a victim of abuse by her 15-year-old cousin. But then yesterday I took care of a really cute 4-year-old who hugged me for making him feel better. I am not a nurse or doctor, but I remember a story my grandmother told me, who is a nurse. She was telling me about a Jewish guy who fell off a motorbike and was in critical condition. He was in desperate need of blood but his family would not allow it, because having foreign blood would make him impure or something. My nana thought that it was ridiculous and through some persuasion managed to get the consent from the family to give the guy his transfusion. Although afterwards his family disowned him and he later said that he would have rather died. Worked on a rural EMT team during summers off from college, and responded to a drunk driving accident. When we arrived, I thought clearly this guy has to be dead, mostly due to the crumpled car that the firefighters had cut apart. This guy must have been drinking a lot, because there were beer bottles all over the place, with broken glass shards all lodged in his skin. But that wasn't the worst part. He had the remnants of a beer bottle lodged in his neck, which in and of itself wasn't too bad. I've seen worse, except the bottle was the only thing keeping his head attached to this body. The man had decapitated himself. I'll never forget seeing his eyes moving and mouth attempting to speak, or the sick sucking sound that were emanating from his neck as he struggled to breathe. Obviously, he did not survive the night. My wife worked at an ER in Dallas, TX for a while she has many stories of mutilated bodies, burned victims and gunshot wounds. The one that got me was this one. A kid, about 13, and his mom come into the ER. The mom had dragged the kid in because he was complaining of real bad digestive problems. The kid had convinced her he was fine, until he couldn't hide the bleeding coming from his anus. They take him in for x-rays and see, clear as day, a 14 inches black rubber cock, like in that movie. They didn't know it was black then. Found out later. Obviously, this thing had wedged itself up far, most likely due to his efforts to remove it. was pushing on the walls of his intestine and had 3 days worth of it piled on top of it. They take him into a private room and ask if there is anything he wants to tell them before they discuss specifics with his mother. It's going to need to be removed surgically. He tells them no. He just felt sick. They tell them they had found an object lodged in his lower intestine. His response, "Oh, I may have sat on a marker. Poor kid. Just experimenting with that sexuality. With a black 14 inches rubber cock." I really hope relevant Rule 34 doesn't show up for ARP's post. Morthand chick was letting Johns duck her colostomy hole. I think I'm done. Not just with the internet. I'm just done. I'm out. GG. My mom used to be a nurse at a children's hospital in Pittsburgh. The worst I can remember her telling me was there was a little boy born without eyeballs. Other than that, it would be the families that would bring their kids in and not even visit until it was time to take them home. My roommate is a nurse and there is a homeless guy that comes to ER regularly. Apparently this guy had a major surgery in the last 10 years where they removed something from his stomach, or that general area. After the surgery he woke up and just left the hospital without letting himself healing. He proceeded to do drugs such as meth and his body was never able to heal properly. Apparently he comes to the ER about once every week to rebandage his intestines. The nurses have to rinse and sanitize the intestines and rebandage him up every time he comes in. They simply take a large bandage and wrap it around his midsection. He has been seen outside the hospital holding his intestines with a plastic bag pressed to his stomach while smoking cigarettes. Was at a Hans Rosling lecture once when he talked about his time as a doctor in Mozambique. To illustrate how rudimental the healthcare was, he retold a story of a pregnant woman who had been in delivery for 48 hours, risking to die. The baby had one arm prolapsed, apparently cut off from the rest of the circulation. It had started to miscolor from necrosis, and was effectively stuck. Emergency cesarean was not an option where he was at. Rosling couldn't say for sure that the baby was dead. He thought he might have heard faint heart sounds, but he knew it was going to die either way, and so was the mother if he didn't do something. After discussing with the pregnant woman's mother, Hans commenced cutting up the baby from inside. Apparently not an uncommon procedure if the baby is dead and you don't have access to the equipment required to perform a cesarean, and pulled the parts out. Apparently the woman survived. Wife is a nurse. Back when she was working at another hospital, she had been taking care of a meth addict. This person looks like your typical user off Breaking Bad. Anyways, she tells me that this one time someone came to visit her, and while the visitor was in there, one of the other nurses saw the visitor putting something in light fixture. The other nurse thought it was strange and went to go see what it was, thinking it was probably more drugs or something. Anyways, what she pulls out has got to be the most disgusting thing I can think of. She takes it out and shows it to my wife. My wife immediately knows what it is and tells her she needs to get rid of it and wash her hands right now. What was it? Well, the person visiting was also a meth addict and had pulled off some of their scabs, which for those unfamiliar can contain meth, and placed them in light fixture for the patient to eat later so they could get high. RN here, and I gotta say, as horrifying as these stories are, I am laughing as much as retching. Guess I've been a nurse too long. Anywho, here's my fun tale. Had a very obese man, 400 plus lbs, with a swollen scrotum. No kidding. His ballsack was the size of a basketball, just dangling there between his legs. The gross part was when he went to sit down. Yes, he could walk a few steps with lots of help. He would grasp the handlebars of his walker and start swinging his hips back and forth, to get his ballsack swinging. Then, at just the right moment when his basketball-sized junk was out in front, he'd sit down quickly so as not to crush anything. I pride myself deeply in being able to keep a straight face through that ritual. I never once saw a male nursing assistant who didn't choke with laughter watching him do it. Maybe not the grossest story here, but it might at least not give anyone nightmares. She was just making a little money on the side. I tried to read this thread while eating breakfast. My mom worked for a urologist. She came home with a story of this guy that had a master lock attached through his D. He misplaced the key and was looking to get it off. He also rode his bike to the office. They had to refer him to the hospital to remove the lock. My GF worked as an EMT for a bit. She had a case when she was in training where a guy took some kind of psychoactive drug and thought his fingers were trying to attack him. So he shot them off one by one with a handgun. It was just a bloody, pulpy stump left on his left hand. He obviously had to stop when he wanted to shoot off the fingers on his trigger hand. Not mine, but my sister. She was working at an old folks center near our house, and she was with this one older gentleman. On his hip was a blackhead the size of a dime, on top of a decent sized lump, about 2 inches long, an inch wide and half an inch tall. So she threw on some gloves and squeezed the blackhead. With the permission of the man, of course. Out popped this roll of gauze that was left over from his hip surgery 10 years prior that he never bothered to get removed. Apparently the smell was horrid and she will never forget it. 4th year med student in Nicaragua. While working in the family planning ward of a health center, a woman comes in for a postpartum checkup. We ask her if she is keeping her V clean. She says she is. She is lying. We ask her to take off her pants and she keeps making excuses but eventually does it. The moment her pants go down, panties are still on. The whole room smells like rotten cheese and this only gets worse as the rest of the examination goes on. Looks like she had candidiasis. The other doctor with me does checks her uterus with a speculum and then takes it out and has to sniff it. This was my first time checking a uterus. Asks me to look into it and then makes me sniff the speculum. Sticks it right up about 1 centimeter from my nose and there is a blood clot on it. I feel like a part of me died trying to suppress the vomit. TLDR. Girl's cooch becomes playground for mushrooms and smells like rotten cheese. Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? Not a doctor, but my human sexuality professor in grad school had some interesting stories. He worked a lot in very conservative Christian communities and so a lot of times people got married with no sex education. He had one couple who couldn't get pregnant. Turns out they thought sleeping together literally meant sleeping in the same bed. Another couple was in therapy because neither one of them enjoyed sex or ever had an orgasm. After having them talk through step by step what they did in bed, he learned the guy was just sticking it in and nothing else. He told the guy to move back and forth next time and see what happened. The couple came back one more time to say thank you, and didn't need any more sessions. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like as a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped and it wasn't to help her walk on her post-op knee. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, doctor. I had severe asthma as a kid. I was intubated for a severe attack a few times. My parents were instructed to take better precautions in our home and went through instructions. More dusting, washing bed sheets, etc. And the big one, no smoking inside the house. So my parents agreed to all of this. Few weeks later I'm back in the hospital. A doctor recognized me and came over to talk. Then he bent over and smelled my head. I'll never forget that. I thought it was so weird. He told a nurse to sit there and not let me leave with my parents. When my parents showed up he asked point blank, "Did you not understand what I told you last time? Do you understand these attacks could be fatal?" But we opened windows and have stopped smoking in her room when we put her to bed. I saw a patient for a follow-up after 3 ER visits and as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2-4 hours with no relief. This raises suspicion to me, as the same meds are working in the ER. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Binnaker and swallows. I felt really bad. He had never received any education about his illness or medications. A mother came in with her son to discuss treating his acne. Son was about 15 years old and didn't really care about the acne, but mom did. After going over treatment options, she asked if he just needed to do it to get rid of the acne. A grown woman with a child thought that by him having sex his acne would magically go away. SMH. Edit. It seems that many people think that having being a teenager equals acne. Thus having sex makes you a man and you would no longer have acne. Odd thought process emo. Also, WTF is up with the whole broken arms thing? Edit 2. RIP my inbox. Thank you for all the responses and clarification on the broken arm incest saga. I feel like I've officially become a Redditor and learned one of its darkest secrets. That having sex gets you pregnant. It was a 20-plus-year-old woman that couldn't grasp the idea that sex leads to pregnancy. She thought that in order for a man and a woman to have children, they needed to be married first and then have a baby. That sex was just an act unrelated to it. And then again, we are talking about a small rural community in the middle of ducking nowhere, Mexico. And edit. My highest rated comment. Awesome. Thank you. Also, it's amazing how common this misconception is all around the world. I don't want my baby to get a vaccine because Jenny McCarthy's book says her son got autism from the thimerosal in his MMR vaccine. Jenny McCarthy is a one-time Playboy model who wants to sell you her books. MMR is a live vaccine and does not contain thimerosal. Thimerosal contains ethyl mercury, which clears from your body in 10 days, unlike methyl mercury which stays for months and actually causes damage. Measles killed 135,000 people in the world this last year. Autism has a strong genetic component. If one identical twin has it, there is a 75% chance the other will as well, with 75% of identical twins both having autism. Andrew Wakefield faked the research linking autism to MMR vaccine, lost his license to practice medicine, and made millions helping lawyers sue and selling books. He lives in a mansion in England. I went to school for 11 years, spent 10,000 hours studying and just want to make sure your child stays healthy. Quit thinking your 5 minutes of internet research means anything. Get over yourself and vaccinate your damn baby. That coming to the ER for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the ER for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ER with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. There was a nursing student I had once who laughed loudly and exclaimed, "How can you possibly get an STD in your mouth? Are the innocence of youth." Patient comes in at 2 AM for insomnia, clearly tweaking her brains out. Heart rate 200, can't sit still, bouncing off the walls. I suggest maybe easing up on the sugar, but doctor, I love sugar. K. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went BC. It doesn't bother her and she'll see if it gets better. That the 30+ cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. Not a doctor, but when I was in Afghanistan, a local man came up to us on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor. So we got the medic to go see him and I helped unwrap his hand and it was just ducking huge. He'd cut his hand very badly and, for whatever reason, kept it submerged in diesel for 3 days before seeking help. His hand appeared to have soaked up a load of diesel. Or it was just infected to duck, but it resembled a water balloon and lightly touching it caused it to piss liquid. It was nasty. I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that. 1. Getting my tubes removed did not remove my ability to get a period. 2. That we women have a urethra, a V, and an anus. Babies do not come from the urethra. This one was strange because she had me and my sister, so. 3. That when you neuter a dog, you just remove the balls, not the red rocket. 2. China Taiwan's sex ed was severely lacking, so my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you can get pregnant. If you kissed a guy, you could get pregnant. I'm still finding out, years later, misconceptions that my poor mother has about reproduction and explaining things to her. So I'm only an EMT, but I want to weigh in here to this conversation. I had to tell a patient with severe pneumonia, and the patient's family, that you don't get sick, that is, catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. Edit. I just want to say to everyone who flooded my inbox with wonderful sentiments regarding the work of EMTs and paramedics, that appreciation makes dealing with the seemingly inexorable chorus of professionals telling us, me, otherwise much easier. Nurse here, retired after 27 years on the job. The number of American 20-somethings that don't know if they're circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, are you circumcised? If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, what's that, is way too many. For the record, I can count the number who were uncircumcised on 2 hands. I'm a paramedic and recently transported an idiot who self-presented to the local hospital, who found he was having a heart attack, steamy, and needed him sent to a bigger hospital for treatment. During my assessment, I asked him how long he'd been having chest pain, on and off for 12 months. He tells me, any family history? One of the biggest indicators. Oh, yes. Dad died of a heart attack. Brother died of a heart attack. Both of them first presentation. Stone dead on the spot. No ducking about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relatives spontaneously chucking hearties and dying, and you've never got it investigated. Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, well, I've lost weight, and you know that when you lose weight, you lose it in your gums first. Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. So, not a doctor, but I work at a hospital. We had someone come into and because they needed their nails redoing. They genuinely thought it was a good idea to go to accident and emergency to have their fake nails taken off and redone because they had gotten too long and become uncomfortable. Had a patient in our high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. I'm not a doctor, but I suppose this is related. My mother, before she had kids, grew up not even knowing that you could breastfeed a baby. She was never told anything about what breasts were for, sex, and even about homosexuality. Her parents never talked about any topic that was considered taboo. My mother learned about that once she had her first baby, subsequently at 16. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. Obligatory, not me but my wife. She's a nurse practitioner and had to explain to a 40-year-old man that brown sugar did in fact, contain sugar, and that is most likely the reason why he now has diabetes. The same man also adamantly insisted his wine consumption was not an issue because he only drank the dry stuff like Chianti, so it doesn't have any sugar. Well, it looks like she is about 30 days pregnant. Congrats. How can she be pregnant? She is only around her brother. Well, actually they don't follow the same moral code as you or I. Veterinarian. My brother is a general practitioner in rural Tennessee. Enough said. Right? He says most of his patient visits go about like this. MD. Well, person, you're pre-diabetic, have high blood pressure, and are complaining about joint pain. Have you been exercising and cutting out sugar and carbs? Person. Yeah, I have. Doc, but it doesn't seem to help. Do you have any better meds you could prescribe? MD. Well, let's talk about your diet. How much water do you drink a day? Person. I don't like water, so I get extra ice in my sweet tea every day to make sure I get enough water. MD explains how that's not enough water by a long shot. How much sweet tea are you drinking every day? Those can have a lot of sugar in them. Person. Well, I get a large one from Hardee's McDonald's wherever on my way to work with my breakfast, and another one on my way home for dinner. Then I have a glass or two when I get home. MD. Well, that's a lot of sugar, and a lot of fast food if you are eating it twice a day. What do you eat at home? Person. I don't like to cook, so I usually don't eat anything but Little Debbie snack cakes at home. MD. Those have a lot of sugar too. Person. I thought that all I had to do was cut out Mountain Dew. Now you're saying I can't eat my food or my snacks? What are you suggesting I do? Eat salads for every meal? Why can't you just up my meds? My mother is a doctor. She once told me this story about a patient she had. She serves low-income people, so typically immigrants, minorities, usually without health insurance. The man is from Central America and is there for a normal checkup, typical of most patients. He has fairly high blood pressure. However, this man is also having bowel problems. So my mother asks, what color and consistency is your feces when you need to use the bathroom? The man has no idea what she's talking about. My mom tries again. Your poop. What color and or consistency is it typically? The man still has no clue what she's saying. He understands a bit of English. She tries again. Your doo-doo. Nothing. Your fecal matter. Nothing. Your poo. Nothing. Not number 1, but number 2. Nothing. Finally she asks, it's not liquid when it comes out, but it's more solid, you know? The man has an epiphany. OHH. You mean it? He says. Yes, you're it. So my highly educated, professional mother has to continue the rest of the checkup asking about is it? What color is your it? Is it more wet? Does it hurt when you take a it? This went on for a fair amount of time. My mom nearly burst out laughing by the end of it. Absolutely amazing what a minor language barrier can do. Dentist here. Things I've had to explain to parents. 1. Breast milk can cause cavities. 2. Don't put your kids to bed with a bottle with Coke in it. They then switch to Diet Coke. Fasapum. 3. Don't wiggle out your permanent teeth just because the tooth fairy will give you money. 4. You can't brush cavities away with toothpaste or any of these new internet fads. Oil pulling. Honey. Chocolate. Once your cavity is deep enough, it needs to be fixed by a dentist. 5. Fluoride isn't poison any more than table salt is poison. Small quantities are good for you. Anyone who tells you otherwise has been lied to and believe it. I have plenty more, but I'd have to think harder. It had a few questions about number 3. There was a little guy probably 8 years old or so that had wiggled out his 4 lower permanent incisors, front teeth, after wiggling out his 4 baby teeth in the corresponding spots because his family made such a big deal about giving him money from the tooth fairy. They were in my office asking when the new teeth would be coming in. Had to tell them never. Edit number 2. Incisors only have 1 root typically, and when it first erupts it is not completely developed and the tooth is still moving through bones, so it isn't really firm in place yet. This kid capitalized on a single rooted, undeveloped, erupting tooth, and with a little elbow grease and the promise of riches was able to tough it out. Patient made an appointment and brought in his it in a box. He was concerned about the size of his turd, and if it's normal. All he got from the visit was, normal turd. Yes, it's pretty wide. Turd box was set out with biohazard waste. Waste guy thought it was a misplaced package and put it on the front desk. Secretary got quite the surprise that day. I'm a dental hygienist and once was telling a patient after a cleaning that she had gingivitis. She replies with, I must have caught it from my boyfriend. Had to explain to her that it's because she doesn't brush floss enough. She was 36. A 32-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo and doesn't only attack cancer cells because it likes the acid environment in it. Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. So when cats and dogs eat grass, that means they have cancer, right? Me. No. No it does not. Made for an awkwardly silent ride the rest of the way. My dad's answer, I am not a doctor. My dad had to tell a patient that they were not pregnant. The patient was male. Not a doctor, but I regularly have people come in for eye examinations because when I take my glasses of things are blurry. Often these aren't passing comments during the exam, but the main reason for their visit to the clinic. My sister, who is a new Redditor and hope sees this, is a doctor, and 25 years ago when she had her very first patient out of residency and this patient refused to allow her to see her breasts, which were sore and needed a mammogram to check out a lump. So sister asks why and this girl who is about 30 and single said matter-of-factly, oh, that's lesbian. We can't do that. It's against the Lord's wishes. She loves telling this story at the dinner table on family gatherings, especially to our religious side. I don't know how much of this is true. It was my cousin, who is a doctor, who told me. He was in his first year in a clinic and people went there to have an appointment because he was good looking. Elder ladies loved him particularly. But this is totally unrelated. And the worst case was when this elder lady goes in with her granddaughter, around 8-year-old. She had a severely infected wound in her head. Upon close inspection, he saw the wound crawling with small maggots and the smell was terrible. He was pissed, of course, and asked why didn't she wash the wound and brought her earlier. She said she thought it would heal with time and was afraid to wash it, lest water enters her brain and kills her. There was also this woman that took her 6-year-old daughter there to check why she still didn't have pubes. Not a doctor, but a nursing student. I was checking the car seat and walking a postpartum mom out of the hospital. Mind you, this was her 5th child. 5. She had raised 4 other children to adolescence. But for this one, on the way outside, she took a blanket and tucked it around the baby's head and face, nice and taut. Not a doctor, but I agreed to pick up my good friend's wife from her pregnancy sonogram. Driving home, the wife tells me she's surprised it's a girl because the last kid was a girl and it's supposed to go boy girl, right? This one is a little different. My dad is a pediatrician. He told me the story of a teenage boy, around 13 YO, who was referred to him, something unrelated, can't remember what, when he asked him if he was on medications. The boy's mom pulled out some birth control pills. Apparently his family physician suggested birth control as a way to treat his acne. Yes, you read that correctly. Licensed doctor told a teenage boy that was just going through puberty to take female hormones as acne treatment. I think he had been taking them regularly for the past year. My dad told me about an extremely religious male patient who was concerned about his nocturnal emissions. He saw it as an offense to God and wanted to know what he could do to stop it. My dad's response, well, it's gotta go somewhere, guy. My uncle told about a patient who thought he had Ebola because he was in the same as a coughing black guy. Had to explain to an adult you have to brush all the sides of a teeth. Like, no, just the side that shows when you smile is not enough. And yes, flossing is not just a thing for rich people. Doctor here. I think the most frustrating I've seen since I was a resident was a very pretty, like stunningly pretty, 17-year-old with what appeared to be normal, loving, affluent parents. She had a tumor in her pelvis, rhabdomyosarcoma, that we could resect to potentially cure her. The parents declined. Also declined chemo and said they want to try holistic medicine because that made more sense to them. I last saw her 3 years ago. She was getting huge lymph nodes removed from her groin because they were unsightly, obviously metastatic disease. Parents did not want primary tumor removed and again declined chemo. I see 100 patients a week probably. Lots of devastatingly sad cases. But I still think about that girl, listening to her parents, costing her life. I bet she's dead now. I can assure people, doctors are not trying to swindle you, give you unnecessary care, or have some ulterior motive in this sort of setting. 99.99% of doctors are treating patients the same way they'd treat family. So try not to be dense. We want to help. Doctors of Reddit, what patient made you go how the frick are you even alive? I had liver failure. When I was 8 months pregnant, my baby had stopped moving for several hours, so they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body used up all its clotting stuff. I was in ICU for 3 days, in hospital for 2 weeks. My liver recovered. I went home with my son. We could both have died. The hepatology department and maternity department were working together, which is not a usual thing for them. So happy you're both here today. Patient here. When I was 7 I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night, and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors of Reddit, what is your most oh my god what is that moment while treating a patient? I interned in a city that gets very cold in the winter. Homeless people who were having a tough time surviving outdoors would come to the ED to get admitted, even if just overnight. They'd get a warm bed, a few hot meals and a cleanup. This one fellow was in really rough shape, couldn't walk. The poor nurses did most of the cleanup, delousing, sponge bath, dressing the open sores. My job was to do the physical exam including the mandatory rectal. Literally had to lift that scrawny flap of a butt cheek and pick the encrusted dirt fesses matted hair away from the rectum to expose the anus. Thankfully I only had to turn 180 degrees to reach the sink that I dry heaved into. But before this fellow can be discharged he needs a podiatry consult. His black gnarled feet have thick yellow big toenails that have grown in a circle and are now piercing the bottom of the toe. The reason he can't walk, podiatrist Inton comes in, starts a foot soak, and proceeds to tackle those nails with something that can only be described as modified tin snips. Now you know how some people have that habit of opening their mouth when concentrating really hard. Yup, he clipped that nasty nail and it flipped right into his mouth. We shared the sink. Nailed it. OBGYN rotations. I was delivering my first baby. It was an older lady from the rural side of town. When I asked her to push as the baby had fully crowned, a wad of worms exited her anus. I'm talking at least 60 live worms. I gagged so hard, but managed to keep a straight face throughout and deliver the baby. I realized then and there that OBGYN was not for me. This was in rural Alabama. This middle-aged married couple had presented to the ER after they had been drinking for almost the entirety of the evening and got into a heated argument. Things got heated and the woman eventually fell off the porch of their trailer into the shrubs a few feet below. The husband in his drunken state suddenly dropped the argument and came to his wife's aid. She didn't suffer anything too serious, just a couple of scratches here and there, except for what the man said looked like a piece of glass or pipe or something that became lodged in the woman's arm when she hit the ground. He decided to not come to the hospital because he could remove this object himself. He got his largest pair of pliers and gripped onto this glass pipe looking thing lodged in his helpless wife's arm. He clamped down and pulled, cranked and cranked, trying to remove this object and it wouldn't budge. After his masculinity defeated and the alcohol wearing off on both of them, they decided it's sensible to finally come to the ER. Upon arriving to the ER, the doctor immediately realized this poor woman had a compound fracture of her humerus, and this pipe or piece of glass thing was a bone sticking through her skin that her husband was trying to pry out with a pair of pliers. True story. This is the story that made me audibly gasp and cover my mouth, and I have read most of them. I am a surgery resident. I once helped operate on a man whose face was chewed off by a bear. I had to find little scraps of skin at the edges of the hole in the middle of his face and try to decide where they went to try and make the damage smaller. I also saw a patient come to the emergency department with a Barbie in their rectum. He apparently puts the arms up and legs down like a diving position, rubber bands the arms together, then places it in his rectum for a time. When he wants it out, he takes laxatives. Only this time it got stuck. The kicker, when we removed it, he asked for it back. 1. Maggots on a gangrenous foot. Both times I almost lost my lunch. The worst part was that the second time, I knew exactly what the faint crunching meant, but I still had to remove the sock shoes. 2. Telling a highly addicted PT that I wouldn't be giving him the narcotic RX he wanted after he had run out of his prescribed meds early because he took too many. This was actually the only time I have ever said frick to a patient. Me, I'm not giving you an RX. I also spoke with your pain management doctor and he does not want me to fill anything for you since you made the choice to take too many of your medicines. Patient, starts flapping arms and legs in bed. Me, what are you doing? Patient, I'm having a seizure. Me, that's not a seizure, that's a tantrum. Patient, gets completely still, looks me straight in the eye, and shoots his pants. Me, actually shocked. What the frick did you do that for? Patient, because you're not giving me the medicine I need. Now you have to tell the nurse to come clean me up. Me, yeah, nope, I will have the nurse bring you a clean gown and a towel. Bathroom's right next door. This was in med school, dermatology rotation. I got to see my own patient, so I asked what the problem was. He told me he thought his genital warts were back. I asked why. He didn't say a word but turned around, dropped his pants, spread his butt cheeks and showed me a cluster of genital warts around his anus at least 10 centimeters in diameter. Even when he stood up straight it was just sticking out of his buttocks. I put up my most professional voice to say HMM. Yes, I think you're right. The man thought this was hilarious. I'm not sure if I've not seen more surprising things after this, or have just gotten used to them. If you're still in dermatology, I'd imagine you'd get to see all kinds of amazingly horrible things. Skin has so many ways to go wrong. A nurse here. We brought a code trauma off the helicopter. A lady who was passenger in a really bad wreck. Her husband was driving and was dead at the scene. Once we got her stable, the ER staff came to take her to surgery. I gathered up the clothes we had cut off of her and grabbed her purse that EMTs had removed from the car. There was a lot of blood on it, so I thought I should just grab her wallet instead. I reached in and grabbed what I thought was a wallet, pulled it out. It had hair. It was a chunk of her husband's scalp. Story from one of my friends who worked as a paramedic in Hamburg for some time. Mind you, this is disgusting. They were called to an unconscious person, drug addict, who was slumped down on a park bench close to the train station. Were back in the days the most drug addicts would hang around. They approached the guy and tried to wake him up, checked his vital signs etc. Then put him on the ground. He had no shoes on but only wrapped up his legs in plastic bags. If you ever been around hardcore drug addicts you know most of them don't smell too good. After a while they just give up on personal hygiene, which incidental is actually more dangerous than the drug itself since they tend to not treat their scabs etc. This guy reeked to high heaven, and once they proceeded to check his plastic bag shoes they saw why. His legs up to his knees were completely black and full of maggots. He had an infection in both legs due to shooting up H and never treated them. Very much like the picture of the homeless guy which is circulating the net. Not going to post that here. My friend said that once they lifted the plastic bags up a little which were melted into his decaying flesh, little mountains of maggots would fill around his feet. Hands down one of the most disgusting things he has seen. I feel like I need a hug after reading this. Holy mother of frick. Doctor here. When I was working in the ER one evening I had my worst experience so far. I was called to one of the examination rooms that are designated for infectious patients. This is already a bad sign as it usually involves some sort of abscess that needs to be drained. However, this time it was far worse. I was told by the nurse that it involved a man who had bilateral venous ulcers on his legs and that they were now infected. I looked through his journal and saw that he last saw a doctor about 10 months earlier and no note of any checkups after. Not by a nurse or a GP. Therefore I asked my nurse when someone last took a look at his legs. Not since his last journal entry. Then I asked when was the last time he changed his dressings on the legs. He hasn't. Some background info on the patient. Old man who lived by himself in his trailer that was parked in the middle of the forest. He had no running water. He was a bit of a drinker and a general I don't give a frick mentality. Awesome. Suited up and went into the room. The room smelled like an odd combination of stale beer, mold and disease. Certain infections smelled different and this one was very pungent, almost sulfuric. I introduced myself to the patient who didn't understand what the frick he was doing there. All he wanted was some antibiotics for a flu and then he was sent here. Why the frick do you want to look at my legs for? They were already taken care of last year. Great. So we started unfolding the dressing. They were crusty and crackled as we unwrapped the first leg. As we got deeper it changed color to some sickly yellow and the stench became worse and worse. One of my nurses left the room to throw up. Then I saw it. Very small but inside a fold there was a little maggot who squirmed. Frick. When we finally got to the wound, we saw all the little maggots feasting on this man. There must have been 50 of them. The stench was absurd. I was focusing a lot to breathe through my mouth but then it felt like I could taste which made it even worse. My nurse came back and promptly went out again. I unwrapped his other leg and same story there but the infection was much deeper and I could see a few tendons on the base of the ulcer. Absolutely delicious. We had to clean off the maggots and placed them in a bowl but they were squirming and went on the floor and crawled all over the place. I had to watch my feet so I didn't step on them. After that we took the patient to hose him down to at least try to get rid of some of the smell. Then booked to the offered debridement and a fresh vacuum dressing. Discharged a few days later with strict instructions and booked him in to return for dressings and checkups. Then we never heard from him again. There used to be a well-known patient that would present to the emergency department with frequent urinary tract infections. Now, urinary tract infections are much less common in men than in women and don't occur sporadically that often. This gentleman was a male stripper, and his party trick would be what he called a ruby shower. In essence he would empty his bladder, and replace its contents via a catheter with red wine. He would then empty his bladder during his performances. Unfortunately, fate caught up with him. One infection became too severe and he did not survive. This is the second post mentioning the ruby shower. I had no idea this existed. Removed a shoe from a PT with a severe diabetic foot. 2 cockroaches crawled out of it. Paramedic here. While working in the one night we had a guy come in complaining of groin pain. So we bring him back and it turns out he has a master lock. The kind with the spinning dial that you use to secure your locker at school, locked around his pants. Essentially blood could flow in but could not flow back out so this thing was hugely swollen. He had panicked after he realized he could not remember the code, dealing with a real genius here, and he took a screwdriver to the dial and snapped it off. So we consulted with urology and the urologist wanted to take him to surgery, cut his ween lengthwise, slide the top out then the bottom, and then suture it back. Needless to say the patient wasn't thrilled with option A, so option B was for this big ass nurse, we'll call him Tom, to go in with bolt cutters and cut it off. Option B selected. Curtain closes, Tom gives a 1, 2, 3, a loud scream at 3, a pop noise. Tom exits with a broken lock and the man was sent to the floor to recover. That's just one of so many but I always tell that one. Smelled what turned out to be an infected Bartholin's gland which secretes vaginal lubrication. I've witnessed childbirths, trauma surgery, and worked as a nurse's aide for years before medical school and this was the only time I've almost puked in a patient's room. The smell was the most terrible thing I will probably ever be exposed to. The poor patient. If I came to the doctor with something and they vomited I'd be so humiliated. Imaging tech here. So I basically look at black and white images of people's innards. Once I had a guy, and it looked like his abdomen was filled with fluid, but it looked very odd. Then I realized the fluid was moving. The guy had the biggest aortic aneurysm I've ever seen. So big I couldn't measure it on my machine. He got sent off to the hospital. I was in outpatient services that day, and I don't know what happened to him. I also had a woman with so many holes in her heart, in the muscle between the heart chambers, that it was like Swiss cheese. Another time I was in a prison scanning a con. He'd been shot and all of his abdominal muscles were removed. He wore a velcro girdle to keep his stomach in place. I put my scanner down on his abdomen, and I had to figure out what organs he was missing because he had some removed from after being shot, but he had no clue. I think he was missing a kidney, the gallbladder, part of the liver and like half of his pancreas. Token not a doctor, but I am a nurse and I have a story. I was working in the emergency department one afternoon and we had an elderly lady just calling out help me repeatedly all afternoon. She was brought in by her nursing home for agitation, which is normally code for they can't handle them anymore. So the PT was placed with a carer assistant to try and calm her down and make sure she didn't wander around the ward. The carer was helping to feed the PT and I walked past when suddenly the lady just breathed her liquid died in and collapsed backwards. I of course instantly pushed the med emergency button and everyone comes running from all over. We assess her airway and it's deemed clear but not self-supporting. No food in there, which was strange. She wasn't breathing and no heartbeat was present, so one of the male nurses starts compressing on her chest while another nurse tries to insert an airway. As he compressed on her chest, a literal fountain of murky green goo spurted from her mouth. All over the walls, ceiling, medical staff, literally everywhere. And of course we are all like, what the heck is this crap? And the poor male nurse had to keep compressing the chest while the other nurse kept trying to suction the patient's airway to clear it enough to insert an airway. After 5 or 6 minutes the nurse finally gets the airway in after suctioning over 6L of this goo. And after some defib the doctor declared the patient dead. The bay and the surrounding say 5 or 6 meters was just drenched in this slimy murky brown green mess. It was absolutely breathtakingly disgusting. Eventually we found out the poor old lady had a massive bowel obstruction, had a cardiac arrest while eating, and the goo was days and days of liquid fecal matter. Safe to say I scrubbed myself raw in the shower that night. On my first weeks in trauma, 4th year of med school, we had an 11-year-old girl come in who was literally dumped out of a car in front of a hospital, with one side of her body completely mutilated. What remained her of limbs just hanging like huge chunks of meat, and the rest of her body was burned all over, and there was so much blood. Maybe it's because I panicked a little, but I don't think I've ever seen so much blood in my life. We later found out someone in her family, father or cousin, not sure, was a known criminal who had just got out of jail time for blowing up ATMs with homemade explosives. They claimed she found a stash they had hidden, but we really believe she was helping them pack it. Either way, it was the ugliest, saddest thing I've ever seen. As an imaging tech, we once had a patient who was close to 400 pounds, who was fairly well bedbound. To assist with hygiene, the patient had a rectal tube that drained their feces away, but this had fallen out probably a day earlier. As a result, there was a pool of horrible substances trapped beneath her brewing. This was discovered when we rolled her to position her for rays. The smell cleared the room and lingered there for hours, while people went and showered and changed their clothes from the pervasive creeping miasma that was THR worst thing I have ever smelt in 15 years working in hospitals. My mum is a nurse and has seen some pretty messed up things. The one story that sticks in my mind involved an elderly man who came into the hospital 3 times a week to have a growth on his face washed and redressed. The growth had slowly taken over the left-hand side of his face, so much so that his left eye, his only working eye, had closed over. He was effectively blind. This meant that his wife, whom he had been looking after for years due to her frailty, was now tasked with looking after him instead. Furthermore, this bloke was old enough that the hospital didn't want to operate on him, so the hospital visits stopped. He could no longer get there, so instead a nurse would visit him 3 times a week. Now this growth was unsightly, wept constantly, and smelled bad. Really bad. The whole house stank of it. The nurses said it smelled like death, and thought he was going to die any day. During one of these visits by my mum, she was cleaning his face over the sink, and noticed a flap of loose skin. She went to clean it with the sponge and squelch, The growth fell off into the sink, and it was crawling with maggots. The sink was now filled with dead flesh and maggots. And the smell, oh goodness, the smell. Turns out a fly had laid some eggs on it at some point, and they'd hatched and started eating all the dead flesh and the growth until it fell off. And the man? He was fine. There was new, pink skin where the growth had been, and he could see again out of his left eye. Gave him a new lease on life. Heartwarming story? Yes. Most disgusting my mum has ever told me, heck yes. Makes me wonder why nobody suggested admitting him for a couple days to debride with sanitary maggots. It is a very well known and common technique, with many medical benefits coming directly from the pain-killing and growth-promoting qualities of maggot saliva. I was working as a scribe when we went to see an 8-year-old girl that had a fever. Nothing too remarkable until we started the physical exam. We examined her head. Normal. We examined her upper extremities. Normal. Then we pulled up the blanket to examine the lower extremities. Her feet were the size of an infant's. You should have seen the look on the doctor's face as he was trying to figure out how the girl's feet got so small. The mother looked up at the doctor, saw the look of confusion on his face, and said, "Those aren't her feet." She pulled up the blankets a little further, revealing a pair of perfectly healthy feet, nestled next to the feet of a doll that she put under the blanket. We saw the doll's feet and thought they were the girl's. Surgical registrar here. I was working in a smallish hospital in a rural town in Australia. We were asked by the medical team to see a patient that had been admitted under their care by the emergency department overnight. Happens quite often in that hospital, with a CT demonstrating a very distended bladder. They apparently had trouble with a catheter, so they called me to have a look. With much hesitation I went up to see her on the ward. So I managed to put the catheter in with a lot of trouble. This lady was fecally incontinent. A little bit of urine drains out and I just keep thinking, something's not right. I go back and look at the CT scan and the IDC placed in the emergency department looks like it's appropriately positioned. Subsequently pulled out. Behind it was one big sucker of a uterus, absolutely full of what appeared to be a fluid density. The report read, along these lines, I crap you not, as follows. Conclusion. There is a very distended bladder. The catheter balloon is situated in the prostatic urethra. Moderate to severe hydronephrosis is noted. Long story short, I speak to the consultant. We get her to theater. With great difficulty we manage to dissect our way around this huge uterus and we call the O&G guys to come and help get it out. Unfortunately during this process the uterus bursts and there is a boatload of pus that just streams out. It smells so goddamn horrible. There are people gagging around us at this yellow-green, sulfuric smelling goo. The scrub nurse can no longer take it and vomits in her mask. The consultant is looking at me like frick you for bringing this to theater. We finish this case and I am so glad. I get home and I keep thinking, I can still smell this awful thing. I have another hour-long shower. All night I can still smell this thing. Morning comes. I can't have breakfast cause I can still smell it. I get to the hospital and everyone is wearing masks. Apparently, the smell was so horrible, and the extraction in our theater so outdated that it had somehow pumped the smell into the vents around the hospital. All night, small amounts were leaking out into the atmosphere causing this horrendous smell. Silver lining, lady lived for another 3 years. This is almost like the swamps of Dagobah story. I'm an RN. When I was in nursing school, I was very excited to receive my first patient assignment, a 90-year-old woman admitted from a nursing home with pneumonia. Part of my responsibility was to give the patient a bed bath. Everything was fine until I began to do paracare, and discovered that her vagina was full of maggots. It was more sad than anything else, and I actually have some worse stories, but this one stuck with me since she was my very first patient. Obese woman came in with her hubby and a foul stench. Turned out a yeast infection had spread under every fat roll. It got up to her neck. You have been visited by the Pope doggo. Comment 4 times and he will bless you with lots of good luck. If you are new to the channel, you can subscribe. I publish r/ask Reddit by Planet Reddit. Medical professionals of Reddit. What is the craziest DIY treatment you've seen a patient attempt? Anesthesiologist here. We had a patient come in for IND of bilateral deltoid abscesses. He apparently had thoughts of being a bodybuilder. But instead of lifting weights or knowing someone who could hook him up with some quality steroids, he decided to bulk up by using some protein powder at GNC and mixing it with water, drawing it up into a syringe, and injecting 20-40cc daily directly into the muscle. If bulk was what he was going for, it definitely worked. Temporarily. A rip-roaring localized infection makes you look plenty swole. They got almost a liter of pus mixed with liquefied protein powder out of each deltoid. This also wasn't the first time he'd been in for this problem. The last line kills me. Try it once. Shame on you. Try it more than once. What the duck are you doing with your life? My dad had an abscess on his face. It was huge. About the size of a golf ball and horribly red. It kept getting bigger. My mom, a nurse, kept telling him to go to the doctor. But my dad was a ridiculous cheap ass. One day when she was gone, we noticed that a big white head had formed on the abscess. And it was apparently ready to bust. My dad went out to the garage, got his shop vac, placed it over the white head, and proceeded to suck out the abscess. It worked surprisingly well and healed up after that nicely. Mom was still furious, though. Paramedic here. Once had to explain to a family that putting lemon juice in the eyes of an unconscious patient isn't an approved treatment method. And no, it didn't work. It was an interesting moment when I had to explain why his eyes hurt. Smelling salts equals seeing acids. If I've learned anything from reading the comments here, it's that some men will tolerate almost any amount of pain to avoid a doctor seeing whatever stupid shit they've done to themselves. This is no exception. I once spoke to a paramedic who went out to a man at 2 AM who had excruciating pain down below. The poor organ was wrapped tightly in soaking bandages, and underneath was a blackened penis with large pus-filled holes in it. The man eventually admitted that he shoved a chicken bone, a clean one, whatever that means, down his cock for pleasure. Predictably enough, he couldn't get it out. And being too embarrassed to go to the doctor, he left it until he was in so much pain he couldn't walk. Both from the rotted penis and the fact he hadn't been able to urinate for days. Apparently you could actually see the bone once the wound was clean. And although not an expert, my friend couldn't imagine that what was left was salvageable. I had a guy come in for coughing and shortness of breath for the past few months. His lungs sounded like absolute shit. Got a chest x-ray that looked horrible. So I did a CT scan. Radiologist called it the worst case of necrotizing pneumonia he'd ever seen. Dude had like a 15% functional lung tissue left. The patient then mentioned things had been worse after he started using a new breath freshener spray. He whipped out one of those blunt effects concentrated air freshener bottles. Supposed to cover up weed smell. Labeled not for internal use. Apparently he had been using it like vinegar spray. And had already gone through 3 bottles. What happened to him? In nursing school while I was on clinical rotation in urology, there was a man who ended up having his penis removed. It turned out he had an infection brewing for quite a while and thought the best course of action was placing a sock over his penis in hope that it would heal. He was generally confused and upset as to why this didn't work to heal the issue. The classic. If I can't see it, then it's not a problem. One of my first clinic patients was a dude who was injecting a mixture of testosterone, human growth hormone, sesame oil, and sunflower oil into the base of his penis as a DIY penile enlargement therapy. Well, it got infected, so he ended up going to the ED for incision and drainage. I saw him as a post-ED visit, and at that time, he figured that he shouldn't be injecting into his penis while it was healing. So instead, he was injecting his oil plus sketchy hormones off the internet concoction everywhere else into his body, arms, legs, butt, shoulders, etc. because he figured it would still have some effect. Today I learned, some men are capable of committing atrocious, heinous acts of terror on their own dongs. There's a myth that lowering someone's core temperature will save them from an opiate overdose. As a result, many first responders have arrived on scenes to find friends, fellow users inserting ice into someone's rectum. Sometimes they don't have ice around though, which leads to getting inventive. Popsicles. Frozen hot dogs. My personal favorite, which regrettably I didn't witness myself. It was told to me by another medic, was a bag of frozen French fries. Cold will do nothing to help someone who is overdosing on heroin or other opiates. What they need is respiratory support, oxygen and or artificial ventilation, and naloxone, Narcan. If you're a user or know one, and somebody ODs, call 911. Perform mouth to mouth and give Narcan if you have it. But leave the popsicles in the freezer. I work in dental and years ago had a patient attempt to superglue her front tooth back on after it broke in half. She screwed up and ended up gluing the chunk to her upper lip. I had a dental patient with a dead front tooth that has turned black, so she painted it with white nail polish daily. Edit. This is now my top rated comment. How stupid is that? Lol. Yes. She had a daily routine of drying it off, painting it, and blow drying the polish dry. Crazy thing is, she did a pretty good job. This happened when I was still a med student doing a rotation in the ED. Patient comes in and is pretty vague about his actual complaint. Something about head pain, but he looks just fine sitting waiting to be seen. When I finally get to see him and ask him what actually happened, he removes the hat he was wearing and a chunk of skin about the size of my hand literally flaps off of his skull. This guy managed to basically scalp himself. And apparently it had been like that for 3 days. According to him, it was caused by falling in his bathroom and hitting his head on the toilet. He had been previously duct taping it down or using the hat to hold the skin on. But it wasn't sticking well, and that's when his wife convinced him to come to the hospital. I like my skin on my body more than I dislike hospitals. Just reading that made me woozy. How the duck did he walk around for 3 days like that? Pharmacist here. Worked in a shop where a woman asked for some advice about potential UT or ST. Told me she had bathed her vagina in bleach for 5 minutes to try and kill any bacteria. Miraculously, she hadn't done any lasting damage. A 50-year-old man swallowed a chicken bone while eating, and it got stuck down his throat, upper esophagus. Unable to take it out with his fingers or coughing, he got a fisher hook with a line and tried to rescue the bone with it. He ended in an emergency department with both the bone and the hook in his esophagus. Edit to add some info. Both objects had to be extracted endoscopically, and then the patient recovered after receiving antibiotics in the hospital. Perforation of the esophagus causes mediastinitis, infection of the space between the lungs, which carries high mortality. An old lady told me the rain hurt her arthritis. That's reasonable. She also swore that dogs spit had healing properties, so she let her dogs lick her feet when she felt it coming on. She then wanted to show me a video of said dogs licking said feet. I swiftly and politely declined. Adult patient had gas and poked a hole in his belly button with basically a knitting needle to release it. Edit. It didn't work. He actually came in for the ensuing infection in his belly button. I didn't think it was possible to ever cringe this hard. You've proved me wrong. I work in oncology pharmacy. I had a patient die of totally treatable breast cancer because they decided to treat it with mistletoe instead of chemo. All because Suzanne Summers did. Yeah. The Thighmaster lady. Don't take medical advice from the Thighmaster lady. The most heartbreaking thing I've seen is a desperate husband bring his wife in at death's door. They were young with 2 kids under 10. She'd been diagnosed with breast cancer and didn't like what her oncologist was telling her. Shit's terrifying, to be fair. She then left the UK, so all chemosurgery free at point of access, and followed the alternatives practices recommended by some witch doctor in her own country. By the time husband dragged her back, she was too far gone. Had spread to so many organs. Trouble with breathing. Groggy seizures from brain mets. I work in ED. I don't know how oncologists and palliative care teams do what they do. Of all the horrible traumas I've dealt with, this is one of the most upsetting cases I've ever picked up. A little late to this thread, but have a weird one. A patient was told by her doc that she had low magnesium and should consider supplements. Not uncommon. Instead of getting MG supplements, she ate an entire tub of homeopathic volcanic ash and completely destroyed her electrolyte imbalance and ended up in ICU. We admitted her as a pharmaceutical overdose, so poison control automatically follows up with you. It was hard to explain to them. Edit. It was probably naturopathic, not homeopathic. I don't know enough about specific differences. Think of a tub of protein power. But volcanic ash. Her husband brought it in for the poison control report. You were supposed to mix a scoop in water for the health benefits. She ate the whole tub and had a seizure and wrecked her kidneys. The activated charcoal volcanic ash vomit that was all over her when she came from Emerg was a beach to clean up. Ate an entire tub of homeopathic volcanic ash. Damn. That's some advanced stupid right there. A mentally delayed woman came in septic to the ED. Dids raise. Blood cultures. Urine cultures. The works. Finally found this weird image on her pelvis film. And we had Jin come do a pelvic exam. They pulled out this blob with bones in it. Y'all. I swear to God. It was a decomposing frog. She put it in her vagina for safekeeping. She got toxic shock syndrome from a frog. Edit. Just realized that the topic was about DIY treatment. And my story doesn't really match it. I guess there wasn't anything she was trying to fix. Except maybe the lack of frogs in her vagina? Frog? That's a typo. Yes? Please? Repeated for her pleasure. So which 1 2 3 of you sick ducks gilded me? Not me. But my boss, mother of the child I care for, is a nurse practitioner. I asked her what the worst thing she had witnessed was. She continued on to tell me the story of a man who had stapled his ball sack together and onto his body after slipping with the razor. He had it that way for days. Metal holding his poor testicles in place. Infected and gross as you would expect. Before he came to a professional. Later admitted his ex attempted to castrate him. The balls lived. Later admitted his ex attempted to castrate him. I guess that's why you don't judge people when they come in with weird injuries. Dude came to the ED because his leg was swollen. I'm talking. Like. Twice the size of his other leg. It turned out that his 4th and 5th toes were getting caught on his sock. Which, to be fair, sounds super annoying. So he cut them the duck off. With scissors. And then it got infected. And he waited. And waited. And that's how he lost his entire ducking leg. Long story but. Had a young teenager with sickle cell disease who had been in the hospital for around a week already who decided to manage his pain himself. This was a few years ago. But I caught him pretending to take his meds. He would cock his head back and gesture that the pill went into his mouth, but really he either kept it in his hand or threw the pill behind his back and landed somewhere in his bed. He was also quite a talker. Which I then assumed was a tactic to try and distract me. I kept seeing his odd behavior and caught him doing this 2-3 times by the middle of the shift, so I was definitely onto him. He had a PICC line, which is essentially a long IV where the tubing goes all the way to your heart, in his left arm. And I noticed that it was quite a bit more swollen compared to his other arm. Sometimes clots can happen in PICC lines. So that was my biggest concern at first. But the line was drawing blood fine, so I know it wasn't clotted off. Told the doc. Then I drew blood from his PICC line and sent it down to the lab for it to be cultured to see if there was any bacteria. Lo and behold, it came back positive for a bacteria that is commonly found in tap water and usually not a source of infection in infected PICC lines. Fast forward a few hours later, he confessed that with any oral medication, pill form, he can slip by the nurses. He saved for later in order to crush them up himself. Try to dissolve it with sink water in the bathroom. Every room had a private bathroom. And inject it in himself via his PICC line. What the duck? Why? Why would that be any better than swallowing the damn meds? Having once seen a commercial that oatmeal can lower cholesterol, a patient started having chest pains and tried to resolve it with a bowl of oatmeal. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed. So this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. Yep. I had a crack addict cut her thumb on her broken crack pipe. The thumb was incredibly infected. She grew tired waiting for the hand surgeon to arrive. He was in the operating room with another patient. so she bit her finger to release the pus. Then she left the hospital, cursing the staff the whole time because we are useless, etc. As a child I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal, and sent me back out into the sun. I realized when I was older why my mum went nuts. I have a Jamie Oliver recipe that directs me to do the same thing midway through roasting a chicken. The secret is in the baby oil. Makes it taste like a real baby. My mom once melted Vicks Vapor Rub into my tea because she thought that would help my cold. It didn't. I know people who would do this. More than one of them. They'd swear by Vicks Vapor Rub, and kind of treated it like a cure-all. My dad, more than once, ate a tablespoon of Vicks when he had a cold. Neighbor came over to borrow a chainsaw. I noticed he had a thick bandage around his arm and asked him what happened. He said he fell out of a tree last week and cut his arm. I asked if he got stitches and he said he just wrapped it and his family is praying over it. About 4 days later I seen his wife and she said he was really sick and may have the flu. Come to find out he had septicemia and dying. He died a week later of kidney failure and sepsis. I was getting a kick out of all the stories on here, but this one is just sad. Putting a sex toy up the rectum to better reach another, larger sex toy. I just read the other day about a dude who got a dildo stuck up there and then got the kitchen tongs he was using to extract said dildo stuck up there too. Not sure if this is serious or just tongue in cheek. Patient used to get boners in class and it embarrassed him so he used rubber bands to prevent it. Ended up killing the tissue in his penis and now he needs a catheter for life. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that as surgeons use staples to close wounds, he'd cut out the trip to hospital and DIY with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. I am not a medical professional, but my father-in-law had severe skin cancer. He basically had an open sore on his back for several years that bled and bled. We never knew about it until one day we saw a pancake-sized crater through his shirt. Went to the hospital finally and they basically said he has cancer throughout his whole body at this point. His response was he thought it was a cut that wouldn't heal and put gauze and neosporin on it. Edit. Since folks are curious, yes he is still alive but they didn't give him much time left. They managed to treat the wound but the cancer spread into his organs and bones. The sad part is it could have been avoided if he just went to the doctor years prior. But that is unfortunately the common mindset in a lot of older folks. God, that's terrible. I've found that sort of attitude is common among older people though, where they sort of shrug and get on with it. When my granddad was young he fell and dislocated his shoulder. He decided to just pop it back in himself and forget about it. It's never properly healed and still causes him pain so many years later. A friend of mine had a similar situation. Went over a year with a sore on his foot that wouldn't heal. GF finally talked him into seeing a doctor, found out he was diabetic. In severe ketoacidosis, I'm sure I spelled that wrong, and ended up in the hospital for several months and lost his leg, above the knee. He's also looking at a possible kidney transplant if he can follow the compliance diet, which he doesn't like. Vegetables are gross. He's in his early 40s. White bread soaked in milk placed on an armpit abscess to draw out the infection. Needed an IND and a couple weeks of IV antibiotics by the time he got to us. Either that or the guy who crashed his motorbike. Scraped his leg all to hell. And then decided the best course of action was to self-cauterize it on the tailpipe. Bro. Stupid or not. The tailpipe guy had a set of brass ones. Then decided the best course of action was to self-cauterize it on the tailpipe. When I worked in ER, my colleague had to see a guy with an ear problem. He had something stuck in his ear and had been trying to get it out. This wasn't a new thing. He'd been trying for some time. Turned out, he had completely removed his tympanic membrane. And the bits that were stuck in his ear and that he was trying to pick out with cotton buds and hair clips were his ossicles. Enjoy. I have consistent skin irritation in my ears and try and limit myself to sticking cotton buds in my ears to 4 times a week for relief. Thank you. You've cured me of this vice. And I'm setting myself on fire. Good day. I sent this story to my dad, who is an ent. He responded with this story. Today I saw a guy whose dog bit off the top 1/4 of his ear. He brought in the piece that the dog tore off. I rinsed it with peroxide and sewed it back on. The fun never ends. God bless medical professionals. I could never do it. Had a patient come into the ER with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, 1/2-inch deep gash in his leg. I go to pull the bandage off, and as I'm peeling it away I notice the skin is completely black and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud and stuffing it into his leg. That's what all the black mossy stuff was. Hint: don't do this. Was it bleeding when he came in? Checkmate. Yeah. I wanna know the answer to this as well. And why chew it all up? Why not just mush it with your fingers? Seems like taking bacteria from your mouth to your wound is not a great idea. Not that any of this is a good idea. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try to even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms was a pinched nerve, so he would take me to the chiropractor, his girlfriend, to get my neck cracked when it happened. Seizures. People. They were seizures. Black beans are delicious and make a beautiful blue dye. That's useful enough for me. I'm hoping you get actual medical care now. Princess Alexandra Amalie of Bavaria, 1826-1875, believed she had accidentally eaten a grand piano made of glass, and was afraid it would break inside of her. Thanks for watching. Subscribe for 3 videos a day. Redditors in healthcare, what is something you never thought you would have to tell another grown but human? Number: I cannot tell the race of your baby on ultrasound. You'll have to wait until birth to have an awkward conversation with one of your boyfriends. Pretty frequently have to explain to patients that they can't have metal on their bodies during an MRI, even if the jewelry whatever is on a different part of their body than what is being imaged. But I'm only getting an MRI of my foot. Why do I have to take my earrings out? Because the magnet affects the entire room, and it will rip your earrings out and throw them around the room. Also, people who have pacemakers who are peed off when we don't let them have an MRI, because they think it won't be any big deal. Sorry, I know you really want the best possible imaging for your back pain, but we really don't want to kill you to get it. Really, doctors need to be screening their patients for things like that before scheduling them for an MRI. But you'd be shocked how much it happens. I know you are trying to help, but you don't do CPR on someone who is actively telling you to stop between compressions. Shut up, I'm trying to save your life. Why showering regularly is important. I am a home health physical therapist. It wasn't till I started using Reddit that I discovered just how many people don't realize you have to wash your butt. The water trucking down during the shower isn't enough. Paramedic here. I had a PT once who was complaining of being unable to sleep. He's telling me all these different things he's been trying in order to sleep. You know, basic things like counting backward, counting sheep, melatonin, NyQuil, Benadryl, Zquil, warm milk, alcohol, weed, and This has been going on for about 2 weeks. Wait a minute, So I proceed to ask how long they've been on I started like 2 weeks ago when my GF showed me. At this point I thought this 47-year-old man would catch on. But nope. Not even a flicker of a light bulb. So I say to him, you realize M can cause insomnia? It was as though I removed a bottle of stupid juice he was drinking and opened up a can of Acme knowledge, because he responded, oh my god, that makes so much sense. Cause I was even smoking M to try and sleep. Yeah, this productive member of society went straight to the waiting room. Yes, you smoking in your house is likely making your kids' asthma worse. My mother-in-law went off on me for giving my 12-year-old brother-in-law ice cream after dark, but he has asthma. You'll give him an attack. Cut to 5 minutes later, we're all in the living room and 2 people are smoking. Yes, it's the ice cream. Don't hide bottles of 5-hour energy in your bag. My PT came in with a complaint of vaginal foreign body. Doc goes in to do the pelvic exam. Pulls out an opened, sealed bottle of 5-hour energy. Cue her explanation of hiding it from her spouse because he doesn't like for her to drink energy drinks. Then she asks for it back so she can drink it. It's not a pocket. Don't douche with bleach. Patient had mixed bleach, fabric softener, Dawn dish soap, vinegar, and some water, just in case, and burned the bejesus out of herself after having a baby 3 weeks prior because she was convinced people could smell her. She douched with it multiple times and came in when the burning toned down, sent off to gynecological surgeon and never seen again. Intercourse makes babies. Okay, so maybe not as succinct. You would be shocked at the number of calls related to abdominal pain turn out to be pregnancy even after asking the patient if there is any chance they are pregnant and they answer number. Older man, terminally ill, New Year's Eve, presented to the ER in the company of an escort. He had a finishing nail in his erect dong. He was into penile sounding. He says, well, there was nothing else laying round, and I'm so freaked up and can't feel a thing.